Welcome to Cool Springs Plastic Surgery 4th Annual Open House. We're coming at you virtual again, but that's exciting. We can't wait for all of this stuff happening.
We've got a lot of amazing things today. This has been an incredible event that we put on. We've got over 2,000 people who have registered for this event today, which is incredible. Everybody watching at home, thank you so much for partaking. We've got kind of an empty studio audience here today, which is a little bit kind of weird to be talking to everyone, but we know you're out there listening. So lots of amazing things. We've got live demonstrations. We've got video demonstrations. We have surgical panels. We have OR tours. We've got so much cool stuff, right, Angel?
Great stuff. It's going to be awesome. But first, let me introduce you to this guy. He's joining me this year on this open house, and this is Dr. Conrad Soroshik, one of the plastic surgeons here at Cool Springs Plastic Surgery. He's been with us for 4 years. Great before and afters that you're going to get to see in a little while that he has done and that we do here at the practice. And then also, great job body shaping.
Listen, thank you, Angel. I appreciate that. I'm going to brag a little bit about Angel. Angel here has been with our practice for about 7 years. Angel also, if you remember, if some of you who watched the open house last year, remember that Angel actually hosted the open house last year. She did such an awesome job that I felt like I had to be next to her to help her.
Now I have help. Thank you.
It's going to be an amazing show we got for you guys today.
Yeah.
Angel also, if you've ever come into our office for a treatment, Botox filler, or a surgical consultation, you might have run into Angel at our front desk. She's incredibly pleasant, very fun to interact with, and has an incredibly amazing laugh that we've all come to love. So thank you all for watching. We're excited, right?
Yes, it's going to be great. So let me talk to you a little bit about our different specials first. Let's talk about our specials. So we have our gold, our platinum, our gold, our silver, and our bronze packages. And then we also have our Luscious lips package. We do great lips here. And then we have our Botox and Dysport packages. And that remember that Botox and Dysport is girl's best friend. And then we also have our 20% off on skincare.
Yes, very important. You can get access to all of those specials on our website. Our website is csps.me, or you can click on the link below in this actual feed to get access to all that if you wanted to ahead of time. All that stuff does expire. I believe it expires on Friday.
That's right. But you know, you can call our office also, 615-771-7718. One phone number for all locations. They can help you. And then absolutely, our specials are through by tomorrow. So make sure you're calling us before tomorrow, or you're shopping, clicking the link that I think is down below us. Make sure that you're clicking that and finding out some information.
Perfect.
So, about our schedule.
Let's talk about our schedule.
Okay, we've got so many things happening. We're going to talk about injectables to start with, our Botox, our Dysport, a different combination treatments. We're going to have aesthetic presentations. There's going to be some lasers, microneedling, different things. And then we're also going to go on into the day where you get to talk about your favorite place.
Yes, so we're actually, again, going to give everybody an opportunity to see what it's like to be a patient at Cool Springs Plastic Surgery and scheduling to undergo an operation. Go through the process of the preoperative part, the actual, we're going to show you our ORs. We're also going to show you the recovery room, and then give you a little tour of our clinic to show you what it's like in the recovery process as you undergo the postoperative care. So we're super excited to share that with you today. We're going to have some amazing surgical panels where we're going to be focusing on various aspects of surgery and cosmetic surgery.
Right.
We also have a pretty special panel set up at the very end looking at combining various modalities to treat the aging face. Things like not only surgery, but also Botox, filler, and using advanced skin care, lasers, etc., combining different treatments. So very exciting. We're super pumped.
Right. It's going to be such great information. You will learn so many things. Stay with us. So, we're about ready.
What about the end of the day, though? What happens at the very end?
Oh, my goodness. Great giveaways. We're going to have if you've entered into any of the drawings, we will have our drawings at the end of the day. Hopefully, you will win. All of you. I want you all to win. But I can't wait for us to get started.
All right, so without further ado, we're going to start with
Chrissy. Our nurse injector is going to come on in a minute. She's going to talk about combination treatments. Stay with us.
We'll be right back.
so this patient came in and just wanted a little bit of a refresh. But if you can see in her before pictures, her skin was starting to age a little bit, where you can see some of the superficial lines and textures. So we did a resurfacing laser called Halo. And we also restored some volume loss in her temples and in her cheeks and under her eyes. We did a little bit of Botox around her eyes and between her brows. So by doing that, you can see where her lid got a little bit of a lift, and that's also part of the improvement from restoring the volume in her temples. So,
these are some amazing pictures, Chrissy.
Absolutely.
It's amazing. So tell us the benefit of combining treatments.
yeah, so I think a lot of times people forget about the skin when we're doing
Good point.
rejuvenating treatment. So for her, we really targeted the skin first, and so everything we did afterwards looked better.
Yeah.
Chrissy, I will say that, you know, when looking at this picture here on everyone's left side, you see a lot of hollowing right underneath here. You see this divot forming here. You see a lot of these very fine lines, especially out here. These lines out here for folks at home are called the crow's feet, and they're kind of the smile lines that kind of make us look older as we all get older. So you seem to have treated that incredibly well. It looks like the cheek volume here is much larger, much more full, and that cheek volume almost looks like it lifts all of this up, right?
Exactly, it does. Yeah, we actually, in this after picture, really didn't put any product here, but just by restoring her mid-face, we restored that structural support to that tissue, and it just looks better.
And you can tell that the resurfacing part, especially using a halo, which is a wonderful tool, allows us to kind of smooth some of the skin, help kind of eliminate some of the very fine lines, and help kind of provide a much more of a unique, kind of a flatter, more smoother look.
Yeah.
So, Chrissy, tell me, do all of your patients get a plan like this, a treatment plan,
Yeah.
first of all? And what if you give them a plan and they're like, okay, but my budget is here?
That's a really good question. Actually, in this next slide, you can see this is a patient of mine who we created a treatment plan, and she's partially done, or we partially completed it. So in her before picture, we created a full treatment plan, and in her after picture, we're about halfway through it. So she's had Botox around her eyes and between her brows, a little bit on her forehead, and then same thing, we restored the volume in her mid-face, which helped kind of lift her lower face just a little bit and improve under her eyes.
So real quick, Chrissy, I don't want to interrupt you, but when we refer to the mid-face on any of our patients, we're referring to this area right here along the cheekbone. This is the mid-face area. The lower face encompasses this area down here. So what Chrissy's kind of describing is how putting a little bit of volume up here can kind of help lift and elevate that part, right, Chrissy?
Exactly. So we started there, like you said, in the mid-face, and that helped us some in the lower face so that we can use less product and be sure to keep her proportions balanced and not volumize her lower face, which happens with time.
So it looks like you're on a good plan for her. She's made some great additions to her treatment, and so she has more to come. Yep. Tell me this, do most people want to use multiple types of injections?
You know, usually people come in and they complain of a symptom. So for her, she just wanted a refresh but didn't really know what. So we created a full treatment plan going over all the treatments that would benefit her and kind of how we would do it. And here we're partially through that. Next we will do Kybella and contour her lower face, a little bit of resurfacing with Halo as well. But
right.
Great result, Chrissy.
Yeah.
That's a great plan. It's nice that you kind of broke it up, that it's not just, sometimes folks come into a plastic surgery office and say, look, I've got this one thing, and they just want to treat that one aspect of the face. And it's nice to be able to kind of look at someone and say, look, there's a couple other things that if you did would be a dramatic change rather than just an isolated one little thing change. So that's a great way to approach a patient. So let's look at patient number 3.
yeah, so she's actually a good example of someone, like you asked Angel, patients usually ask for more than one product. Well, in her case, she just came in and complained of dark circles under her eyes. And then after we talked, we decided that we would restore the mid-face first, and then we put a tiny little bit of product under her eyes so that, again, we didn't distort her proportions or her side profile.
Right. That's an excellent before and after, I agree.
I love this one, too, because we restored her mid-face and did nothing to her lower face, but you can see the subtle changes in her lower face just by restoring the mid-face and lifting that a little bit.
And you get this nice fullness here, creating that kind of a concavity, a little bit of a shadow there, just to giving her that more youthful, that more glamorous look. It's a great job,
Beautiful, yes.
And so do people usually treat a combination in that way, tear troughs and other things?
Yeah, it's really rare for me to ever just treat the tear troughs by themselves and put filler under the eyes without restoring the mid-face. So usually we can use less product, like I said, under the eyes if we do the volume restoration first.
So let's look at that next patient.
So she's one of my favorites. She is a young, beautiful patient to begin with, but just wanted to enhance her beauty. So, like I said, she was beautiful before, but just wanted to enhance that. So she started out with just wanting lips. So we did that, gave her a really nice, natural result, a little bit of fullness, but kept it balanced to the other proportions in her face. And then we did a little bit of filler in her cheeks because she didn't like under her eyes again. So then we did cheeks and a little bit under her eyes. We've also done a tiny little bit of Botox too. So.
That is such great information. So I want everyone to know out there that Chrissy is at our Franklin location. So if you call in, if you want to schedule something with her, 615-771-7718. And remember, our packages would benefit you for these multiple treatment procedures. There's many options you can choose from. And then also, coming up next at the Franklin location, there is, Teresa and Olivia are going to be talking about our girl's best friend, our Botox and Dysport. Awesome treatment procedures. And so stay tuned. That will be coming up next.
back with the next segment of our show this afternoon. I did want to take one quick pause and just let everyone know that this is an extra special year for us. This year here at Cool Springs Plastic Surgery marks the 25th year anniversary of this incredible practice. Dr. John Moore and Sherry Moore started this practice 25 years ago with a small office down in Cool Springs. That practice over that time has grown to encompass multiple surgeons, multiple providers, multiple locations. We've continued to grow following the methodology and the wisdom that the two of them have bestowed upon all of us. So we are so grateful for the special occasion and a special year that this truly has come out to be for us this year. So thank you to them. Thank you for all of us to being here today, and thank you for all of you at home for watching this fun show. And hopefully you're all going to come away learning a little bit of something about Botox and Dysport over the next segment. So without further ado, I'm going to turn it over to Olivia and Teresa. Olivia is one of our nurse injectors. She works currently out of the Mount Juliet office, also does a little bit of injecting here at the Brentwood office. And Teresa works out of our Music Row office down in near Vanderbilt downtown. So without further ado, I'm going to turn it over to them.
Hi everyone, I'm Teresa. I'm the nurse injector at our Music Row location.
And my name is Olivia Gibson. I'm one of the
appointments for patients who come in for Botox, fillers, or injectables. We have injected over 300,000 units of Botox and Dysport in the past year, making us one of the elite providers of non-surgical injectables in this area. So that's a clap for all of our providers who do an exceptional job taking care of our amazing patients. Without further ado, let's cut it away to Olivia and Teresa.
Hi everyone, I'm Teresa. I'm the nurse injector at our Music Row location.
And my name is Olivia Gibson. I'm one of the nurse injectors at the Mount Juliet office. Teresa and I are here today to talk through what a consult and treatment look like with Botox and Dysport.
So we are each going to consult with a patient today. We have a male and a female patient. We will come up with a treatment plan and go ahead and inject them.
Botox and Dysport are neurotoxins that relax the facial muscles and reduce the appearance of fine lines and wrinkles. Typically takes about 2 weeks for Botox and Dysport to kick in. So Teresa, do you want to tell us what today is?
Today is exactly 2 weeks before our open house, so we'll be able to see the full effect of the treatments that we do today.
All right, let's get started. So why don't you look in the mirror and tell me where you would like to treat today, Angela?
So forehead would be great, and I mean, all over would be great, but I mean, I know there's areas. What would you recommend first?
Yeah, absolutely. Okay, so the forehead, I see all of these lines in your forehead. Mm-hmm. So those are created by raising of your brow with your frontalis muscle. It's a flat muscle on your forehead. The frontalis muscle lifts your brow, so when we inject Botox, it will relax it down. Mm-hmm. So if I were only to treat this frontalis muscle, you would feel pretty heavy here. Mm-hmm. So we'll definitely treat this group of muscles here called the glabella. Can you frown for me? Make a mean face. Yeah. Okay, so you can even see your muscles here, your corrugators pull in. So we'll treat those two, and then smile really big for me. So you've got a bunch of great smile lines around your eyes. We'll soften those with some Botox today. The thing with you have like static lines, meaning at rest you still have some lines in your face. So it may not be one treatment to kind of cure it all and get rid of those lines. If you were to stay on top of your Botox treatment, like do it every 3 to 4 months, then maybe after a year we could soften those lines and maybe make them go away completely. One treatment will soften it and you should see a result. The other thing with you is you are using your frontalis muscle just at rest. You're kind of lifting your brows up because you have a little excess hooding on your upper lids. So you would love an upper blepharoplasty at some point in life.
That would be ideal.
But
on the list.
In the meantime, what I want to do is not treat your frontalis muscle too much because you're just not going to like that. You're going to feel very heavy and you use that muscle all the time to raise your eyebrows up. So we'll just be gentle there and try to treat well around your crow's feet, because sometimes this muscle that wraps around your eye, the orbicularis oris muscle, it's a sphincter muscle that kind of squeezes in. So when we inject Botox there, hopefully it will relax up and out.
Nice.
And we could get a little bit of a brow lift with you, which, you know, is always a plus.
Great.
So what I'll do is I'll feel your muscles and I will mark you, and then I'll go get it drawn up. Okay?
Great, thank you.
Awesome. Yeah, you've got some strong muscles over here, and relax and raise up again. Perfect, and relax. All right, I will go get that drawn up, and I'll be right back. Okay.
Thanks.
Round for me again, and relax. Okay. Perfect, great job. Round again for me, and relax. 1, 2, 3. And round again, and relax. Good job. So if you had had a glass of wine the night before, or taken like Motrin or Advil or anything, you may bruise, but you really shouldn't with Botox. These can sometimes make a little crunchy sound. Good job, Angela. You did amazing. See you back in about 2 weeks.
Okay.
These little blebs on your face will go away in like 15-30 minutes. You can put makeup on in about an hour or so if you needed to. Rules for after, so you don't want to lay flat for about 4 hours. It takes about 4 hours for Botox to bind to the muscle. So don't exercise the rest of the day. Don't lay flat for the next 4 hours. Don't wear like a hat or any constrictive band. Pretty much I want it to go where I put it, and not anywhere else. Okay.
Okay, great.
All right. Thank you so much. You're a great model.
Oh, thank
you. So have you had Botox before?
Yes, but it's been quite some time.
Okay. So what areas do you usually do?
Forehead, crow's feet, my little bunnies sometimes,
right
and my 11s.
Okay, perfect. So, Botox works, of course, by relaxing those muscles that make the deep lines here, that pull your brow down, that make the crow's feet, and that make your bunny nose. So we'll relax all those muscles today by putting some Botox in there. Botox doesn't work today. It takes about 5, 7, 10 days before you see that full effect of your treatment. So on a man, the muscles are just stronger. So you've got a very strong muscle through here. Frown for us. Yeah. So typically men need a good bit more Botox than women do. But just to relax those muscles a little bit more. You don't ever also want to put too much in their forehead, because those are the lifter muscles. And if they can't lift at all, their brow gets mighty heavy. A man's brows sit lower than a woman's do anyway. You don't want to feminize them by elevating too much and making them look unusual. So anyway, we're going to get going on that right now. Okay, so just rest your head back there. I'm going to clean you off a little bit. Your only restrictions today will be to stay upright for about 4 or 5 hours. You don't want to bend over like this, because who knows where that Botox is going at that point. And don't do anything bouncy either. We don't want anything to come down to your upper lid. That's the muscle that opens the eye, so don't want anything to go there, okay?
All right.
So that's really the only restrictions, and that's just for today. Tomorrow you can do whatever you want to do, okay? Awesome. So let's get going here. Okay, and relax that. We'll make this a stick right here. Is this okay? And the same on the other side. Good. Now frown again. Relax that. And you go above this eyebrow. Sometimes that one hurts me a little bit, which means this one will too. Frown again. Relax. Brows really high. Relax that. I'm going to start in the middle here and work my way up. One more raise. Okay, good. Good. Now, raise your eyebrows again. Relax that. Way over here. One more raise. Or actually a couple. Okay. And one more time. Good. Relax. Right there. That's little small amounts up in your forehead, so we'll get those to just by spritzing around, hopefully get those lines evenly relaxed. Let's do some bunny nose, okay?
All right.
So, scrunch your nose up. Perfect, relax that. Right here. And perfect, relax. Right there. Good deal. You also want to rub up today, okay? Just rub away from that eye.
Okay.
And let's do some crows. Again, relax. There. Again. Okay, good. There. And lastly, perfect, relax. Right there. Good deal. All right, so that's that. Let's get you cleaned off a little bit.
Barely even feel it.
Good.
And we're back, and I hope you enjoyed that video as much as we did, and we want to talk about all the results that we're going to see here in just a second. I'm especially excited to see the male patient because a lot of folks think that Botox is only for women, and that's not always the case. Men also need a little Botox in their life. So before we get started, I do want to introduce our two ladies here. We have Teresa Safford over here on my left, or your left as well. Teresa has been in the aesthetics world for over 20 years. Teresa has worked in the operating room. She's directed an OR. She's worked in the clinic, in the plastic surgery clinic. She's also been doing injecting. I bet everybody out there, Teresa, probably even knows who you are because you have so much experience out there. So we're super excited to have you, and you're an incredible injector, and we're very grateful to have you aboard. And she works out of our Music Row office. And then on the end over here, we have Olivia, last but not least. Olivia has been with our practice for since 2018. Olivia started working in our clinic to understand how the face works, how the muscles in the face work. She took that knowledge and applied it to injectables and now has become this incredibly gifted, artistic injector that I've actually let inject my face. So I am super proud of that, and I'm super proud of you for everything that you've done. So without further ado, we're going to get the show started. So let's talk, Olivia, we'll talk first about your patient. So tell us about this lovely patient.
Yes. Okay. So this sweet lady came in just wanting, a refreshed, that's what everyone wants, a refreshed, natural look. She was an interesting patient because she wanted to treat the lines in her forehead, but her brow and her upper lids are just a little low, so we had to really dose that pretty lightly. But we were able to give her a good lateral lift in her brow to kind of elevate and then soften the lines around her eyes and in between her brows. And she got a great result. So,
Olivia, I want to bring something up real quick because I think that's an incredibly important point to hit upon, which is what you just mentioned. That sometimes if you don't treat lighter for folks like this, for instance, you can cause for their brows to drop, and then it can make the hooding over their eyelids look much worse.
Right. Right. So she had, static lines or lines that are deep and they're still there when she's not animating. And we talked about that beforehand, that she may not be able to get rid of those lines completely. A lot of times you need multiple treatments. You need to come in every 3 to 4 months, stay on top of it to really get that smooth appearance, especially if you have the static lines.
Right, and so you can see a great difference though, even though you didn't do heavy in the forehead, there's still some softening of those lines.
Absolutely.
So tell me, Olivia, how are you going to deal with a patient that's going to be scared or nervous?
Just take deep breaths, walk through it. It's small little insulin needles, so less than a bee sting. It's very quick. Normally we get done and they're like, is that it? And that's the goal. And then they, move on with their day.
Yes. And then also talk to us. We get a lot of questions on the phone. Y'all know I'm on the phone. Also, if you have any questions out there, you can type them in on your screen and ask us any questions. But tell me about the safety of Botox.
Oh, very safe. It's been around for 20 years, FDA approved. We've, obviously been doing it for a long time. They actually use Botox with like cerebral palsy and babies. We're doing more cosmetic cases here, obviously, but a very safe and effective drug.
Right, very safe. That's great for all of our patients to know. We're not going to do something that's going to hurt you. It's not going to hurt you.
So Teresa, let's turn to you. Let's talk about your patient that you injected. So tell us about your injections and what we've accomplished.
Yes, for a male, it's just a different story. They're a different breed. Muscles are stronger. Muscles are stronger. They, I still do the same pattern as I would in a female. He wanted to get rid of some of the forehead lines, which I think we accomplished nicely. He also has some of the static lines, Olivia, that you mentioned. but they're much softer. He's maybe not raising quite as high as he was before, but he can be surprised. He can have an expression.
You know, Teresa,
that's what it's all about.
That's a very good question, and I think that's something that, you know, for instance, Olivia, when I came to you asking about that, as a male, I don't want to make my face be completely flat, be completely smooth, and not be able to show the ability to animate my face.
Right.
You still want to retain some movement of the muscle, but you want to get rid of some of the coarse lines that you find, especially crow's feet out here around the outside of the eye, and especially over here around that glabella. So tell us about your approach to that. How do you dose differently?
Yes.
Tell us about that.
Use a larger amount of Botox. Men just simply take a larger amount of Botox. Same pattern, you're putting it in the same place. A lot of men will come in though, and all they're concerned about are the forehead lines. They don't care about this little frown that they have. This is what they want gone. Well, these are the lifter muscles, and you can't simply dose there or they will be unable to raise
It's a
their
great
forehead.
visible that you just did.
Yeah, look,
They-
Teresa,
oh,
look
well,
at
there
that.
you go.
Look
Okay.
at
Oh,
this.
that's good.
Yes.
Love it.
So that's him frowning, obviously, in the before, and you can see he can still be concerned,
Yes.
which is the hugest thing. You don't want to tell someone some horrible story and they just, you know, they can't.
They can't
express.
right.
Yes.
Yes.
So I think that's beautiful. He's definitely still got expression.
So for a lot of folks out there who we are, you know, with COVID over the last couple of years, we're all wearing masks, and those masks cover up our faces. And then by not being able to express yourself, your patients or people around you might not know if you're laughing at their joke or not laughing at their
If you
joke.
have no expression.
Right. So that's important. So you did a fantastic job.
He's thrilled.
I wanted to just ask y'all maybe both a question. You know, Botox is a term that's used a lot. Botox is just one type of, you know, neurotoxin that we have available to us. Dysport is another. Talk to us about the two neurotoxins and maybe talk about your experience with them. Is one better than the other? Tell us about that.
I have for many years, well, when Dysport came out, they're both botulinum toxins. They're just made from a different protein. Same action, they're making the muscle not move. And over years, sometimes people can become acclimated to one a little bit more than the other, and we may want to switch at that point. I have, rightly or wrongly, many times called it Betty Crocker and Duncan Hines. I mean, they're both toxins. They're both going to do the same thing, and it's just really a patient preference.
Right.
Very, very individualized.
Krispy Kreme and Dunkin' Donuts.
There you
There
go.
you are. Those are really
Same thing. Both really,
Really
good
good.
donuts.
They
but
are.
sometimes you just get a craving for something else.
else.
So, and we've seen that. We've seen that happen to folks. That they build up a little bit of an acclimation. It's a great word that you used earlier. And at that point, that might be a good opportunity to switch and try something different. But folks need not be afraid that, oh, well, I didn't get Botox, I got Dysport, or I got Dysport, I didn't get Botox. So that's
So
a
I
great
have
point.
some questions coming in from some of the viewers out there. And so somebody asked, what if I didn't know the areas that I needed to treat? How are you going to deal with that?
I think we probably both would hand them a mirror, sit down in consultation and say, tell me what bothers you. Because I might look at them and say, oh, we want to go here, you know, and that's not what they're concerned about, you know, or whatever. So I'll just hand the mirror. What's bothering you? What brought you here today? What do you want to make look better?
Olivia, is that the same approach for a new patient coming in to see you, for instance? Is that how you approach
Absolutely.
them as well?
Yeah, I hand them a mirror and then we look together, and I'll comment on things I see and
Yes.
something that maybe can help them that maybe they haven't noticed or it can work in conjunction with the area that they're concerned about. But absolutely, it's a group effort. We're a team, and we're going to give you the best results
right.
together.
Right.
Another quick question. So patient comes in, they get a treatment, and they're like, wait, they're walking out, checking out, and they're like, I'm still moving my face. How long does this stuff take to kick in?
Great question.
When should the patient be looking for an actual result? When does that happen?
About 5 to 7 days is normal, time of kicking in of the Botox or Dysport. Dysport maybe is a little sooner, but 2 weeks is full effect. And so at that 2 week mark, we always like to see patients back in so we can, check, make sure everything looks good, add more if we need to, and correct anything and just see how beautiful you look.
Are there restrictions that y'all put patients on after the procedure,
Great
after the
question.
treatment?
We do. Ask them to stay upright for 4 or 5 hours. The muscle that opens your eyelid sits right in here, and so it's important that nothing gets rubbed down toward that. I ask them not to bounce, not to work out that day, because you certainly don't want any complications. The only thing I really worry about, probably mostly, is a bruise, but the bigger complications would be a drooping eyelid or a heavy forehead, which is why you don't dose too much. Like on your your patient, you watch this forehead amount and just ask them to stay upright. Don't bend over for a few hours.
And then they're good
And
to
then
go.
they're good to go till that 5, 7, 10-day mark when their Botox kicks in.
Right.
And they look in the mirror and they become happy.
And they can exercise and do all their
everything
things.
the next
All-
day.
The next day.
The next day.
Well, tell me this. So we've had a question. Somebody asked, how can I make sure that I'm going to get Botox and still look natural?
Natural is what it's all about.
Yeah, I think that's name of the game.
yeah.
Refresh, natural,
Great.
relaxed.
Great.
There are many people, young girls, I think some of the really younger girls who they don't want their forehead to move at all. And I try to dissuade them a little bit from that. I want just them to be able to be surprised. You've got to be able to do that a little, but they'll look natural.
Right. Well, that was such a great and informative presentation. Thank you both so much. You're excellent nurse injectors. Remember, Teresa is at our Music Row location. Olivia is at our Brentwood and our Mount Juliet location. If you're wanting to schedule a consult or talk with one of them about Botox or Dysport or any of our injectors, you can call in at our office, 615-771-7718. And remember, we have one number for all of our locations, so call in and we can help you schedule for all locations.
Just make sure you specify which location you would like your appointment
Exactly.
for.
And our people on the phone are really good about asking that. Who you'd like to see, what location you'd like to go to, how soon we can get you in. We're working really hard to make sure you can get in to see them and making sure that they're busy, which we love that for them and for y'all to get what you want.
So Angel,
Yep.
in terms of folks at home who are considering Botox, we have some specials going on right now.
That's right. Let's talk about the specials. Thank you so much. We do have specific Botox and Dysport specials. If that's all you're going to do in our office, that might be an option for you. You could call in, you could click on the link below to do the shopping, and that will have the specific Botox and Dysport. Their pricing is different, so that pricing is different for the Botox special and the Dysport special. You're still getting the same amount of product, it's just priced differently. It's very interesting. But anybody can talk you through that on the phone, or you can click that link and shop. Also, if you're wanting to get your Botox for the year, you can buy one of the gold or the silver or the platinum packages. Bronze also is available. So some people are doing that. They're buying that package. They have that money sitting in their account. They can come in and see us. They don't have to worry about getting their little credit card out to pay us every time because their money is sitting in their account. So click the link to shop. Call our office, or is there any other way for you to purchase with us? Click the link, call the office, or you can go onto our website. You can schedule your own appointment. We love our online scheduling. That's also available.
And for all those of you out there who have a husband who potentially has some pretty significant lines on the outside of their eyes, some very significant frown lines here in the middle, feel free. Give us a call, potentially schedule them an appointment, and just see how much youthfulness that will bring back to their face just undergoing a simple procedure. And as a male myself, I can attest to the fact of what Olivia mentioned earlier. There is no pain. I mean, virtually, you literally don't even feel it. Sometimes you're like, wait, did you really just inject it? The needle is super tiny. It doesn't even feel like a bee sting. So hats off to both of y'all. Great, incredible results. Thank you for sharing all that amazing knowledge with us today. And thank you all at home for watching. We're very excited. What's coming up next, Angel?
Coming up next, we get to see Emily Finley, and she's going to talk about some fillers, which is a step up from Botox, if you want to call it that. But she'll have a presentation for us, so stay with us. we're back. Now, we just had a very informative conversation with a couple of our nurse injectors about Botox and Dysport. If you missed it, remember you can rewind and watch it again, very informative. And then also, just know this little fun little jar means there's going to be a prize. So I'm going to reach my hand. This was everyone who registered for the event. And I'm going to reach in here and we're giving away a Botox treatment, which is awesome. Remember, a girl's best friend. So Donna C., you have won a Botox treatment. We will contact you and let you know that you won. That's very exciting. We love to give away things. So also now we're fixing to watch Emily Finley. She's one of our nurse injectors here at our Brentwood location. Emily has been at the practice for 7 years. She is a certified nursing esthetician injector. Whew, so many words, CNA. So she's very knowledgeable, does a great job. Her patients love her like all of our patients do. So enjoy the video. Emily, take it away.
Hey guys, I'm Emily. I'm one of the injectors here at the Brentwood location of Cool Springs Plastic Surgery, and we're so excited that y'all have joined us for our open house today. I'm going to be injecting Jawline today. We have never had a male model, so we're so excited that Zachary has offered to be our injection model. We are going to be squaring off his jawline and just kind of defining it a little bit more. The jawline is kind of a big, a lot of people come in requesting that procedure. And when we are assessing the patient, depending on male versus female, it depends. We have to inject differently. With males, we tend to want to square off their face a little bit more, and that's what we're going to be doing with Zachary this morning. And with females, you're really wanting more of the definition underneath the jawline. We want to keep female faces as heart-shaped and tapered as possible, so we don't want to widen their jawline or make them look more square. So we're going to be using a couple of different products today, and we're going to be using several different syringes. Jawline tends to take more product than other areas. So if you're considering this treatment, this would be a perfect opportunity to take advantage of one of our packages where, you know, you can cover the entire treatment for less expense. So with this treatment, we tend to inject in several different areas and with a few different techniques. I'm going to be using a needle for this back corner of the mandible. And we're going to kind of try to pull it out a little bit so that we can get that nice square definition. Doing okay? Mm-hmm. So with the definition on this corner, we tend to, that area can actually take quite a bit of volume. So that's why you kind of want to inject a slower and with a little bit more caution. So we're going to come in and define his chin a little bit, and we're going to be using a cannula. Cannula is basically like a blunt tip needle. It reduces the risk for bruising, and it reduces the risk for getting into a vessel. So we're going to be doing a question and answer after this, and please submit any questions, comments that you may have. Unfortunately, the product that we're using is very flexible, and so we can go in and kind of shape it how we want it to, and it will settle exactly where we want it to. Doing okay?
Mm-hmm.
Males tend to take a little bit more product than females, again, because we're trying to build out the shape of the jawline versus just defining the contours with a female. So you can kind of see this nice crisp border that we've created. I'm actually going to come back in and put a little bit back there. A little more back here on this corner. Doing okay?
Mm-hmm.
Yeah, perfect. Great. So Zachary started with a pretty good jawline. It wasn't like we needed a ton of building out, but you can see where this definitely just gives him a little bit more of a sharpened edge and a little bit more defining in this lower face. Doing okay?
Mm-hmm.
You sure?
Yeah, I'm good.
Now, these fillers, like every other procedure that you have, it takes a couple of weeks for them to look their best. You can experience some bruising, you can experience some swelling, but we really ask you to give your face some grace and give it a couple of weeks, because as they settle in, they look more natural. They appear, you know, they integrate into the tissue more, and your result is just going to get better and better.
Well, thank you, Emily. That was an excellent presentation on jawline filler. Great before and afters. Remember, if you're interested in any of that information, you can call in, talk to one of the people on the phone, click the link to shop. Stay with us. We have another great nurse injector coming, Olivia Salmon. Remember our TikTok famous Olivia? She'll be doing another filler example for you. So don't go anywhere.
topic in a very commonly asked helpful consultation here at Cool Springs Plastic Surgery. So without further ado, Olivia, take it away.
Hi, I'm Olivia Salmon and I'm a nurse injector, and today I'm going to walk you through a lip filler treatment with my patient Zoe. So Zoe and I have done her lips before. We've kind of been maintaining over the past, probably 2 years or so? Yeah. So she's not completely back to ground zero as far as where her volume's at now, but it's been about 8 months, so it's time for us to re-up. She's got her wedding coming up in June, so we're trying to refresh before then and add a little bit of volume. Normally we put in about 3/4 to a full syringe on Zoe, so we'll kind of see where we want to get to today since she does still have a little bit of volume left. The product I'm going to use is called Restylane Kiss. I'll show you that syringe here. So we've used Restylane Kiss every time we've done Zoe's lips. This is the product that I really love for her. It gives a lot of height to the lip as opposed to projection, which is what tends to keep it looking more natural, and it can really define her border and keep her shape really beautiful because she has a really pretty natural cupid's bow, so we just want to enhance that. Zoe has been numbing for about 20 to 30 minutes, so she should be good and numb, but the lips are still a sensitive area, so she may still feel a little bit of some of these pokes, and that's pretty normal. But there's also lidocaine in the filler, so as we go, it can get a little bit more numb as well. So I'm going to start on her top lip and just work side to side and then across the bottom. So we'll start right along her border here. A little poke, Zoe. 1, 2, 3. Great job. And I always just tell my patients to remember to breathe and don't hold their breath, because that's usually when people start to feel lightheaded, is when they hold their breath. But Zoe's a pro. She knows what to expect. Another little poke. And I do just really small amounts at a time. So you don't want to overfill a lip. That can be a really obvious look when you have too much filler in a lip. Our goal is never to just quadruple the size of a lip. We just want to enhance what she naturally has. You're doing great. Bruising and swelling are really normal and common with filler anywhere, but especially in the lips, they tend to swell easier than some other areas of the face. So I always tell patients, don't panic if they grow when you leave here. They will go back down. Usually it can take about a full week for you to get to your true end result with lip fillers, sometimes even a little bit over that if you do bruise a decent amount. And that's about 1 to 2 weeks is when we would reassess to see if we needed to add any more, adjust anything, and kind of see where we're at. Looking pretty. To help with her bruising, Zoe and I already talked about her avoiding Advil, aspirin, red wine, anything like that that can thin your blood for several days before, just so that she doesn't have more bruising than is necessary. But even when you do avoid those things, you can still have a little bit of bruising. So far, she hasn't really bled though, so she's doing good. Okay. Almost done with this side. So all in all, this product usually lasts about 9 to 10 months, sometimes up to a year for some people. Since Zoe still had pretty good volume even at 8 months, she's someone that probably holds on to it a little better than others. I would say her total volume probably would have gone down about 10 to 11 months or so. So you can see on this side we already have a little bit more elevation and volume, so I'm going to go ahead and kind of match that on this side and then go to the bottom and see if we need a little bit more. Tell me if you need a break, Zoe. You're doing great.
You're good.
You're used to it. Sometimes when you first get filler. It can feel a little bit firm at first, and that's normally just because there's swelling around the area. So as that settles in, it will become really soft where you barely notice it as any difference from your natural tissues. But that can take, again, about 1 to 2 weeks for that to fully occur. And I would say lips are probably the most uncomfortable of any filler area. They're just a sensitive area. But luckily you don't have to do them very often, which is nice. And smile big for me. Perfect. And you can see when she smiles, smile one more time, just how much more show she has on that top lip. Her lip doesn't want to curl under as much as when you don't have that little bit of extra volume. You can lose some of the lip when you smile. And that's a common request. It's just that they want their lip to look a little bit fuller when they smile specifically. And lip filler and even Botox can help with that specific concern. We actually normally do on Zoe just 1 unit of Botox on this side of her top lip because it does tend to curl in a little bit more on that side. So I'll do that at the end as well, just to show you what that looks like. Switch out my needle here. We're moving on to the bottom lip, Zoe.
Okay.
Okay. A lot of people ask me how, or more so, or curious kind of how many syringes they'll need for the lips. And I never do more than 1 syringe at a time in the lips. I think that's more than enough for what anyone needs to change their natural volume at once. We can always add on more once the lips settle. But if you add in too much filler at once, trying to get to that really full lip quickly, filler's more likely to go outside your borders, and that's when you can get kind of that duck appearance, or I like to call it a filler mustache, when it looks like there's filler outside of the lip. So if you go slow and let the lips accommodate to the filler, you can avoid a lot of that. And every lip's going to have its limits regardless, where not everyone's going to be able to get to Zoe's lip size. If they don't naturally have a fuller lip, then they're going to have to stay somewhat closer to their natural anatomy for it to still look natural. And at the very end of the open house, we'll have Q&A. So if you think of any questions during any of this, just jot them down. You can ask them at the end, and one of our injectors will respond to you about those. And I always just kind of pinch to make sure everything feels smooth through there. And she's doing good. Going on to the other side. 1 more needle change. Lips are overall pretty quick. Some areas of filler take a little bit longer, but lips being a small area, even though they're sensitive, they don't tend to be quite as long of an appointment. All the lip fillers that we use in our practice are made of hyaluronic acid, which is pretty common. There's not many places that would put a non-hyaluronic acid filler in the lip. And the beauty of hyaluronic acid is that it is naturally found in your body. It's what gives your tissues moisture. Hyaluronic acid fillers are just cross-linked hyaluronic acid so that it becomes a gel instead of just straight liquid. And that's how we get different consistencies of fillers. Some are better for lips, some are better for cheeks. Like I was saying earlier, the Restylane Kiss is incredibly flexible, which makes it so great for defining a lip border, but it's still very soft. For lip fillers, you don't want a hard filler. It's not going to feel like that natural lip tissue. So the softer fillers, unfortunately, do tend to go away a little bit quicker. So cheek and jawline fillers are usually what lasts the longest. Some of those will give you maybe up to 2 years. Where lips, it would be rarer to get a filler that is indicated for 2 years, even though some people can hold on to it longer than others. We are almost done. She's doing so great. Zoe's always a star when we do her lips. And smile big one more time. And then relax.
Are you doing anything?
Yeah. Zoe's pretty numb, so she probably can't feel that she's smiling normally here. Okay, just a little more on this top lip here. Okay, I'm going to take a look at Zoe there, make sure everything looks symmetrical and see if there's anything else we need to do. We've used almost 3/4 today, so we're not quite at that full syringe. But again, she had a little bit left in her lips, so I want to make sure we're staying at the size that Zoe would want to be at before adding too much more. Smile one more time, and then relax. Good. Okay, so one thing I want to point out on Zoe, so when she's at rest, it's very symmetrical as far as her size and her borders, but when she smiles, smile one more time. She curls in a little bit more on this side, which is why we're going to put that unit of Botox over here, which will flip out her lip a little bit more when she smiles specifically. So, I'm going to switch to Botox, and we'll do that real quick. How's your pain level overall right now, Zoe?
Oh, it's good.
Good. The numbness from the topical lidocaine and from the filler will probably last her at least another 30 minutes or so once we're done. But she can eat and drink normally. She doesn't have to avoid anything. It may just be a little numb when she tries. Okay, and purse your lips for me. And then relax. So just one little drop of Botox here. I'm just doing one unit on this side. And this will kick in about a week as well. So kind of when everything is settling, that Botox will kick in and finish it all off. I'm going to put a little bit of Aquaphor on you. The lips can feel a little bit chapped sometimes right after filler, just from those harsh cleansers and from being tight from swelling. So it can be nice to put a little Aquaphor, but no makeup, lipstick, anything that's got caked makeup on it. All right. And you are done. You did great, Zoe.
Thank you.
Okay. So for the open house, our special for the lip package is any syringe of lip filler for $675. And then you get $50 in your account that you can use towards anything, any treatment at the practice. And we're all done. Yay.
Welcome back. I hope you enjoyed those presentations with Olivia Salmon and Emily Finley, nurse injectors here at our Brentwood location. And remember, if you missed any of it, if you're just now tuning in, you can rewind and watch some of those things. Don't want to miss anything. It's all very good and very informational. So now we're going to do some more fillers with some more of our awesome injectors. We've got Michelle. She works out at our Mount Juliet location. She's been with the practice 25 years, almost since the start with Dr. Moore, which is amazing. And you do a great job injecting. Your patients follow you all over. And then I've got Susan. She's at our Cool Springs, Franklin location. She's there at the mothership where Dr. Moore started it all. And so she's been at practice for 16 years doing injecting. So a lot of experience in this room right now. They're going to be doing some not lip filler, but filler on the face. Take it away, Michelle and Susan.
We're actually going to be concentrating on the lower face today, and that's a area that some people tend to ignore. You know, everybody's into the cheeks and the lips these days, but really, you can really take a lot of years off by doing lower face. And even though we're concentrating on her lower face today, I'm going to let Susan talk to you about what we look at when a patient comes in for evaluation of what to do when they have lines in the lower face.
Sometimes the areas of the lower face are affected by what's happening in the upper face as well. So sometimes certain people have to have a little bit of cheek volume to give some support to this lower jowl area. Sometimes some jawline filler is required also, just to help kind of pull some of this back. And in some cases, we just have to refer for a surgical consult. But for her, we're just gonna kind of concentrate in the nasolabial fold, oral commissure, and the marionette line area today.
Great. And we're going to get started. The patient has already been cleaned and prepped and numbed, and she told me she was numb. So we're going to go ahead and get started. So. Okay. And today, Susan is using a combination of different fillers. We look at fillers when we do a filler based on location, what product is best for that location, where we're at, and we do try to look at patient budget. You know, we know everybody's on a budget, so we try to help out in that aspect too. But we definitely have some fillers that are really fabulous in certain areas. Today we're going to be working with RHA3 and RHA2, Susan? Yeah. So we're doing the RHA line today, but other fillers that we use in this area generally are like Juvederm Ultra Plus. We also use Refine. Refine is also a really, really good filler for fine lines. You know, those little lines that you get around the mouth and the little pesky ones that come up here. So Susan's going to be injecting first with RHA3. When we look at a face and we look at lines and things that are in the lower face that make it age, a lot of times it's because there's not a lot of stability there. There's hollowing and that forms lines. So we go in and we try to stabilize the area first by doing a little buildup of filler in there. Natural look, we don't over volumize you. And so that's what Susan's doing now, is trying to go in and get that lifted a little bit. A lot of times that will take out a lot of the lines, especially the deeper ones. When you have really deep lines, it's important to get that stabilization underneath. And the cool thing about this is the RHA3, all of our hyaluronic acid fillers have lidocaine in them, which is great because not only do we numb you topically, we also are giving you numbing on the inside as we go in. So I think we pride ourselves on making it as pain-free as we possibly can, because most of your injectors are wimpy. So we understand what it's like to have it done, and we pass on that empathy to you.
Oh, that's good. That's really good to know. And so that's something that we get asked a lot when people are calling in. They ask, number one, what product they need to buy, and then they also ask, how much is this going to hurt? And so it's good to know you're going to pick a product for that patient that's going to help them the best. That's why we try to say, oh, on the phone, we are so not able to make that conversation happen, but we would love to schedule you a consult with one of these providers, and they can talk specifically to your needs and make sure they're using the best filler for them. And then also, numbing is our friend. We love a good numbing cream. And I'm so glad to know that even after numbing cream is wiped off, the product even is helping with that numbing. That's great information, Michelle.
Absolutely.
Yeah.
You know, one thing too, you were talking about, you know, picking a filler. A lot of times when we see fillers come in from not our practice, from other practices or people that have been done, and they're having problems with their filler. It's just maybe not where it was laid or how it was laid, but it can also be the wrong product choice for that area. So keep that in mind when you're looking for an injector. You want somebody that is well qualified, somebody that's been doing it a while, somebody that's well educated with their product. It's just not a matter of showing up and getting filler.
For sure. And also, if anybody has any questions out there, please type them in. Send them to us. Michelle, Susan, they're able to answer questions for you. I do have a question, though, Michelle, if you'd like.
Absolutely.
If you're ready for some. Post-care and downtime.
Oh, great question.
Yeah.
Really is kind of area dependent. When we inject lips stay swollen anywhere from 24 hours up to 3 or 4 days, depending on the patient. And I wish I had a crystal ball to tell you, oh, it's going to be exactly 2.5 days. We don't know that. But we do give you tips like, you know, kind of making the area, iced it down afterwards, and, you know, little things along the way to help reduce that swelling. Typically in most fillers, you have about a 2 to 4 day of swelling event. You can have bruising, so I tell people, please do not try to do fillers before a big important event that's 48 hours later, because we can't guarantee that you won't bruise. We try very hard for you not to. The other things are, there can be, you know, risk factors like infection into the filler, and we monitor, we have a questionnaire. You do not want to get fillers 2 weeks before or 2 weeks after any dental work, because that can actually cause problems within the filler. So keep that in mind when you're booking your appointment.
But Botox is safe as far as dental work.
Absolutely.
Great.
You can get all the Botox you want around dental work.
And we love that. Girl's best friend. I do have another question coming. Let's see. How do you know a patient is a good candidate for filler in the lower face? So how did you decide? I think you talked to that quite a bit.
Yeah, one thing we look at is how loose is the skin, because we have the luxury of working for 2 of the best plastic surgeons in, I'm not going to say Nashville, the whole state of Tennessee. In fact, I'll say the whole South. They are absolutely wonderful.
Absolutely.
And so if I see a patient that has a lot of jowling or sagging skin, here's what I say. I can help you soften with fillers, but I'm not going to be able to fully correct that, and you need to know that. And we try to figure out what your expectations are, because really surgical, having surgery is pristine. That is your #1 best look, is doing a surgery. And as long as you understand that, and we have an understanding that I'm not going to get you to a surgical look, then you're a great candidate for fillers. We also do look at your history. If you've got clotting disorders, if you've got an active infection, like I said, dental work, those things will rule you out for fillers. And when in question, feel free to call us and run that by us. We'd be glad to let you know what you can and can't do.
For sure, for sure. We do have a question from some of our viewers. I have 2 actually. How often should someone get filler, which goes to how long it lasts?
Okay, we have various fillers and they last various lengths of times. But I tell my patients, it's like real estate. Location is everything. If you put filler in a lip and you're a lip biter, a 1-year filler is only going to last you maybe 10 months, maybe 8 months, depending on, you know, I'll have people come in. Yeah, I'm like, you got to stop that.
Yeah.
The longer that the filler is in an area that doesn't move, the better it lasts. So we have some fillers that are 2-year fillers, and those are usually mid-face fillers. Most of our fillers are anywhere between 1 year and 2.
I have another very interesting question. Can filler be used in facial scarring for correction?
It can.
That's fascinating.
Yeah, there are a couple different fillers that are on the market that have been approved for you know, scarring issues. Depending on the scar and the depth of it, you know, we kind of assess and see if they'd be a better surgical candidate for revision.
Right, for sure. That's fascinating. I did want to say that Susan did my lips in December, and they're fabulous. We did it on a Wednesday, and I had a party at my house, a Christmas party at my house on Saturday night. And so I was good to go. I had some swelling on Thursday a little bit, maybe a little bit on Friday. And of course, you never know how a patient's going to react. But I did my filler on a Wednesday, trusting that it was going to be fine by Saturday, and it certainly was, I think, and they still look great to me. So let's talk some more questions. Let's see. At what age do patients typically start asking for this kind of treatment?
For lower face?
Uh-huh.
I see a lot when they hit into their late 40s, early 50s, and that's kind of when we all have the wake-up call going, what is this, and how did this get here? And we lose three things. We lose bone, we lose fat, and we lose elasticity. So when all that combo hits, everything drops, and that's when you see the jowling start, and that's when you see the jowls here, that's when you see the foldovers. So typically that is anywhere between age 45 to 55 is the start of that.
And so let's talk number of syringes. Let's, what if I need more than one? How do you figure out how many somebody's gonna need? And what about budget? How do we help?
The things I look at when I'm talking to a patient are, how deep the lines are, what their expectations are, and that's very important because if they expect to get it as the best they can, we may need another syringe or two. I tell patients when I look at them, I can't do this with one. I may need two. And so really it's in looking at the patient, the depth of it, the location of it, and we do try to be respectful of the budget. We will give you a range of what we can do, but honestly, if you do what we suggest, that's usually the best outcome.
Right. So I hate to say this right now because I was trying to save it to the end, but this is a great time for me to talk about our awesome specials right now. Remember, we have the packages, and so those would be great options for you to have sitting on your account. You can talk to one of these providers about some of their filler options, and they can talk about, well, you've got this much money sitting in your account, let's work on this and this, and we can improve this area. So it's a great time to look at those packages. You can click online and read about those. We've got the platinum, the gold, the silver, the bronze, and then, of course, the lips, the Luscious lips package that we've talked about. And then I did have another question. Can fillers migrate like Botox can if you lay down too soon? Because we learned earlier with Teresa and Olivia not to lay down for 4 hours.
Typically, fillers will not migrate if you lay down on them. I tell you where they will migrate, and I'm a classic example. I hollow right here, and anytime I've had it here, I like to sit at the desk and do this number. Not a good idea. It will migrate if you push on it too firmly. But just to lay down, no, you're safe to do that.
And if when you talk about pushing on it, is that just when you've initially had it or all the time? Okay,
Good
just
question.
initially.
Yeah, just great questions, Angel. Initially, because usually after 2 weeks, it's set in there really well, so no problem. Now, I will tell you, you all seen people that have had fillers that have not had a really good outcome with them, or they've got, what we call fish lips. That, a lot of times, is migration of the filler. So what happens there usually is poor product placement, poor product choice, and then too much product at one time. Those are the three things that will cause the migration from the injector.
Great. And so tell me, will this patient have a follow-up with you after this treatment, or with Susan after this treatment?
Absolutely. And Susan, do you want to talk about that, or?
The follow-up?
Yeah, how we usually do it.
Sorry, I'm in my zone.
In the zone. She was in the zone.
The zone.
When I have especially my first-time filler patients come back, I would like to make sure that everything's laying smoothly, let them ask any questions. Sometimes we have to do a little bit of massaging, and we may have to add a little bit more product as well.
And so usually that happens around 2 weeks, right? A lot of times it's great for a patient on their way out the door. Oh, let me go ahead and schedule my follow-up. A lot of times the injector will tell them, make sure you talk at the checkout desk and get that 2-week follow-up with us for your filler and your Botox also. Let's see.
Looking good.
It is looking good.
Let's see.
So,
oh, nice. You're going to love this. Susan has almost completely obliterated all the lines on this right upper lip. It's amazing.
Great.
It's good. One thing that Susan and I wanted to add, you might have seen her using what looked like a longer needle. That was actually a cannula. And cannulas are wonderful because they're blunt tipped, which means less pain going in. They glide. They usually have a lesser chance of bruising. I'm not going to say they never bruise, but really, honestly, 90% of the time,
very
I
little.
think, I don't have a lot of bruising with cannulas.
That's great to know.
So
We have some at the entry site typically, but for the most part, little needles make a lot more bruising.
Okay. That's so fascinating. And you know, I found that any bruising I may have is just easily covered up by a little touch of makeup. It's not even that big of a deal. That's very good to know. Thank you so much. And then let's see. I saw a question. Let's see. How can masseter Botox be used with lower face filler to enhance the jawline?
So, a lot of times we look at masseter Botox when somebody is either complaining of pain in there and their masseters are big, because a lot of times those two correlate. But some people have a boxy face right in through the masseter area, and a lot of times we can go in and reduce the size of the masseters, which kind of brings their jawline out a little bit more. And then, have you ever seen somebody? I've actually got one now, and I've got a bag of filler waiting on me. I've had weight loss, so my whole face went. But there's a hollowing that I've got right here, and a lot of people have that, and you can go in and inject filler in there and just carve out a really nice crisp jawline there and back here for most people. Now, some people we look at and you need a little help from Cabela or liposuction or something like that, but you can do a really nice jawline, and incorporating masseter Botox can be part of that plan.
Which goes a lot to those combination treatments that we've been talking about all day. And so that's a great example. That was several things you talked about that could work out for a patient for a combination treatment. I did have one question asked about infection, and that would be more if there was the dental work involved usually.
Usually, yes.
And then I've also had a question if there's allergic reaction. Do people have allergic reactions to this product?
I have been injecting for, like 20 some odd years. And I will tell you, I've had one. I've had one. It was extenuating circumstances, though. The patient had had something weird going on previous to that. And I injected her and did a couple different areas. And the patient said to me, "How much did you put in my lip?" And I'm like, "Oh gosh, hardly anything." And she was swollen. We gave her some Benadryl, put her on a dose pack, and we don't know. There is lidocaine in the product. So if you're allergic to lidocaine, you definitely need to let us know before you come in. We can special order filler without lidocaine. So just FYI there. So we don't know with her whether it was a lidocaine or a reaction off of a previous illness that she had had. But that was 15 years ago.
That's amazing.
Yeah, nobody since then, and I've done thousands.
And so tell me, what is the product in the filler?
You mean
what is
hyaluronic acid?
Yes.
Thank you.
Yes.
Yeah, hyaluronic acid is a product that's actually found in your joints and in your body in general. So these companies have done a really good job about trying to mimic the hyaluronic acid. And it is hyaluronic acid that we inject, which is great because we don't have to worry about anything weird coming down the pike, for the patient.
Right, which is why, because they're trying to make it so natural.
Absolutely, and they have.
One more thing I want us to talk about, and that's natural results. How can we make sure we're getting natural results?
Do you want to take that one? Susan hasn't got to talk much. So.
I'm in my zone when I'm looking. I think mainly not overfilling and creating realistic expectations for the patient so that they don't think that every single line is going to be gone or every single shadow is going to be full, because you don't want to walk around with too much filler. It does not look good.
Right.
And also the choice of products in certain areas. Some fillers are meant for areas that are in motion. Some areas are meant, they need the structure of a thick, strong filler. So I think that's key right there.
I think it's so good for our viewers to know that this is truly a science, and our ladies have been trained and retrained and more training. And Dr. Moore is so good about investing in these ladies so they can learn all the good things, and we can investigate the best products to make sure we're getting our patients the best care that we can. That is certainly our goal here at Cool Springs Plastic Surgery. So this has been awesome. This sweet lady has done great. Thank you so much. You want to sit up a little bit and show us a little bit of, oh, that's great, I see. Filler to me, and am I right, ladies? Filler is the one thing you can walk in, get it, and you walk out and you see your results.
Yes.
It's not like Botox where it takes a few days for you to start seeing it. Thank you. Oh, go ahead.
I was just going to say, sometimes it's hard to notice if you're not used to what you're looking at. If you look at her corner of her mouth, it's now turned up where it was kind of joining the marionette and looking sad. She still does have some superficial lines, but they are almost all gone. And then this little area too is more volumized.
Nice.
It's more kind of sunk in there.
Very nice, Susan. Great job. You ladies are awesome. It's nice to watch. It's nice to visit and talk about it. And so I just want to remind our viewers, if you have any questions, come on in with your questions. We can try to get to those. Also, remember the packages that we have available. You can click the link and there'll be more information. Remember, we have one number for all locations, 615-771-7718. Call in. You can talk to one of our awesome phone people. They know a lot of good stuff and can give you great information. They can help walk you through buying a package if you want to do that over the phone. Or also, remember, click the link and shop. Anything else?
I just want to say, talking about the people that answer the phone, not only do you get awesome educated injectors, you get awesome educated phone people too. And our phone staff is absolutely wonderful about taking care of you. You're going to love the phone staff as much as you love your injectors out here.
Oh, Michelle, thanks so much.
You're
Dr.
great.
Moore is really good at investing in us too, making sure we have great training and we know what we're talking about. And also, if we don't know, we're going to take your information and call you back. We will find out for you. Remember, Cool Springs at csps.net, or you can log on to our website and look at it. Michelle and Susan, Michelle in Mount Juliet, Susan at the Franklin location. Give us a call. We can get you on the books for a consult with them or a treatment. Thank you so much, ladies. It's been great.
Thank you, Angel. And thank you.
That's right.
I'm going to do the other side of your face.
So we'll be back in just a minute. we just had that great conversation, and Michelle was a part of that for our filler. So in honor of that, let's do a surprise giveaway.
Oh.
I just paid somebody in the back to give me this jar so I can give y'all some filler. So 1 syringe of free filler coming at you. I'm going to let Dr. Srochek poke his hand in there and
All right,
find us a piece.
I'm gonna go to the very bottom here.
One
I'm gonna
sheet.
try to get the very
Yep.
bottom one out. I think
Okay,
I
everybody
got it.
out there in TV land, you're excited.
Okay.
Okay, so
The winner.
Amber C. We're gonna contact you, and you win a syringe filler.
Sweet.
Yay! I'm so excited.
Hey,
now
that's
let's
a
talk
great
to these
giveaway.
2 awesome humans.
So the next segment, we thought we would have an opportunity to take some of the questions that we've received from our viewers, but also common questions that pop up all the time in everyday life. We thought we'd kind of maybe, some of the questions have been answered before, but we're going to kind of reinstate some of them and kind of go through some of the details maybe that we didn't touch upon. So question 1 regarding fillers and Botox. Occasionally in the clinic, we get patients who come in to see us and they'll say, oh, you know, I think I need something done to my face. I need filler, Botox, I'm not sure which one. How do you tackle a patient that really is not sure what they need, but they have some concerns?
So I love a patient that doesn't know what they need and that I can kind of start fresh and redirect them. So Botox works by relaxing the muscle, and filler works by filling in volume. So if someone has a volume deficit or needs some support, that's when we usually go with filler. But Botox relaxes the muscle, so most people can benefit from Botox, but between the brows, around the eyes, where the muscles contracting, increasing the skin to form lines, that's when Botox is really good to target those lines. You have anything else to add?
What about you?
I agree. When I have a patient that's just totally lost on what it does, I'll say, typically, not always, but typically Botox from here up, filler from here down. There are some exceptions. You can inject masseters with Botox. You can do the chin, dimply chin. You can do the upper lip, and that's what's called a lip flip. So there are some areas on the lower face you can inject with Botox, but typically that kind of helps everybody kind of know what they need going in.
Right, and it was so great when Olivia did her presentation on her lip filler. She threw in that little lip flip at the end. She all of a sudden said, oh, wait, I think you need a little lip flip. So she ran and got some Botox and did that little lip flip. That's a bonus for that sweet little patient. Also, I want to let people know to send in your questions if you have any. We can ask these 2 awesome ladies. And remember, I've got Chrissy, who works at our Cool Springs location. She's here at Brentwood also some of the time. And I've got Michelle, who's from our Mount Juliet location. If you're just tuning in, we're talking to them about filler and Botox. Send in your questions.
So fillers, what is a filler? What is a filler made of? What is exactly that we're putting into someone's face?
Sure. Filler is a gel-like substance that in our office we have hyaluronic acid fillers for the most part. And they look like a gel and they're a little thicker. And most people, when you talk about fillers, they think like a syringe of filler is a huge amount. When you look at a filler, it's actually only like 1/5 of a teaspoon. So it's not a lot, but the gel consistency really volumizes quite well. So that's what we use as hyaluronic acid fillers, and they have a great safety mechanism behind them in that if you don't like it or something goes wrong, we can dissolve it. And that's why we choose to use those fillers, because they're just all around good fillers.
What about, when you're putting fillers into someone's face, are there specific areas that fillers are best suited for? Like the typical areas that we use filler, for instance?
Mid-face, for instance, is best treated with filler, and I always say it's kind of the root of all evil. If you have mid-face volume loss, you'll see issues under the eyes and in the lower face, and just by volumizing that area, you can get improvement in multiple areas. So lips are also great for filler. What else? Contouring.
Jawline.
Yep.
Jawline. You can do tear troughs. If you've got a hollowed out tear trough, there are some I'm sorry, I should have had this in my mouth. You can do tear troughs where the areas that are hollowed under the eyes, but I will tell you that really requires a good consultation ahead of time, because sometimes it's a surgical need over a filler need.
And that could be the case with many patients. We can try to do fillers, but there may be a surgical need. And I love it that we're honest about that with our patients up front. Yeah.
How can, what's the best way for a patient who's out there, for instance, one of the viewers that's watching the show or watching it later on, how do they choose the right injector for them? What's the best way to make a decision about who to go to?
Well, I'm kind of the coordinator for the injector, so I want to speak to this because each and every injector here I would let work on my face. And all of our injectors are highly educated. So I tell everybody when you're looking for an injector, look, we've got 4 locations. So that would be one way of finding a good injector because you're going to get good injectors at each location. So we've got a location in Mount Juliet, we've got one downtown, we've got one at Cool Springs, and we've got one here in Brentwood. And so I would tell you that's one way. You can also go on our website and read about each of our injectors. There's bios on all of them. Referral is always good. Ask to see before and after pictures.
So
and then when you meet with
enough
them,
about referrals are incredible. You know, right? A lot of our staff have amazing patients that they've treated. The referral basis is incredible. So talk to someone who potentially might have received treatment before to get some guidance from them. And then before and after photos. If any of y'all have not had a chance to scroll through our website, csps.me or csps.net, our website has a plethora of amazing photos to showcase what some of our injectors do in there. It's incredible how much change just a little bit of filler can truly produce. So that's wonderful.
I agree, and I also know that almost all of our nurse injectors, if not every one of them, have given me some sort of injection. And so I love that I can speak to that on the phone and I can talk to people. And I truly would recommend my friends and family to every one of our nurse injectors. And you're right, Michelle, Dr. Moore makes sure that everyone has top-notch training. We're great at what we do.
So another interesting point, so I was watching this last injection with Susan when she was injecting the midface. The patient herself didn't even flinch, didn't even move. Now, I have never had filler in my face. What can I expect? What kind of pain level can I expect, and what am I going to experience when I'm getting a filler injection?
I think we do a really good job at making it really comfortable for patients. Our topical numbing is really good, and then the filler itself actually has lidocaine in it, so once we get a little bit of product in the skin, each injection after that's even more comfortable.
So lidocaine is a numbing medicine that's inside of the filler itself, and we use lidocaine in surgery to numb up areas of the skin. So filler actually has the lidocaine in it as well, so it helps to diffuse and numb up certain areas so that you're not experiencing that pain.
I tell my patients usually if, there's going to be a little stick, and that little stick, which is the entry point, is going to be a 1 to 2 on a 1 to 10 scale. Oh. And then after that, you're really not going to feel anything. And if you do, let me know, and we'll just kind of stop a minute and regroup.
So I have a question from a viewer, and I have several thoughts about it, but does filler help with pitted acne? Like a scars from pitted acne, I'm assuming is what they mean.
It depends on what the scar looks like. Sometimes it's best to laser first, and then whatever's left over, we can go in with filler and add support to the tissue. So, yes.
Because I was also thinking we might have some conversations in some of our later segments that talk about other options for scarring from acne, but absolutely filler could be something that could help maybe a little bit later after some of those other options.
Or microneedling.
Yeah, I agree. All right.
What's
what
another
else?
one, Angel?
Let's see. How often should someone get filler? How long does it last?
Very common question. Our patients a lot of times say, well, I don't know if I want to get a syringe of filler because it doesn't last forever. Maybe I should get fat grafting. How do y'all communicate to patients the longevity of a filler?
In talking to the patient, I usually try to evaluate if they're a surgical candidate, if they have a lot of volume loss, I will look at them and say, are you open to a surgical procedure or fat grafting, which typically can last a little bit longer? If they're not open to that, because they are surgical procedures that actually, you have to have some sedation with, so some people don't want to do it. And in that, then we kind of reroute and talk about fillers. But if they have a lot of volume loss, sometimes I will direct them to our physicians because they're great. If they don't have a lot of volume loss, we talk about what their expectations are. Fillers I jokingly say it's like real estate. Location is everything. And in areas that move a lot, like the mouth, the lips, they tend not to last as long as they do in the mid-face, which we use a mid-face filler that is indicated for up to 2 years lasting there. The rest of our fillers are indicated either like 1 year to 18 months. And I tell people it really depends on the location or where you place it, because the more it moves, the faster your filler goes out. But most fillers we can get, anywhere from 11 months to, 15 months out of.
So one other question I'll pose to both of y'all, and my wife has asked me, because she's seen some of the amazing videos, the amazing pictures that y'all pose. I mean, it's incredible some of the changes that you can create on a person's face. And my wife has asked me, at what age should they start getting? Is there an age, or is it a certain time in their life? Like, how should patients perceive that?
I think it really just depends on when they're ready. But like, for instance, that patient that I showed earlier on the last slide, she was in her early 20s, and we were just doing kind of beauty enhancement. So it wasn't really even anti-aging, just enhancing what she has already. So that's really early on. And I think we do a lot of prevention now. So treating kind of before things get bad, or preventing them from even forming.
You see younger people coming in now, because a lot of the younger people want lips done. They really want lips, or they want to volumize their cheeks. And so we're seeing them come in younger and younger. It is indicated for 21 and older in most cases. I have done a couple of cases under 21, but they were for repair of like a cleft lip or something like that was doctor approved before we did it.
So I should tell her to come in.
Yeah, absolutely.
Another question: does filler migrate? Does filler move on the face? Can it move if somebody injects filler in my cheek? Can somehow it move somewhere else?
Yes, it can. Around the mouth, that muscle, it's a sphincter muscle. So sometimes if it's placed too deep, or even in the wrong area, it can kind of migrate above the lip. We see that sometimes for patients coming in, and then we dissolve and kind of start over. In the mid-face, so the medial portion, those fat pads move. So if that product's placed too superficially, you can get product to migrate. But laterally, we really don't see much of that.
Okay.
Would you agree?
Yeah, I definitely agree. One thing too is you have to, when we evaluate when a patient comes in, their habits. I have had one migration that I'm aware of. We don't see them that often, so it's not, I wouldn't say they're often at all, would you? I have one in particular. The patient came in, and I had done her lip, just a vermilion border, just a really crisp border. And she came in like 2 weeks later, and it's up here. And I'm like, I'm like, so how you like your filler? And I'm like, I know. And so in watching her and talking to her, she was like, yeah, I love it. But I think it migrated up a little, and she's smacking her lips. I'm like, stop that. And what she had done was, she was a lip mounder, and I did not catch it when she came in, but I watch for it now, like a hawk.
Wow.
Yeah.
You've also talked with me, Michelle, about using a straw.
Yeah, using a straw, doing this, what Christy said about the sphincter muscles. When you are working it real tight like that, you can push it. Now, I would say it's most easily shiftable in the first 2 weeks. Wouldn't you say that?
Okay.
Yeah.
That's great.
Usually after 2 weeks, y'all can kind of settle.
You're pretty safe. Yeah. That's really great information.
And then result-wise, right? You get filler injected, you walk out of the office. We were talking about this earlier with you, Chrissy, like, if you don't, do you see that result instantly? Botox takes a few weeks to set in. So for folks coming out with Botox, they're like, wow, I'm still moving my face. But what about with filler?
The cool thing with filler is the result's kind of immediate, or you might be a little bit swollen or bruised, so it looks better at the 2 week mark. But you get the result pretty instantly. I would not bank on liking it right afterwards because, like I said, bruising and swelling, but yeah.
So typically, do you guys follow up with patients at a 2 week interval, for instance, to make sure?
Yes.
Yeah, if they're brand new, they definitely have to come back for recheck at 2 weeks, and because sometimes you'll have a lump or a bump, and that's just part of the nature of filler sometimes, and it's a small lump, you won't see it, but you may feel it, and so we'll massage at that point. We want to make sure everything looks good, make sure that you're happy with it, that kind of thing. So most everybody comes back for a recheck.
So that's a really good point too. For us in surgery, doing facial fat grafting, for instance, and putting fat under someone's face, in the operating room, the moment that the needle penetrates the skin, you automatically induce an inflammatory response. And your body starts to swell, and it can be subtle or it can be profound. And as you inject fat into someone's nasolabial folds, marionette lines, cheeks, wherever, sometimes that response can be too much or too little. And sometimes that response is so much that 2 weeks later, you're like, wow, I wish I had put a little bit more in. How do you guys approach a patient who, for instance, you might have injected, and then they come back at the 2-week visit, and you're like, wow, you know, I could use a little bit more here, a little bit more there?
We might handle this differently, so I'm not sure what Chrissy's going to say.
Yeah.
But I've been doing it a very long time, so when I look at a patient, the two areas I'll hold a little bit of filler back for out of a syringe are a tear trough and a lip, because the tear troughs, they usually don't swell a whole lot, but they settle a little bit, and so you may have to kind of tweak it. So I'll save just, you know, a little bit of the patient's syringe sterilely, might I add,
Sure.
In a special container. Lips, I'll hold a little bit back because, as you said, they sometimes can swell fast.
Very quick.
And so you want to make sure that the patient's as symmetrical as you can get them. So we will typically, I typically hold a little bit back. But if it's mid-face, if it's jawline, I use that puppy up. I mean, you know, you want to get great results. So you try to use it all when you can. But the two areas that swell or have issues, I'll hold a little back.
Chrissy, what about you?
I agree with the lips, especially if someone's swelling a lot in the chair. I will definitely save a little bit for them and make sure that they come back in 2 weeks, but also breaking up in multiple sessions. So if we're doing mid-face restoration, we might do that in 2 sessions just to make sure that they're perfectly even.
That's great. That's good to know.
I have a question, 2 questions, and I think a lot of our viewers are interested. And it's about, do I need a consult first? And how much is it going to cost?
Oh, great questions.
I would say, for me, and I'd like everybody to know this, I think this would be very beneficial. If you think you're going to need a lot of filler and you have a lot of repair work, I suggest getting a consult first and just doing a consult. Let us get pictures. Let us talk through a plan of action with you. If it's, I just have one area that's bothering me or a little bit, we can do the consult and do the filler the same day. But if you're going to need multiple syringes of filler, I mean, or you could come in and we could consult and maybe do just part of the treatment then and bring you back in for the rest.
Such a good answer. Chrissy, anything different?
I agree. Yep.
So about cost, you want me to talk about it or do you want to talk about it?
Can I?
I don't like talking cost.
I want to precede that before we talk about cost with
sure.
something that I think can kind of play along with that.
Okay.
So there are many different types of filler out there, right? We do not just have one type of filler. And there are, each company that generates or creates filler has their different lines of filler that are used for different parts of the face. Patients, a lot of the time, will hear, I had this placed here, I had this placed there. How do injectors decide which type and which filler to use in which location? How do you guys make your decisions?
The fun part is there is so many different fillers that have different characteristics, but it's really about marrying the product to the area that we're treating. So depending on where we're treating, what we're trying to do, depends on what product we choose from. And it is fun that there's so many different ones that do better in certain areas.
Yeah, I agree with that. There's, certain fillers that are my go-tos for certain areas. But I also listen to the patient if they say, I want the most natural look that you can give me, and I'm really freaked out about looking unnatural, which I don't think any of our injectors would do that. But if they're really overly concerned with it, there's a product that I tend to go to more than the other. I'm not going to name names on stuff, but I will kind of make that part of my decision basis too.
What about, does experience play a role in this, do you think? Is that something that, that you find that over time, as you develop a better handle on the different products and the outcomes?
For sure, yep.
I said in our last segment that really, when you see bad outcomes, it can be just a freak thing, but it can be the injector. If you have an inexperienced injector that doesn't know their product, they don't know proper placement, they don't clean well, they don't educate the patient, and they don't give them the proper information, it can go south really fast. Fillers are great things, but with any great surgery or great procedure comes comes risk factors.
Absolutely, absolutely. Anytime that you pierce the skin, there's always a potential for something to go wrong. And that's why, going to somebody who has a lot of experience, who has a knowledge base to be able to perform things well is truly very valid and very important. So then let's shift over to the cost side.
Right. So let me talk about that. First of all, I love all that you said, and I know that Dr. Moore handpicks nurse injectors, starts their training, helps them along the way, and then they are awesome. All of excuse me,
they're
all
artists,
of them.
amazing
They
artists,
are
right? You
I
create
totally
your own
agree.
masterpiece.
I totally agree. Our fillers run anywhere from $6.50 to $8.50 a syringe. So it just matters on which product they choose for you. Now, if you're wanting to look at our package options for you and you're just wanting lips, purchase that Luscious lip package. But if you're thinking maybe you need a little volume in some cheek area or something like that, there's several great package options for you. You could purchase one of those packages and it might be enough for you to get a couple of syringes of filler and your Botox. That's a great option for you. Also, later we're going to talk about other things like microneedling and lasers and those options. You could purchase a package that's going to offer you a chance to do some filler and maybe a halo or a BBL or a microneedling. So there's many options with our packages. Click the link and then you can see all the things out there, or you can call our office, 615-771-7718. Talk to one of those great people on the phone. And with that, we will close out and start prepping for our next segment.
All right.
Thanks, girls. Y'all are great.
Thank you so much for joining us.
Y'all are awesome. Thanks, everyone.
right, everyone, we're back, and we are here with an incredibly exciting segment. If you've ever seen a TikTok video of someone injecting someone's veins and watching those veins disappear, this segment is exactly for you. We are here, I am here on the couch with Angel, and we are here joined by Amanda. Amanda is our nurse practitioner at our Cool Springs office, and Amanda does sclerotherapy. So Amanda, welcome. Thank you for joining us today and helping to educate all of us about the amazing things that you do. So tell us about yourself and tell us about some of the things that you are able to do.
All right. I am a nurse practitioner here at Cool Springs Plastic Surgery. I specialize in sclerotherapy, which is a treatment for superficial spider veins. I've been a nurse practitioner for about 12 years. I trained at a vein center, and that's where I learned, I worked under a physician who specialized in superficial venous disorders. So I learned how to do cosmetic sclerotherapy as well as how to identify larger problems, who would be a good candidate for sclerotherapy, and treatment options.
So before we get started watching some of those great videos, I want to make sure and ask our viewers, if you have any questions about sclerotherapy, be sure to type them in and we'll get that information, because once you start watching these videos, it's amazing.
You get mesmerized.
It's
you get
amazing.
mesmerized.
It's so amazing. So make sure and ask your questions. So let's
Amanda,
get started.
Let's go. So we're going to roll
do it.
some film here. We're going to show some video.
Okay, so look at this patient. Oh, what are you doing?
So right there, I'm preparing my medication to be injected.
Mm-hmm.
I use one of 2 FDA-approved medications for sclerotherapy.
Okay, let's watch this sweet little foot.
So we're looking at a foot.
A foot.
You can notice as I inject the medication
Look at that.
you can see
Wow.
the spider vein disappear.
That's just so amazing to me. So that's a vein. Oh.
And here's another one. Amanda, is this painful?
Most people report very little discomfort at the injection site. I do have to use a very small needle to inject the medication, but after the initial injection, most people report no discomfort at all.
Mm-hmm.
And I don't expect any sort of post-procedural pain or discomfort.
Mm-hmm.
Where are the most common areas that you treat these veins?
So typically for women, legs, lateral thighs, in the calf area. I treat all over the legs.
Legs. Okay, so that's something important for people to know. This is a treatment for legs at our office.
Yes, correct.
Great. So you knew these people were candidates. Why?
Well, they came in, we did a consultation, we did a brief health history, we reviewed medications, they're not on any sort of long-term blood thinners or anything like that. They don't have any symptoms of a larger underlying venous disorder, such as leg swelling, heaviness, cramping. So they were all great candidates.
So who is someone who would not be a candidate?
So anyone that comes in with large rope-like, the bulging varicose veins, that is better treated at a vein center. So.
And that's what the consultation is going to be
yes,
for.
and we'll talk
Absolutely.
about that with the consultation.
Right.
We also, during the consultation, will discuss how many treatment sessions might be needed. A lot of that just depends on how many spider veins are present at the time, how large the networks of spider veins are.
So tell me, how does that work?
How does the medicine work?
Yeah, how does that happen?
And what are you injecting? What's the medicine that you're injecting?
So the medicine that I use is called Sotradecol, and it is one of 2 FDA-approved medications. I use a very small needle to directly inject it into the spider vein. Once the medicine is into the spider vein, it will irritate the lining of that spider vein vessel wall. Once that irritation causes it to be damaged, and once it's damaged, it will shut down. Shutting down the whole spider vein is not an overnight process. It takes time for it to completely shut down and heal. But after I inject it, I will put some cotton balls and some tape. I'll put you in compression stockings, and then we usually follow up in 4 to 5 weeks. And at that point, we should have seen some good results from the session.
So I want to ask a quick question.
There's so many questions.
So
You
many
go.
questions. Amanda, so a patient, let's just say they're at home and they're watching this and they have these spider veins on their legs.
Okay.
And they call our office. What do they tell us? What do they tell our staff? How do they know how much time to book? Do you do injections on that first visit, or do you do an initial consultation? How does all that process work for you?
So I think if there's any question about whether there's an underlying larger venous problem like a varicose vein, I absolutely think it's important to do a consultation because again, that is something we will field out to something like a vein center. But I oftentimes can see my patients for the first time, do a consult, and schedule for the day of the procedure. If that is the case, and that's what you're scheduled for, I do ask for them to be off of any sort of blood thinners, aspirin, ibuprofen for 2 weeks.
Ibuprofen being Advil as well. A lot of folks
Yes.
don't. Ibuprofen is the same thing as
Motrin,
Advil.
Advil, ibuprofen, exactly. I ask for those to be off for about 2 weeks and also 2 weeks after the procedure. I do require you to be in compression stockings for 2 weeks after the procedure as well. This is really so important. It's a critical step in making sure that those veins are completely compressed after the treatment. It locks that medication in and it just maximizes the effect. So if we're going to do it, we might as well see the best possible results.
Absolutely.
So compression is super important.
How big of an area can you treat in for instance, a 1 hour visit? How much of an area can you treat?
So a lot of that is specific to the patient, and on the initial consultation, I will go into an in-depth discussion as to how much I can treat. I have a safe drug window that I need to stay in. I try to do as much as possible with each session, depending on how many spider veins someone has. Starting out, sometimes we'll just do one leg first, and you'll come back for the next leg the next week. That just to kind of expedite things. Right now is a great time to do sclerotherapy. Fall, winter, spring is a good time. Summer's also okay to do it if you're at the pool with your kiddos, or you're spending a lot of time outside, or you're going on vacations. I probably wouldn't advise doing sclerotherapy in the summer just because the stockings are going to be hot and uncomfortable. We can do it. It's not a contraindication to do it in the summer. It's just a little bit more comfortable, depending on your lifestyle, to do it when it's cooler outside. And I also do want my folks to avoid prolonged sun exposure for 2 weeks after the procedure.
So I have several questions.
Fire away.
Yes. One of them, is it bad for you to shut that vein down?
No, that's a great question, and one that I get asked a lot, because it does seem like obviously blood perfusion and supply is something that is very critical. These spider veins are all abnormally functioning veins. They are not your healthy veins that are perfusing tissue that are really vital to be healthy. So if anything, by shutting down these abnormal spider veins, it helps direct the blood through healthier channels in the body.
That's even better. That's great. Good to know. What causes these spider veins?
There are a lot of risk factors. Women have higher rates of spider veins. There's thought to be an estrogen hormonal component to it. Women who have had multiple pregnancies related to the large shifts of blood volumes, that's puts them at greater risk of developing spider veins, as well as varicose veins. Anyone with family history, that's a huge risk factor. And most of the time, and we'll go through that in the consultation, but most of the time, most folks that I see will have had a mother, a grandmother, or someone who's had spider veins. So those are really the three biggest risk factors. Standing prolonged, crossing your legs, there's some thought behind that, but really your genes, if you're a woman, and pregnancies are the biggest.
Well, and another question from a viewer: can they come back?
Absolutely. Oh, the ones that we treat, typically once they are completely closed and fully treated, they do not tend to come back. I usually can tell if the spider vein is closed at the first follow-up session, which is about 4 to 5 weeks after the initial treatment. At that point, the spider vein might not be completely gone, but I should be able to know if it's closed or not. It will eventually just fade and disappear.
Okay, and so what if you have some of those, the question from the viewer, on the nose or on the arms?
So I don't use sclerotherapy for the nose or or the arms. I do know that we have people who do the lasers here, which tends to be a little bit better for the areas on the face.
So we'll learn more about that later in another segment when we're talking about
skincare
lasers and all of that, for sure. So those are facial options. So this is strictly for legs that you're treating.
Strictly for legs.
So one question for you. So somebody comes in, they have the procedure done, you watch the injection, it happens, the veins go away. Are they going to be gone 2 weeks later, or does that necessarily mean that they're healed?
So they will, and that's sometimes can be a frustrating thing of sclerotherapy. They are not completely gone initially. When you see me inject, I can see the medicine push that blood out of the blood vessel. Blood then refills. That blood then is trapped in that damaged blood vessel, and that's what will eventually fade and disappear. So a lot of times people will look worse before they look better. Certain skin tones might look a little bit darker. Some people will look a little bit more red, more irritated. So usually 4 to 5 weeks, although everyone heals differently. Sometimes it can take up to months to see the full effect. And again, that's one of the reasons why fall, winter, spring is a great time to do it, just so we can have you completely healed and ready to go by the time it's summer and shorts and skirts and it's warm and you don't want to wear long pants
and compression garments.
And show your legs.
Yeah. And so another question that we've had, how much does this cost?
Oh, great question too. It's $400.
And that's for a 1 hour treatment.
For a 1 hour treatment.
For a 1 hour treatment. Yes. And so that's also something that your package could do. So there's the package options. You can click that link to shop, and you could get a package and get a couple of sclerotherapy treatments if you think you would need more than one. Oftentimes one is a good amount.
Yes, depending on how many spider veins you have to start out with, how large the networks are. Many times one package or one treatment is enough, although it is not uncommon to need more than one session.
Okay.
It's really just patient specific, and we will talk about that in a consult. Yeah.
And so that's a good thing to know. So you want to call and schedule a consult, or click online, because remember we can schedule online, which is nice now. And this is with Amanda at our Cool Springs location. And then it is $400. So with the package, if you purchase that, you could have $400 towards that, and then maybe have another extra for your Botox treatment or for a microneedling treatment or the other options that we have. So there's so many options with our packages that you have. Anything else? Any other questions from our viewers?
I don't know if anything else has popped up, but I will say, I've tried doing this myself to patients. I got a little bit of a tutorial. It looks so much easier than it really is. This is really, really, really challenging. This is not easy to just pick up. How did you learn this? Did it take you a long time to get good at this?
It took me a long time. I first started doing sclerotherapy in 2015. I worked in interventional radiology and did more kind of larger vascular procedures using ultrasound or fluoroscopy guidance. That is when I transitioned into working at the Vein Center with one of the same physicians that worked in interventional radiology. A lot of it was just on-the-job training. It takes time and it takes practice, but it's really fun to do, and I really enjoy it. And I'm glad to be doing it here.
Well, and we're so glad. We are so glad that you're a
Yes.
part of this practice and that we have this treatment. And then somebody asked, let's see, and I think you spoke to this. Can you work out then within 2 weeks?
Oh, that's a great question. So, 2 weeks after the procedure, I asked for no heavy lifting or pounding type exercises, such as running. Although I highly encourage walking, stretching, Pilates, yoga. That's all really, really good. It helps keep everything flowing, everything moving. It's going to make you feel better. I just don't want any real heavy pounding type exercises.
That's so good to know. And then I agree with you. It's amazing to watch those videos. It's awesome. And I know your dad is watching. He must be so proud. He should be. You do a great job. Anything else?
Well, I think that's all that we had. But thank you, Amanda, for sharing all this with us. And to all the viewers at home, if any of you have spider veins and would like to get some sclerotherapy, feel free to call us at
615-771-7718 is that number. Remember,
awesome.
it's one number, all locations. We have people standing by, our awesome phone people that can help you schedule that consult with Amanda and talk with you about package options. If you have any questions, give us a call. Look forward to our next segment
Yes,
that's
so coming
up.
we've got an incredible session coming up with Heather Happy. She is our esthetician here at our Brentwood office, and she's going to have an incredible session on advanced skincare. So follow up in just a few minutes for that.
Stay tuned. and welcome back. We're here with Heather Happy, one of our licensed estheticians. Heather works at our Brentwood location, and she's here to talk about advanced skincare treatments. We have lots of options for you here at Cool Springs Plastic Surgery, and this is just the beginning and just a little bit of an intro. So from here moving forward, skin treatments. Let's hear about it. What's first?
So the first thing we want to talk about is a treatment that has absolutely little to no downtime at all.
Awesome.
And that's going to be hydrofacials, and you can combine them with also the treatment dermaplaning. So we have a picture. This is immediately post dermaplaning and hydrofacial. So the skin looks a little bit pink after the treatment just because of the hydrofacial and the dermaplaning itself. But this treatment is excellent for patients who need a refreshment. They don't want to go into advanced skin treatments like microneedlings, lasers, things like that. They're getting ready for a wedding or a big event or a vacation. This combination specifically of dermaplaning and hydrofacial is great because it works on exfoliating the skin, removing the peach fuzz that we have on our cheeks and face, and then the hydrofacial just comes in and refreshes the skin. So
right, so that's what I would have
popular.
asked you. I could do this and then go to an event the next day.
Absolutely, absolutely. It's really popular with brides and just huge events.
Right, great.
Yes.
What else have we got?
So and with hydrofacials, we also have booster serums and LED lights. So there are always add-ons that we can do with treatments. We will always tell you if we recommend a particular kind of add-on, we'll always tell you what it is, what it's for, what the cost is going to be. We don't want you to be surprised when you get to check out that something's more than you were expecting to pay for. But we have booster serums, and these are concentrated serums that are a complement to hydrofacials. They do something more. So they might help brighten the skin. They might help stimulate collagen, add more hydration. So those are add-on treatments that we can do with hydrofacials, and we'll always talk to you about it before we proceed with it.
So you can do a basic hydrofacial or hydrofacial with add-ons?
Yes, and then you can add on a dermaplaning if you want. Okay. Do the hydrofacial by itself. It just doesn't matter. It's just a fun combination.
And that can all be done at the same time?
Absolutely.
And then can we do this pretty frequently?
Yeah, a lot of people will do it every 4 weeks or every 6 weeks. It depends on your schedule, your budget, what you're wanting to look for. If we're working on something specific like acne, clogged pores, things like that, then we can do them a little bit more frequently. I recommend about every 4 to 6 weeks.
Great. All right. That's a great option. Yeah. What else?
So next, this is actually one of my favorite things to do in the office, surprisingly, are chemical peels. So this is a patient.
Wow.
This is a patient. She's absolutely lovely. She has melasma. So if we see on the left-hand side of the screen, she has the classic example of melasma, which is a hormonal hyperpigmentation, very prominent in women. Some men get it as well, but it's really denoted by patches of brown pigment. So it's usually in the middle of the forehead or on the corners of the forehead, across the upper lip, across the cheeks. And melasma is triggered by, of course, hormone fluctuations, primarily with women, but also sun exposure and heat. So those can trigger melasma. It is a condition that's really difficult to manage at times. We can't ever get rid of it, but we can do treatments in the office and also skincare products as well to help maintain it. So this patient had our reverse peel, which is primarily for hyperpigmentation of the skin, which would be excess brown pigment. That particular peel is appropriate for all skin types, so from very light to very dark. And the peeling time is about 3 to 7 days on average. It's manageable.
Amazing results.
Fun, but yeah, it's manageable and the results are great. And she has no makeup on, and she is in the Army. Actually, she just retired from the Army. So this was her picture at home in her uniform. So she loved the results.
Yes.
Beautiful, beautiful treatment.
How often can you get that?
I like to do them usually about twice a year. So if we have severe melasma that we're dealing with or severe hyperpigmentation, sun damage, lots of brown pigment, lots of freckles, we can do a treatment back to back, probably about 6 to 8 weeks apart. If we have it maintained with skincare products, you're out of the sun, not getting those triggers, then I like to do them usually in the fall to clean up summer sun issues. So maybe once or twice a year. Twice a year is usually ideal.
Yeah, great.
Now, the next patient.
More?
Yeah. The next patient is, this is also a reverse peel, and this is for brown pigment. And she was not quite ready to have advanced treatments like BBLs or halos or other things. And so this is just showing her before and after, showing the excess brown pigment in the first picture, and then where we were at. This was about a month or so later. And this shows initially her age is 40 and 40 for her skin, and then after her peel, she basically lost about 4 years.
That's awesome.
Of skin health. So super, super exciting.
Great
Love this
results.
peel.
Great results.
Yes.
So call in. You can ask questions about that. You can get on Heather Happy's schedule for a consult, and she can give you some thoughts and options. This was amazing.
It's so fun.
Amazing results. Yeah. Thank you so much. Stay tuned. We're going to be with Elizabeth in a minute and talking about microneedling.
All right, folks, we're back for yet another incredible and amazing session. Right now, we're going to be working with Elizabeth here. Elizabeth is one of our licensed estheticians at our Cool Springs office, and Elizabeth has 17 years of experience of doing aesthetics. I mean, that's an eternity in some books, Elizabeth. That's awesome. So very experienced. And Elizabeth is going to be showing us today what it's like to perform and for a patient to undergo microneedling, one of my favorite treatments here at our office, which is amazing for folks' skin tone, to help improve the skin tone, help smooth out any imperfections. So Lizzie, you take it away. Tell us about microneedling, tell us what we use it for, and show us the device that we use.
All right. So this is our microneedling device, and it is fairly simple to use, and it actually has little needles in the very top of the cartridge, and this cartridge actually has settings, so it can be set for different depths depending on what type of treatment and what type of thing we're trying to actually treat.
Okay, so tell us, what are the most common things that we treat with microneedling? What does it do?
The most common things we treat are acne scarring for people that have any type of dimpling in the skin, particularly from injuries or, like I said, acne as well. We also treat patients that are looking to improve their collagen and elastin in their skin, which in turn is an anti-aging treatment. So it will firm the skin, it'll make the skin look very glowy and very youthful.
So carry on. Let's see how this works. So we're going to show you guys a close-up view of what microneedling is about. For those individuals at home who've ever heard the term or have ever thought about having a procedure done like this on your face, this is going to give you an up close and personal view of it. Amanda's been numbed, right? Am I right in saying that? Amanda, we numbed your face a little bit. Yes. The needles in this pen are teeny tiny. They're super small, and they do kind of penetrate the skin. And by penetrating the skin, they induce the collagen, the elastin to start to get inflamed and to form and make it harder and thicker and a little bit more smooth. And by doing so, by using this pen all over the face, we're able to induce that reaction uniformly throughout the face. And like Lizzie mentioned, we have a depth setter on it, right? So we can make it deeper and shallower. So in terms of depth settings, for somebody who's never had this before, what would you use?
You know, I would actually start with a 0.5 setting, and there are certain areas on the face that are a little bit more sensitive because of the fact that the bone is so close to the skin. So really more near the hairline and around the brows, sometimes around the lip, but that is what we use our numbing treatment for, and we do that for about 25 minutes or so prior to the treatment so that the patient is completely comfortable and you don't feel any pain.
Awesome. Well, let's get started.
Okay, so
Amanda, are you ready?
I'm ready.
Oh, this is going to be so much fun.
So we've treated Amanda once, and we're coming back and treating again. Microneedling can be done once a month until the desired effect is reached.
And Lizzie, tell us what you're putting there on your hand. What is that right there?
This is a hyaluronic acid serum. It almost feels like a gel. It's very cold to the touch, and hyaluronic acid is 1,000 times heavier than water. So what it does is it highly moisturizes the skin, which is what causes the really dewy, glowy effect once the healing time is over. We also have the option to use growth factor, which inhibits the growth of collagen and elastin even more quickly. So this is more to firm and also for the healing process of acne scarring.
Okay.
So we're going to start with hyaluronic acid serum, and we're just going to spread a little bit. Actually, we're going to do this side here on Amanda's forehead first, and I do this kind of in sections because it does seep into the skin fairly quickly, and then it ends up being dry. So we want to get on there, and it helps my pen move along quickly. So we're going to turn it on.
Okay, here we go, Amanda.
And we're going to start. Usually I start right here in the middle of the brows just to make sure that everything feels okay. How does that feel, Amanda?
I don't feel anything.
Oh, good.
Perfect.
That's what we want.
So, Elizabeth, I'll ask you just a couple questions maybe while you're doing this so that you can maybe help us answer. So sometimes folks come in with scars on their face, whether it's from a mole being excised or some kind of a traumatic injury on the skin, and the scarring is a little bit uneven and it causes for little bumps in the skin. Is this something that can be useful to help treat those areas?
Absolutely. Those are the areas that we would even focus on. Sometimes if we have an area that has a depression from a scar from an injury or acne scarring or just an irregularity in the skin, we actually will stamp that area just like so, and we'll hold it there for just a second. And that really kind of saturates that area as well. But it does do a great deal of difference to skin that has dimpling or real irregularities as well.
What does this feel like to you, Amanda? Does this feel like any kind of like a massage, or like, what are you feeling?
I honestly don't feel anything. The numbing medicine works really well. I guess there are certain areas, maybe a little bit towards the brow, that I really am not feeling much at all. Just a little pressure from the actual.
A little pressure, like a little massage.
Yeah, yeah. Not painful at all.
And Elizabeth, how long does a typical treatment, microneedling of the face, take? How much time do folks allot for something like this?
Typically, the numbing part of the treatment takes about 20 or 25 minutes, and then the actual treatment usually takes about 30 minhatch.
30 minutes?
For the whole face. So you're looking at about an hour total time.
Okay.
And we just move in little sections here. I like to cross hatch or go in little circle patterns, if you can see. And typically when we get down around the mid-cheek area and near the ear, we like to typically turn up the device just a little bit.
Okay.
Because the skin in that area is just a little bit thicker.
Okay.
A great area also to focus on with microneedling is under the eyes. And the area under the eyes, as we age, tends to get a little bit more crepey and sometimes a little hollow, or could have some wrinkling there. And because this builds collagen and elastin, it really helps to plump the skin up underneath of those areas, and then to also firm them. So you will see some adjustment of the skin there right afterwards.
Is there anything that people should do at home prior to undergoing microneedling to help prepare for the treatment?
Honestly, the only thing that I typically ask is that you don't go into direct sun exposure, like on a real sunny Caribbean vacation or Florida vacation, just because it does make your skin more sensitive when you're out in the sun. So I say at least a week or two prior. But really, other than that, not too much, no.
What about the recovery process? What is that like for this?
The recovery process is really pretty simple. Usually when you leave the office, you look like you've maybe had a little bit of a mild sunburn to the face. You can experience a little bit of swelling depending on the depths that we go to and the things that we're trying to correct, but usually that only lasts about 1 day or so.
Okay.
Maybe 2 at the very most. You will have a little bit of what I call skin dandruff, which is sometimes a little bit of dryness, which is just the skin cells turning over and shedding. And that is something you definitely want to see. And it means that the procedure is doing exactly what it is meant to. But after that, you can certainly, after the first 24 hours or so, you can certainly wear makeup and go back to your regular routine.
Here's a fun question. Should patients ever bring in some earphones while they're getting this done to listen to some music rather than the buzzing sound from this machine?
That's a great question. Actually, that's a great idea. Yes, you can certainly do that because it is a little bit loud.
I hope everybody at home can hear Elizabeth kind of answering a lot of these questions, because the machine is a little bit noisy, but nothing to be scared of. Amanda is very calmly just laying here and enjoying this treatment and this therapy that she's undergoing. Now, Elizabeth, I do want to touch a little bit about your acne clinic. We have so many individuals in the Brentwood area and even in the surrounding areas that have pretty significant acne scarring, and those scars can be disfiguring to a degree. And a lot of patients ask, what can I do? What cream can I use? What can I put on my face tell us about some of the things that you can offer for them to try to help with some of those issues.
Well, this treatment here, microneedling, helps tremendously, and any age person can do microneedling, really from teenage on. I would suggest that you come in for a consultation and we can actually take a look at the skin and give you some recommendations. But we also offer hydrofacial, which has different types of amino acids and minerals and topicals that we can press into the skin through the hydrofacial to help heal acne outbreaks. We also have peels that can help with acne outbreaks and that can help with pigmented scars from acne. And microdermabrasion also can help very much. The only time that you really don't want to do those types of treatments on acne is when the acne is actually active.
Gotcha.
Because if it's active and we do that, then we can spread the bacteria to other places on the face and on the skin.
How do we know if acne is active? What does that mean?
Active acne is actually pustules, or what we would call whiteheads, on the skin, and those are actually pores that are infected and they have been clogged. And if you break those by doing a treatment like this, then it can spread to other areas and become worse. So we try to get that under control first, and then we can go to these types of treatments to fix whatever is left behind.
One other question, so, acne, those scars are pretty fixed, pretty hard, pretty rigid. Is it possible that patients might need more than one treatment of microneedling to help those scars go away?
It is possible. Typically 3 to 6 treatments of microneedling is really a great goal to get the maximum result that you'd like. I do see results from it after the very first time that I have done a treatment.
That's great.
It depends on how much of scarring you have and what your end goal is. If your goal is for anti-aging and you don't have any type of scarring and you just want to firm the skin and make it look more youthful and bring back those collagen levels, you'll see results after the very first time. But after 3 times, you will absolutely see really marked results. And then after 6 treatments, you really will see kind of a reversal of the clock.
Well, thank you so much for doing this and doing this demonstration. Amanda, thank you for letting us use you as a patient for this. We are about almost out of time, but maybe I thought we could sit Amanda up just to show folks how different her face looks after just doing a half. Amanda, if that's okay with you, I'm going to get you to sit up for us, and maybe you look that way right there, and just showcase how the left side is a little bit redder than the right side. Clearly, you can see that on her skin. But very little pain, I would imagine. Not too bad?
Not at all.
That's awesome. So thank you guys so much at home for watching this. And if any of you have any questions or request additional information, or you'd like to schedule a session with Elizabeth, all of our estheticians across our entire campus do microneedling. It's an incredible treatment, can provide an amazing way to rejuvenate your skin. Go onto our website, csps.me or csps.net. And you can click and schedule a consultation. We have amazing packages that you can purchase today. Those packages can be used for treatments such as this. If you have acne scarring, my gosh, who doesn't have an acne scar somewhere on their face? This is a great way to help treat those and bring those scars and make them nice and even and try to flatten them out so you have that nice even glow. So thank you all for joining us and watching. Elizabeth,
thank
you so much for doing this for us. And follow here next, coming up, we have Savannah. And Savannah is going to be talking with Eva about skincare and creating a skincare regimen that's right for you. A very complicated thing, but they're going to show you a nice way to kind of approach skincare for your face to help you maintain that nice, youthful look. Thanks so much for watching, and we'll see you in just a little bit.
everyone. Welcome back. Coming up next, you're going to get to see Savannah and Eva. Savannah is an esthetician at our Mount Juliet location, and then Eva is a nurse injector at our Mount Juliet location. They're going to be talking to you about skincare and skincare routines, our medical grade skincare, which is top of the line, and then injectables and how they can work in conjunction. Great information for you. Get out your pen and paper, take some notes, and get ready to buy some of that skincare. It's 20% off during our special at this time. You can give us a call, 615-771-7718, to buy those products, or you can go online, click that link to do your shopping. We'll see you after that.
Hey guys, thanks for joining us for our open house today. We're super excited to talk to you today about some skincare stuff. My name is Savannah and I'm the esthetician at our Mount Juliet location.
And I'm Eva. I am one of the nurse injectors at the Mount Juliet location. Today we're going to talk to you a little bit about some of the basic skincare routines, some routines that Savannah and I personally use, as well as different skin concerns with our aging as well as younger skin types, and what we can do for those, whether it be products or using fillers and neurotoxins such as Botox and Dysport.
So we're going to start by just talking about kind of a basic routine that are just types of products that we would put in a routine for most patients, and that would be a cleanser, some type of exfoliation, some hydration, and then sunscreen is another thing that is super important in your skincare routine. So I'm going to talk a little bit about which products I personally use in those categories. And just to give you some background, I have kind of oilier skin, a little acne prone, and some of the products that I like to use are the Zeo Exfoliating Cleanser. I also use the Zeo Dual Action Scrub. For hydration, I like to use our Skin Balancing Serum from our line Skin Benefit. It's a really lightweight hyaluronic acid serum that's good for oily to acne-prone skin, or really any skin type if you just want a boost of hydration. And I also use our Elta Clear sunscreen for my daily sunscreen. And Eva, I want you to talk a little bit too about what your skin type is like and maybe what types of products you would use from those categories for your skin.
Well, I used to be oily, but now that I'm older, my skin's getting drier, so I have different needs. I love the Zeo Wrinkle and Texture Repair. It's a great retinol product that I use sometimes every other night, sometimes nightly, and that's a chemical exfoliant. And then we have the exfoliating polish that I love, which is more of a physical exfoliant. I also use some of the Elta periodically and the Skin Medica HA5.
Yeah, so that's just a little bit about what we use. We also want to go into some common concerns that patients come in asking us about and how we can use skincare to kind of correct that. One really common concern is brown spots or hyperpigmentation, sun damage, all of that sort of thing. And there's definitely several products that we could use, different protocols we could use to address that. But just to highlight a few, our Koji pads from our Skin Benefit line are great. They utilize kojic acid and arbutase, which are both really powerful pigment correctors. There's also some vitamin C in there, some salicylic acid, so they're just a great overall treatment for lots of things, but they really work well on reducing some of that pigment, especially if you pair it with a retinol. And one example of a good retinol to put with that would be the Zeo Retinol Skin Brightener. Obviously, you can come in for a consult with one of our estheticians to really talk in depth about what your skin would need, but those are just some suggestions if you need some ideas of something that you could potentially start with to address those problems. Like I said, we have several different protocols that we may choose to use for your skin. Another common concern is acne. Again, that would be something that is probably best suited with a consult, just because every acne is different. Everybody's acne is triggered by different things and has just different ways that it could potentially be treated, and would probably need to be in combination with some treatments and things. As with all of these concerns, you would probably need to do some treatments as well, but since we're focusing on skincare today, that's what we're going to talk about. But with acne, we do have a kit from ZO that is a good place to start. It has their exfoliating cleanser, which has a little bit of salicylic acid in it to help with some of those breakouts. Their exfoliating polish to give you some physical exfoliation, their complexion renewal pads for some chemical exfoliation, and then also has their complexion clearing mask, which is a mask with sulfur in it, which can help combat inflammation, clogged pores, and all of that. So if you need a place to start, that would be a good thing to start with. And then you could come in and talk with one of us to talk about what else we might want to add or supplement and things like that. The third concern would be aging. So that could, obviously be a lot of things, but, fine lines and wrinkles, textured skin, all of that is kind of what I mean when I say aging. And there are some things that we can use topically to kind of help slow that down. It's not going to be as drastic as doing certain treatments, which we'll get into. But two things that you could use for skincare that would kind of make the biggest difference in fine lines and wrinkles would be to use a vitamin C. So our Skin Benefit Essential C is a great option. Vitamin C helps with collagen production in the skin, so that's going to help to soften some of those finer lines. It's also a great protection because it's an antioxidant to help prevent further aging from sun exposure and different things like that. So that's a great product. My favorite, kind of most effective product for fine lines and wrinkles would be to get on a good retinol. Eva mentioned the Wrinkle and Texture Repair. That is one of my favorite retinols as well. That's from ZO. And it is really good for texture, fine lines and wrinkles, pore size. It's even good for acne patients. So that's a really fantastic product that we all really like here. So those are good topical things that can start the process with aging and lines, but a lot of times if that's someone's main concern, I'll also refer them to see Eva or one of our injectors here because they can sometimes address that a little bit deeper, a little bit better with different things like neurotoxins and fillers. So I'm going to kind of pass it over to Eva and let her talk about how that would kind of combine with those skincare products and what she recommends for a lot of patients.
Thank you, Savannah. Yes, Savannah and I often work closely together in trying to provide the best consultation and treatment options for all of our patients, whether the patient starts with me for fillers and neurotoxins, or if they start with Savannah for facials and skincare. We try to consult with you based on what your desires and goals are and give you the best outcome. It's best to consult with one of us first, depending on the area you think would interest you the most. They work very differently, but they're very complementary. With fillers, we're going to be filling shadows. We can increase volume in the face where we lose that as we age, considerably each year actually. And with neurotoxins, we can selectively paralyze the muscles in the forehead, around the eyes, in various areas. Those are just the most common areas. And they work very complementary together. When we do a treatment of Botox and filler, a lot of times they can be done on the same day in the office, and then you can come back in 2 weeks and either see Savannah and have a follow-up with me. At that time, we can consult with you about your skincare products that you can start using at home. And we would love to see you in the office, either on a monthly basis or every 2 to 3 months for a regular routine of treatment and follow-up. Is there anything else, Savannah?
Yeah, I think that's pretty much covers everything that we wanted to talk about today. If you guys have any extra questions, feel free to reach out to us or the office. I know that they're doing a live chat right now, so you can ask some questions there, and we should have somebody answering that, or you can reach out to either of us personally. I hope that this was helpful. I know we talked about a lot of different products and things like that, but hopefully you got some good ideas of maybe something that you could start with, even if that's just a sunscreen or something like that, because that's one of the most important things we can do. But we enjoyed talking to you today, and let us know if you need anything else. And don't forget to take advantage of the specials we have going on today. Lots of awesome packages and discounts and lots of fun things. So I think next is going to be a laser segment, so make sure you stay tuned for that. That's going to be super exciting.
folks, we are back, and we are now beginning the laser segment, one of the more exciting segments of our program today. And I'm sitting here on the couch, joined by my partner here, Angel, and we are going to be speaking with Destiny, who's all the way on the right, and Heather here on the left. Heather, you guys have met in an earlier broadcast. Destiny is new to our broadcasts this afternoon. So combined together, both of our, Heather and Destiny are both estheticians. They both work at our Brentwood office, and they have oodles of years of experience. So Heather's been doing this for about 7 years. Destiny, you're about 4. And they do all things aesthetic, meaning facials, hydrofacials, we do lasers, we do peels, we do microneedling, we do everything. And then all therapy as well. And then Destiny actually also is our cool sculpting expert for those individuals who are looking for a non-surgical way to reduce some of that excess fat, I guess I could say. Right, Destiny?
Yes.
Okay, so we're going to start a conversation today. We're going to be talking about BBL, we're going to be talking about Halo, and then we're going to be talking about the combination of BBL and Halo, and why is that the way to go? So.
Right, here we go. So, we're going to play a video. Heather, walk us through what you're doing and why you're doing it.
All right, so this is a BBL of the chest. So this patient just has pretty even skin, but she also has some freckling. She's on the younger side. She's in her mid-20s, and she just really wants to do more prejuvenation. She doesn't have a lot of abnormalities to correct. So we're doing a BBL, and this is targeting her brown pigment, a little bit of redness in her skin. She has a couple little angiomas on her chest that I'm treating as well. And with this treatment, while we're correcting hyperpigmentation, we're also stimulating collagen. So that's going to help for the ladies that get a little bit of the crepiness in the chest area. That's going to help to stimulate collagen and help to smooth her texture as well.
Wow, that does many things.
It does a lot. It's incredible.
BBL.
Destiny, what is BBL?
Yes.
What is this?
Great question.
So BBL is very similar to another treatment y'all might have heard of, IPL, which is intense pulse light. This is going to be broadband light, which is from the brand Cyton, and that's the device that we use here in the office. So there's a multitude of different things that we can treat, but this is more specifically for pigmentation, but also adding on from the heat of the treatment some collagen stimulation and production. So we can work on redness, rosacea. We can work on facial vessels, those little cherry angiomas that Heather's treating right now on the chest, sun damage, freckling, age spots, just a bunch of different pigment issues.
Heather, can somebody just walk in off the street and say, hey, I want this done on me today? Can we have this done?
No, not at all. Consultation is absolutely necessary.
Absolutely.
There are a lot of things that can go into doing these treatments, whether it's the BBLs or Halos. We have to make sure the patient is the right candidate for it. So skin tone comes into play when we're doing BBL. When we talk about Halo, we can do all skin tones, but for BBL, we can do more of the lighter skin, mid-tone skin tones. We cannot treat patients with very dark skin. There are a lot of complications that come with that. So we have to make sure, number one, are you a right candidate based on your skin tone? There are also contraindications or risk factors involved as far as direct sun exposure. So if a patient has had recent sun exposure where they have a little bit of tan or a little bit of pinkness to their skin, that can cause burning and it can cause some scarring on the skin as well. So that's a pretty big complication, sun exposure before and after a treatment. And then also spray tanning or sunless tanning products are a contraindication as well. So it's really best, do the consultation, make sure you're a candidate. We also will go over the skin goals, concerns. Sometimes we have to pre-treat a patient with pigment correctors, retinols. We always want a patient on sunscreen.
Yes.
So those factors have to be put in place before we can get on to the schedule. And then we also have to talk about pricing and downtime and lifestyle things and that stuff.
So Destiny, that brings us to a great question that I'm sure
I was
you're
just
going to
gonna
ask.
ask.
Destiny, downtime. So after this, you have this procedure done, you walk out of the office. What are some things that folks need to be doing to protect themselves from potential disaster?
Yeah, so I tell a lot of my patients after your treatment, put some of your active skincare products to the side and focus more on being very gentle on your skin. So we don't want to use a lot of exfoliants, treatments, whether that's physical or chemical. Cleanse, moisturize, SPF during the day, and then at night I tell them really just to cleanse and then moisturize. So a patient can walk out of the office feeling a little bit warm from their treatment. I get very pink and kind of splotchy, which that can take a little, a couple of hours to kind of tone down. Some people might expect a little bit of swelling, typically around the eye and the cheek area. You can also notice a little bit in the lower face. A lot of the pigment, so some freckling, sun damage, you can expect those to look darker. So sometimes someone might look in the mirror and be like, oh my gosh, this didn't do what I wanted. That's actually something that we want to see after a treatment.
That was going to be my next question is when having this done and I'm walking out of here at the checkout desk and I look in the mirror, am I going to look completely awesome or is it going to take some time for the results to set in?
Yeah, so you're not going to look amazing. We're going to tell you look great because we're already seeing what we want to see happen. We see the brown pigment flushing to the surface of the skin. We see some erythema or pinkness of the skin. Sometimes we'll see a little bit of bruising if we're working on some vessels. So we'll tell you look amazing, but you won't really look amazing. It usually takes about 7 to 10 days for the face to get back to normal. Swelling, if you do swell, that's typically whenever we're working on a lot of redness, rosacea, broken blood vessels around the cheek area. Swelling is a possibility, can last for a day to 4 days. Brown pigment, when that flushes to the surface of the skin, that can last about 7 to 10 days on average. If we bruise you, that could last as long as a bruise.
So Heather, thank you for that. And let's take a look. So right here, again, for the folks at home, all of our pictures are arranged in order. So we have left side of the screen, which is the side that me and Angel are on. Those are the befores, and you progress to the afters from left to right, just to orient everybody. So Heather, walk us through. Tell us about what we're seeing here and the improvement, because this woman looks amazing.
She had a fabulous result. So when she first came in to see me, she has, and you can't really see on this view, but on this left eyebrow, she has 3 really large dark brown spots, and that's what she wanted corrected whenever we met for her consultation. And of course, we want to look at the bigger picture. We want to address your concerns, but we want to see, are there other things that we can correct all at the same time? And so I said, well, you have all of these little freckly spots. We can fix those
So Heather, she just came in for those 2 spots on her left brow. That's it. And you did, wow.
Yeah, it's great. It was great. So yes, so she came in, we did the initial treatment, and then each picture shows her progress because she did a series of 3 BBLs, which is what we really do recommend. So this was at the beginning of her 2nd treatment, this was at the beginning of her 3rd treatment, and then this was about a month or so after her last treatment.
Wow.
And then she has been coming in yearly to get her once a year BBL for her maintenance. And she's also been maintaining with skincare products, pigment correctors, retinols, and also daily sunscreen as well.
She has that once a year. It's like a booster.
Oh, there you can see.
I can.
3 dots over there.
It's fabulous. And those are gone.
Yeah. So the thing is that people will ask is, why do I need to do more than one treatment?
Yes.
So this shows that, the 3 spots she really didn't like, those are pretty much gone on this. But we can see the progression where a lot of her other brown spots continue to improve. Texture is really hard to see on photographs, especially with something this big. Her skin just got smoother and smoother and softer with each treatment, and she actually was reversing the aging process with each treatment.
Heather, this looks amazing. I mean, it literally looks like she's years younger just by progressing through 3 treatments of BBL. And again, this is non-surgical, right? This is all done in our Brentwood office. Somebody can go home the same day, right? And they're doing okay.
Absolutely.
They don't have to limit their life, hopefully, too much.
Yeah, I think one kind of cool thing that we can add in too is that you can wear makeup immediately after your BBL treatment. Compared to some of our other treatments in the office, there's no issue with that. So you could come in during your hour-long lunch, get a treatment, bring your makeup, throw it on, and go straight back to work if you wanted to.
That's so good to know. That's fascinating. So tell me the price of one.
So for the full face, it's going to be $495.
Full face, okay.
Full face, neck is $200, and then chest is going to be $495.
Great. So this is great information for our viewers. Now, remember, if you have any questions about the BBL or any other laser options that we're going to talk about, please send those in. We can ask these wonderful ladies and get you some information. But that pricing is good to know. Remember, we've got our packages. But moving on, let's talk about the halo. Next awesome halo. Well,
Here we go.
Bless her.
So this
Angel knows this all too well.
So this is one of our favorite people in the world. This is our dear friend Olivia,
Love
who's
you,
one of our
Olivia.
injectors. And I did a halo. I actually did a BBL and halo on her January
last year,
2021. Yeah. So this is the demonstration of the halo. So the halo is a laser, where the BBL is a light.
Okay.
And so Olivia has a tendency to freckle really easily when she's exposed to the sun, but she also works here, and we want to do a lot of prejuvenation, rejuvenation. So she likes to do a halo. I think it's like every other year.
Every other
it
year,
seems we
yeah,
do it.
it seems.
So she likes to do a halo just to keep working on the deeper sun damage, and then also just, firming, tightening. So I get a lot of questions about pain during halos. She obviously has a tube in her mouth. This is nitrous oxide or Pronox. It's the laughing gas that's given at the dentist office.
Right.
So she is just sucking away on this gas. It's a pretty comfortable treatment once you have the gas. And we also like to do over-the-counter medicines, Tylenol and ibuprofen as well prior to the treatment. But basically what I'm doing is just taking the device and slowly rolling over the skin. And the little white polka dots that you see, that is part of the ablated part of the laser. So this is a dual laser. It's a deep laser and a more superficial laser. It's the world's first dual laser. And so the little white dots are actually ablated skin cells. They're the skin cells are vaporized. The water is vaporized out of it. And that's basically the dust of the cell left over, which is kind of fun to see.
And so you're wearing special goggles and glasses?
Yep.
You want to talk about that, goggles? Yeah, so we just wear those for protection. We always want to have at least somewhat of a barrier, but you can see above the brow, Heather actually did go into the brow and a little bit on the eyelid, and that can help boost the collagen there. It's going to help further improve her skin tone too from the BBL that they did, and it can even give a little bit of like a smaller lift to the eyelid too.
So there is tightening, and so you can go a little bit onto that brow area.
Yes.
That's great to know.
We don't treat over the eyebrow whenever someone has had either tattooed eyebrows or like microblading.
Okay.
So just one thing to consider before your treatment.
Okay.
Something cool too about the treatment that Heather's doing on Olivia right now is that you can see some of the darker pigment that's come to the surface, or I don't know how well you guys can see that online, but I can see it here. The freckling has become a little bit darker, and the good thing about doing a halo over the top of your BBL is that the halo essentially is going to polish off some of that pigment to just helping further improve that, as well as the collagen and smoothing and anti-aging.
So real quick, halo before treatment, what are some things people need to be doing to protecting their skin before, and then talk about maybe the after as well, Heather. Just briefly.
Some downtime. So halo, because it's a laser, that can be done on any skin tone. So from very light to very dark, we can do it on any skin tone. Clearly, when we get into darker skin tone patients, we have to have precautions as far as the settings we use. We cannot go super aggressive because we can cause pigmentation problems, but we still can do this treatment on all skin tones. We do like to pre-treat patients prior to halos. We do for BBL as well, but halos, we really do like to pre-treat with a pigment corrector, something like Lytera, Koji Pads, Bright Alive, prescription hydroquinone. We do retinol with it as well, and then of course a daily sunscreen. The same sun rules apply as far as no direct sun a couple of weeks before the halo and after the halo. There is more downtime with the halo, so patients have to kind of usually work around their schedules a little bit more to kind of make that happen a little bit easier.
How long is their face red after this treatment? How long does that last?
Well, you did mine. You tell them about it.
So I usually tell patients by day 7, you're going to feel very much so or more back to normal. I think one of the main aspects of the downtime from a halo is the amount of swelling that you get. I tell my patients tomorrow morning, you're going to wake up and you're going to notice a lot of swelling, kind of like the BBL, but more intense. up here in this cheek area in the under eye. The next day, it's actually going to be worse. So you're going to look in the mirror, you're going to say, surely this is not normal, and it's completely normal. I think Heather can say this too, but patients will text us, email us, send us photos, and they're like, what do I do about this? And it's all to be expected. Usually by the third day, swelling's plateaued and starts coming down from there. You can sleep elevated if you want to help with some of that. And then from there, most of what you're going to notice is just your skin really dry, and it's going to slough off, and you'll notice it kind of pill up when you cleanse in the morning and the afternoon.
Makeup. Can you put makeup on after a halo? How long do you wait?
A few days you have to wait.
Okay.
And so another question, skincare, are we going to keep that off to the side again too?
Yes, so retinols, if you're on tretinoin, any active ingredients, vitamin C's, glycolic, salicylics, be super gentle, and you also don't want to rush the process of your skin sloughing off. Be as gentle as possible. So even patients will ask me, well, can I use my Clarisonic to help clear it up? Can I use a washcloth, scrub? All of that you just kind of have to set to the side and kind of deal with it for about that week.
Let the process take its course.
Exactly.
I do have to say, after I had my Halo BBL combo, I did come into work that 2 days later, and I had to do something here at the office, which, we work here and we do this all the time. So it's not like some people having to work in front of people and do their, presentations for people. That might be more, they might need to stay home. But I work here, so I came on in. But I did let Dr. Moore have a little look-see at me to make sure I was okay. And the first thing he said was, you had a Halo BBL. I mean, I looked exactly like I was supposed to look. So there will be some, wow, that's a pretty big swell.
Right. On the occasion, we do get the occasional patient that comes in with their face very swollen after a treatment. Yeah. And sometimes it can be, pretty profound. And it's just, you always, if you're ever concerned about something after a procedure, if you're ever worried that something is abnormal, it doesn't hurt to just call our office, get in touch with your provider, and just make sure that everything is normal, because you don't want to assume that something is normal and for it to not be normal. Right, ladies?
And we also, because I've had a number of halos, Angel has too, a lot of our pictures are up on our website and Instagram, but when I have a patient that's a little bit more nervous than others, I will pull up my pictures. I'll sometimes show them your pictures and just say, this is the timeline of what you're going to expect. And I find that a lot of patients think, oh, well, that won't happen to me. Like, I won't be that swollen. It is. It's just several days of your life, and it's great.
And the results are amazing.
So we've talked about Halo. We've talked about BBL as two separate entities, two distinct individual procedures. BBL being using light therapy, Halo using a dual functioning laser therapy. So now, ladies, we're going to shift to patient number 3. And this patient received a combination therapy, right? We did Halo and BBL. Tell us about that and why that sometimes makes a lot of sense.
Yeah, so this is one of my patients, and I actually just saw her back in the office earlier this week for her follow-up to take her photos. She came in during her consult and was very concerned with just her skin tone. So you can see that she has a good amount of freckling and sun damage that she wanted to work on and kind of correct. She's out in the sun very often. She plays pickleball outside. So she wanted to do a good treatment before the summer months, before she is outside, where we couldn't really get in a treatment for her. So I explained to her that her best result with just kind of, I don't want to say a one and done, but like the biggest bang for her buck would be the BBL Halo. After talking, she had decided that she kind of just wanted to stick with the Halo. So I kind of explained to her, showed her a couple of before and afters of just a Halo compared to the combination of the two. And then she decided to do the BBL Halo and was very, very happy with her result.
Great results.
During her consult too, we talked about doing this and then coming back in after the summer months. You can see that she still does have some spotting, some pigment. Overall, it's definitely more clear and more vibrant. But she, when I just saw her for her follow-up, was like, okay, what are we going to do next? What are we going to work on? So there's definitely still some cleanup that can happen. And we talked about the next time she comes in, most likely doing a series of BBL and then another halo to help more with firming and tightening.
Right, right. Those are great results with the combo treatment. We're getting lots of questions from our viewers. Are y'all ready for me? Or do you have something?
No, I've got something, but you go ahead. Fire off the viewers' questions first.
So, a lot of questions about melasma and rosacea, and if any of these are helpful.
So melasma is a contraindication for BBL or IPL. So if you go to another office and they don't have a Cyton device, that's IPL. Destiny mentioned it earlier. The light and heat from the BBL device can be a trigger for melasma. I have actually had patients where we didn't know they had melasma. We did a BBL and they came back and it's like, oh no, we have melasma. We didn't cause it, but we just caused it to come out a little bit before it was ready. So we don't like to do BBL with melasma. Halo can be done for melasma treatments. I don't love halo for melasma. We have protocols for it. Some patients get great results. I actually prefer the chemical peels that we did earlier. I think you do too.
I would like to tell the viewers, if you want to rewind, if you weren't here earlier to see that about the chemical peels, that was an excellent treatment for that melasma. Rewind for that one, look at that. But let's keep talking about halo BBL.
Yeah, halo I don't love for melasma. We do it. I prefer the chemical peels. Rosacea. Gold standard treatment for rosacea is IPL or BBL because we're targeting pigment with BBL. So that's going to be brown pigment or excess brown pigment and redness, broken blood vessels. Amanda talked about it a little bit in her sclerotherapy session. So rosacea is excellently maintained with BBL. For patients with more extreme cases, and we'll see a picture a little bit later, normally we'll like to do 3 BBL treatments. It's just kind of the standard that we like to do. For patients with extreme rosacea, extreme redness, lots of vessels, we might need to do 6 treatments and then do a maintenance every 2 or 3 months to stay on top of it. Products are necessary when we're dealing with melasma. Products are necessary with rosacea. Often we'll work with dermatology to have prescription products that they prescribe for rosacea, and then we maintain with other things that we have in the office. But BBL, IPL, excellent for rosacea, not great for melasma.
Great questions, great answers.
And I can also do halo, or we can also do halo for rosacea as well because that helps with the deep flushing.
I wanted to ask a quick question while Angel's pulling up another one from our audience. You know, a lot of the folks here in this area, they have great skin. They get exposure to sun during the summertime. I like to tell a lot of times for my own patients, look, if you want to maintain, you don't have to have, a lot of signs of aging. If you want to maintain your skin, come in the fall, Halo BBL combo, once a year will literally save you so much aging down the road. Is that a true statement or a false statement?
It's a true statement because Cyton has actually proven that through their clinical studies. They have a protocol called Forever Young, and there is a study. It's on their website. I talk to patients about it. I think you do too as well. So we're basically reversing the clock by doing these treatments. We're working on current sun damage, current skin conditions, and also deeper ones that we don't know about. Like for Destiny's patient, this lady has had decades of sun exposure.
Right.
So this isn't going to be a one-time thing, but we will be able to reverse the clock by sometimes years.
It's amazing. Let's look at another picture.
Okay, so
We've got some more great pictures for you. Oh, wow.
Wow.
So this is one of my patients that I've seen for years, actually, and she's just never really wanted to do more advanced skin treatments. And we just kind of talked again this summer, and she said, I'm just ready to pull the trigger. So she went ahead and did a BBL halo. So she has had decades of sun exposure. And while she's wearing sunscreen and, doing skincare products, those only go so far. And then we have to come in and do some cleanup in the office. So we did a BBL halo on her, and we also went down onto her neck and chest. Those pictures are on our website as well. But this is after one BBL halo. And she was just absolutely thrilled.
I mean, that's amazing.
She came in months later for another one.
Great results. And it's you even see the tightening. The tightening was very impressive too. It's so good.
The benefit of these lasers is incredible.
It is.
Huge adjunct to the armamentarium that we have available here at the Brentwood office at Cool Springs Plastic Surgery. So feel free to schedule a consultation by calling
615-771-7718.
Angel's so good at that. Okay, so another patient. Heather, tell us about what's going on here. What are we seeing here? All this redness.
So this is kind of going along the line of the question you just asked about melasma and rosacea. So this is kind of a special a case where the patient has both melasma and rosacea. Well, melasma is a contraindication to BBL. Holy cow, how did I do this? Well, I'm glad you asked. She has the primary area of her rosacea is across the mid face. So that would be across the cheek on the outer part of her eye, across the nose, and then onto the chin. You can see on this picture, her melasma comes along the ear and jawline and down. And then on another view, she has it, you can see it a little bit better, but she has it up on her forehead as well. So for me, treating her, I had to stay away from the melasma, but treat the rosacea. And so I avoided the brown pigment settings that we use that can actually trigger more melasma. I just avoided that altogether and only worked on the redness and the vessels on her skin. And this was after, I think, 2 treatments. She has, she said that she has been to lots of different offices, had other kind of laser type treatments before, and just didn't see results. And she was really wanting something new. She saw some before and after pictures on our website. And so she is actually using just 2 of our skincare products. She's using a redness reducing serum from Illumier called Calm R. It's what I want all redness and rosacea type patients on that see us. And then she's also using Elta Clear, which is a sunscreen specifically for acne prone skin, hyperpigmentation, and rosacea. So those are the 2 main products that she's using. And she just has such a good result. She has been so happy.
So great. How often would she need to be treated?
So she's going to come in about every 3 months for maintenance. Now we're avoiding treatments over the summer because she, I just don't want to take chances of melasma flaring up with the sun, but she's going to come in about every 3 months to have her treatments.
All right, so I have more questions. Are we good?
Yeah, keep going. I've got a couple myself that I wanted to shoot maybe while Angel locates the perfect one. But for all the viewers out there who are at home and they're watching the show today and they don't really know what they could potentially need, what do you recommend for those individuals to do? How would you approach, or do you think they should just come for a consultation? Do you think that they should check online pictures, look at other people's videos?
Yeah.
What are the steps that you would advise for someone to take when they're like, hey, I am aging, I'm in my 20s, 30s, maybe early 40s, and I don't want to get old fast. What do I do?
Yeah. So I always encourage the consultation, and we need to do that anyways before a laser treatment, or even obviously other things in the office too. It's just your best bet to come and do that first. You can of course look at before and afters to kind of get maybe a good gauge on what you're wanting to work on. You can maybe see a patient who you're like, okay, my skin kind of resembles or looks similar. This person did this. So a lot of times people come in, and especially too after calling to set up their consult, they can explain some of their concerns to whoever answers the phone at the front desk. They're very knowledgeable and can explain a few different treatments just in a little nutshell. So that way a patient's like, okay, I think I want to talk about BBL. Well, they might come in, have melasma, and we might suggest the chemical peel and skincare at home. So that's just definitely going to be the best thing that you can do so you can get a better grasp on downtime. Some people come in and they have no idea what to expect. A day, a month, they have no idea. So it just covers all of your bases so you're much more comfortable and confident before you do a treatment.
Which offices that are at Cool Springs Plastic Surgery offer consultations regarding skincare and lasers? Is it just here? Is it at all the offices?
So all of our offices have consultations for injectables and also aesthetics with an esthetician. So any office can see a patient for that. The lasers, the BBL, the bigger devices, those are done at Brentwood. So even if somebody sees one of our providers in Mount Juliet, they can still thoroughly talk about the treatment to that patient. And then of course, we're all connected. Our computer system is connected, so we can just go under the notes, see what was discussed in that appointment, and then when the patient arrives, we already have an understanding, so they don't have to tell us everything all over again, and then we just are ready to do the treatment. So they don't have to come in to see us again if they see one of the providers at one of the other offices.
That's a great question and a great conversation. We are a great team. We're able to work together in that way and help each other out in that way. The machines are here, but the information is all over at all of our locations. Now, tell me, what body parts, halos and BBLs?
Great question.
We can do face, neck, and chest, and Heather actually can speak to some experience that
For
she's
both of
done
them?
on the body.
Both of them.
So yes, we can do BBL. We can do BBL anywhere on the body. Halo can be done anywhere on the body. Keeping in mind the halo face, we talked about that being uncomfortable, lots of swelling. So if you want an entire leg halo, that's somewhat maybe unreasonable at times.
Okay.
But yes, we can basically BBL anywhere on the body. The halo, it's usually more specific to a certain area. But yes, BBL can be done. I will say, as far as the results go, off face, neck, and chest, we get the best results with the first 1 or 2 treatments on the face, neck, and chest. The other parts that are arms, legs, backs, they need usually more treatments. They are often more exposed to the sun than our faces, necks, and chests because we put sunscreen on and we're careful with that. So those will often need more treatments to see the better results, but we can BBL anywhere. Halo's more specific.
Right, right. That's such great information. So,
Pain-wise, we had Olivia. We were looking at. Olivia was using the Pronox, right? So, tell us about that. How does Pronox work? Does it last a long time? Do you walk out of the office feeling weird because you were on it? Can you drive yourself home? Like, tell us about that and how that's used.
Yeah, so Pronox, and Heather talked a little bit about it earlier, but it's essentially like a laughing gas. So if you've had laughing gas at the dentist, it'll feel kind of similar. You just breathe in through your mouth and out through your mouth through that little tube that was shown in Olivia's mouth. Pronox makes you, I have some patients who get very slap happy. They laugh. I actually did a BBL halo on one of our coworkers, Teresa, who was so nervous before her treatment and just had the best time, and immediately after said, I would do that whole thing over again.
Oh, good.
So she was very happy. Sometimes it can make people a little bit confused, just being honest. Sometimes people will kind of feel or think that something's going on in the room that's not happening. It makes your treatment feel kind of sped up. So sometimes I'll finish a full face. I had a patient last week who said, did you do my forehead? So it can be a little bit confusing, but that's why we like it, because it helps a lot with the pain management, makes the treatment go by a little bit quicker.
Makes the patient comfortable.
Yes, very comfortable, and it soothes some anxiety that can happen before your treatment, but you can drive yourself to and from. Pronox is out of your body within a couple of minutes. So
One other question, really important, because we here in Tennessee get a ton of good old Tennessee sun, especially in the summertime. The best time of the year is to do these treatments, or when should you not be doing these treatments because of the ambient light that we're surrounded with on a daily basis?
So we really try to advertise these treatments to be done through the fall and winter and early spring, just because for me, I don't like to be in the sun. I don't like to be hot, but I get sun. I mean, we're just in the sun, and there is such non-negotiable sun restrictions that we will cancel a treatment. If somebody comes in and they look like they've had sun or they've been in the sun, we'll cancel a treatment. So really getting into this time, because kids' soccer games and baseball games and things like that, people are outside. There are patients, of course, the exceptions that truly are not outside, and we'll do them year round, and that's fine. But really fall, winter, early spring. Now, if you're a jet setter, if you have a home in the Caribbean and you're there all year round, then that's also a little bit of a pickle. But for most of us, we're kind of landlocked in Middle Tennessee.
Fall and winter and spring.
Early spring.
That's the best time. So right now is a good time for one right before we head into the summer. But we're getting close to the summer. So, but I have pricing questions, and then I have an exciting little getaway. I mean giveaway, not getaway.
Oh,
I'm trying to get away.
I don't know. That's what I thought too.
Oh, sorry, we're not going anywhere, y'all. Stay tight. So, let's talk pricing. You talked about BBL, face, neck, and chest. So let's talk halo pricing.
Do you want to go? It's okay, it's fine. Halo face is $1,200. Halo neck is $600. The chest is $900, and the hands are $500.
Hands.
Yeah, hands. One thing to remember about pricing is when patients come in and start talking about their face, they just automatically, naturally think that this is all the face and that it's all the same price. And it's not, because they're different anatomical parts. So just be advised that if you want to treat your face, the neck is separate, the chest is separate. So
great information. That's really good information.
Especially for our packages.
Absolutely. Also want everyone to know about our packages. Now, we have our bronze, silver, gold, and platinum. Man, I struggle with that. I'm so sorry. But we have those package options for you. You know, you could buy one BBL for the face and then have money left over for a Botox treatment. You could buy a package with one halo face and then make sure you're getting the correct package and have some money left over for some skincare or something else for you. So there's several options. Make sure that when you call in, you could talk to somebody on the phone, talk about the options you want to do, and they can advise you on the best package. And that money will be sitting on your account. You schedule your appointment, and then you come in, do the procedure, and you can walk away because you've got your money in your account ready to go.
Perfect.
And then remember, we're scheduling a consult with these ladies or one of our estheticians and going to talk about that, and then you move forward with that procedure.
Yes, so not necessarily at the same time are you going to receive the treatment. That's important because some folks will come and say, oh, I thought I was going to get my treatment today. And we
try to say that over the phone. We try to be very, very careful about that, just to know. But I know somebody's going to call us, oh, I've got to come in for my BBL. I know, but let me get you for a consult first. And so there might be better options for them. So everybody can go online now, check out those pricings on those packages. You can click the link below to do some shopping. You can call our number, 615-771-7718. Remember, that's for all locations, one phone number, and then you can find out information there. If the phone lines are busy or you can't get in through, I think everybody can get through. But also know the online shopping is a great option for you. You can also schedule those consults online at csps.me. Thank you.
Or net.
And then, so thank you so much.
Thank you both.
So informational.
Awesome.
Great.
Amazing results.
Great pictures.
Great job taking care of your patients.
Man, we're just awesome.
What's next, Angel?
Coming up next. Oh, giveaway.
The getaway.
The getaway.
Okay, real quick. Draw a name.
Oh, you want me to do it again?
You get to go again.
I'll go from the bottom again.
Okay. One BBL treatment we're giving away right now. One BBL treatment. Don't say the last name.
K.
Beautiful.
Jamie K.
Okay, that's so exciting, Jamie. You won a BBL.
Yes.
So we will contact you, Jamie. We will let you know when you can get to do that. And then, ladies, thank you so much. Y'all stay tuned. We'll be back with more great segments coming up.
And next, we've got some super exciting surgical segments coming up, right?
The big stuff.
Heather's actually going to come back for our very final segment when we talk about combining facial surgery with non-surgical facial treatments and like halo, BBL, lasers, skincare, etc. But at the same time, the first part of our surgical segment is probably one of the most exciting. We're going to give you a behind-the-scenes tour of what it's like to be a surgical patient here at Cool Springs Plastic Surgery. We're going to give you a tour of our OR, the actual operating room, the recovery room, and the whole shebang. So make sure you stay tuned, and we'll see you when we're back.
Yep, come back.
Hey everyone, I'm Dr. Conrad Soroshik, and on behalf of myself and Dr. John Moore, we welcome you to the 4th annual open house. We are super excited to share this experience with you today, especially as we begin the last segment, which is our surgical segment. We thought there was no better way to start off this part of the program than by giving everyone a behind-the-scenes tour of what it's like to be a patient in our surgery center, which is conveniently located right here in our Brentwood office. So I am currently standing in the main lobby as you enter from the parking lot into our building. Here we have an elevator. This elevator can get you upstairs or the staircase behind me. The elevator, you just hop in, push 2, 2nd floor, and it will take you right up to our surgery center. Or if you're somebody who wants to get some steps in, there's a nice, beautiful staircase that wraps around that takes you right up to that 2nd floor. So come on, follow me as we continue this tour. Welcome to the 2nd floor lobby here at Cool Springs Plastic Surgery. Our clinic space is located on the left side and our surgery center is off to the right. Patients will come here in the morning with their families. Prior to surgery, they will be greeted here at our reception desk and then be able to sit in our lobby and relax while their loved ones are undergoing an operation. Our lobby has coffee, water for our patients' families, but not for the patients themselves, because remember, you can't eat or drink anything before surgery. After that, the patients themselves will go on through these doors right here, and this is our surgery center suite. And Kayla over here is one of our receptionists. Kayla will greet people as they come on up the stairs and say hello and help point you in the right direction. So don't be afraid. Follow me and let's go to the surgery center. So here we are in our preoperative room. This is where patients would come in the morning prior to undergoing surgery. And I'm here standing next to Holly. Holly is our OR director. Holly, what can patients expect to undergo during their surgical experience before surgery in this room?
So we'll bring the patients in the morning. We'll go ahead and let them change into the gown. We go ahead and sign consents. We get their vital signs. We provide them a nice warm blanket. After that, the surgeon's going to come in. He's going to do his markings. You'll have a chance to talk to him, ask him any last minute questions you may have. We'll have a chance to talk to anesthesia. He'll come in and discuss anesthesia protocol. And then also our OR nurse will come in and you'll have a chance to talk with them as well.
So a pretty robust experience right here in this very room. The important things to take away are you're going to be greeted by all the staff who are going to make you feel welcome and comfortable about your journey and experience with our surgery center. You always will have an option to ask your surgeon questions prior to the beginning of surgery. And once all that is done and complete and everybody agrees that this patient is ready for surgery, we will take you into our OR surgery suite. So follow me as we continue on. We're going to show you what an actual operating room looks like. We're going to show you the layout and where you would be. Follow me as we go in through this door. So here we have the operating room suite. We have our staff here.
Hi, I'm Sam. I'm one of the scrubs here.
And over here we have Rebecca.
Hi, I'm Rebecca. I'm your circulating nurse, and I'll stay with you while you're in the OR.
So as we come into this room, the surgery would happen here on this OR table. We have our anesthesia equipment right behind me here. Once the surgery is complete, we would bring a stretcher inside and we would get you on that stretcher and off to the recovery room we go. Follow me. And here we have Maria. Maria is one of our recovery room nurses. So Maria, as patients come out into our recovery room, what can they expect here?
Yeah, we'll make sure that you're awake. We'll make sure that you're comfortable, pain's under control. After a little bit of time, we'll get you dressed and help get you ready to go meet your family and get home.
Perfect. That's the whole experience. Pretty smooth, pretty uneventful. Our patients come in, have surgery, come through our recovery room, and end up going home to recover in the comforts of their own families. So I'm now walking in the clinic on the opposite side of our lobby here on the 2nd floor of our office in Brentwood. The clinic is where patients would come for their initial consultation to meet with their doctors, to have a better understanding of which procedures might be right for them. These meetings would happen in a room just like this. This is an opportunity for the doctors to explain the procedures, the risks, the complications, but also to be able to answer your questions that you might have regarding any procedures that we are potentially going to do. Our nurses here are incredibly amazing. They're very well trained to take care and provide the best level of care for every one of you, whether it's before surgery or after. So Dr. Moore and myself really wanted to let everyone know that we are just so grateful that we are able to offer an on-site surgery center here at this office in Brentwood. The comfort and convenience is beyond incredible to be able to come to the same building, to have exceptional care, to meet with doctors and nurses, then to go off, have surgery, and come back and receive all of your follow-up care right here in this very office. Our surgery center is fully accredited and certified by the Quad A as well as CMS. Our staff has been hand-picked by Dr. Moore and myself to provide you with the most exquisite, amazing care throughout your journey of plastic surgery. Our staff here has a combined experience of over 130 years of taking care of patients just like you. In that regard, thank you so much for joining us here today and giving us the opportunity to share with you what a typical experience might be like for an individual coming in to take part in plastic surgery at Cool Springs. Our office here is available and open 5 days a week, and we offer surgery 5 days a week as well. Thanks for watching. Hope to see you soon.
So that was the OR. Wasn't that a great tour? It's a beautiful location, and we are so blessed to have that here at the Brentwood office. It's 2 state-of-the-art operating rooms where Dr. Moore and Dr. Soroshik can do most of their procedures. Now, coming up soon, exciting part, Dr. Moore and Dr. Soroshik are going to be doing a mommy makeover panel. You'll get to see some great before and afters and hear from those 2 great men. So stay tuned. We'll see you in a second.
And we're back, and we are back for the final segment of our show today. It's been a very long road. We started around noon today, and we are now approaching around 5 o'clock, just a little bit after. So thank you to all the folks at home who have stood by and watched and learned, hopefully, a lot of good information about the amazing services and the amazing things that we provide here at Cool Springs Plastic Surgery. I wanted to take a few seconds just to acknowledge Dr. John Moore. So I'm Dr. Sarosik. For those of you who are just joining us, we've been kind of doing this whole fun show here. I'm now joined by Dr. John Moore. Dr. John Moore founded and started Cool Springs Plastic Surgery 25 years ago. So this is a very monumental year for us, Dr. Moore, that 25 years of your hard work and dedication have culminated and brought us here to where we are right now in our 4th annual open house. And the magnitude of what you were able to accomplish during that 25-year period, all the amazing staff that you have trained that have come through this office, that are still working for this office, that care so deeply about this, the enterprise that you have built, speaks volumes about your leadership and your character and your style that you've brought forth. And I just want to say thank you on behalf of all of us employees, to you, to your wife as well, Mrs. Moore. I know that you've had a solid right hand stand by you the whole way through, because it's not an easy journey, but 25 years of this practice existing today. So Dr. Moore, we all applaud you.
Well, thank you, Conrad. And I would like to say that we love our patients, we love our jobs, we love our team, and it's been a lot of fun to be here for the past 25 years. I've really, really enjoyed it. And we have seen a lot of transformations, and we're about to talk about one.
Yes, we are. We are about to talk about some mommy makeovers, and hopefully we have many more years to go. So without further ado, we're going to start with our first surgical segment. We hope you folks at home have enjoyed the little tour of our OR. It's an amazing opportunity to kind of see and get an inner glimpse of what it's like to be in an operating room and what it's like to move through that pre, post, and during surgical process, as well as our clinic, which our clinic is amazing. We have some of the best nurses ever that help manage and take care of our patients before and after surgery. So I hope you all enjoyed that, and let's get started with a big topic. So it is after 3:25. I know my kids get home around 3:40, so I know a lot of folks at home probably have their kids running around the house. So we want to let everybody know that we are going to show some photos, some photos of patients before, after surgery that might show some explicit body parts. And we do not want you to expose your children unnecessarily to those images. So therefore, if you have some kids around, just maybe take some steps to either conceal the screen or maybe watch it at some point later on down the road. But protect those kids, protect those children. So, mommy makeovers. Pregnancy, Dr. Moore, what an amazing experience for a lot of women. We fortunately don't have to experience a lot of the physical aspects of it, but my gosh, so many changes, right?
Yeah, and this morning had a patient that actually did the magic of a mommy makeover on, and she brought into the world 2 lovely children who enriched her lives and will hopefully enrich the lives of many as they continue.
As they continue to grow.
But it took a huge toll on her body.
It absolutely does. And there are many parts of the body that this affects. You know, having a baby not only causes changes in, for instance, your mood, your skin, your posture due to the weight, but a lot of physical changes to the breast, to the abdomen of the patient, to their flanks. And a lot of those changes, for instance, some of them, I should say, some of those changes will repair themselves, right? Given a little bit of time after the delivery of the baby, a lot of the body transitions itself and tries to get back to a normal state. But some parts kind of remain distorted slightly.
Yeah, and some can be changed with hard work and exercise, good diet, but there are things that those just won't work. And that's where Dr. Sarosik and I get to help.
Exactly. This is our turn to help. So for those individuals who have some concerns, who have some, wow, you know, my body looked a lot different. I've had 3 children now. My breasts look different. My belly looks different. My flanks look different. My body's depositing fat in different places. And I can't get rid of it no matter how much exercise I do. For those individuals, plastic surgery could be a helping hand to get you over that hump or to another level. So Dr. Moore, this is an interesting phenomenon. So a lot of times I have patients come into my clinic and they'll say, well, I have all these problems and I have all these areas that are concerning to me. and what do I fix? And to me, it's a challenge to approach because it's not easy to identify what's most significant, but how do you approach it? What are your thoughts?
I'd like to hear what the patient's concerns are and look at it from a whole body perspective and a whole life perspective. You want to take into account their general health, what is safe, because we want to ensure their safety through the whole process. And then there are changes that can happen to the breast, the tummy, the back. So all these things that can happen. And then we address, what have they been trying to do in order to restore their body and how long it's been since their pregnancy and delivery. So that you take into account as much of those factors as possible, and then what's really bothering them. And we want to get clued into what is bothering them more so than what we don't want to impose our desires of what to do on them. So we pay attention to that and try to accommodate what they want to do.
So an easy way, in a way that kind of, I think we both approach things in a very similar fashion, is that we create with the patient in the consultation room, and you saw in the video those rooms that we have downstairs, we create kind of a to-do list. We create an itemized list saying, okay, when you look in a mirror, when you're at a store and you walk by a window or something and you see a reflection, what are the things that stand out to you that bother you most? What are things that you're identifying in your body that are most concerning to you? Because again, like Dr. Moore said, what Dr. Moore and I perceive as things that might concern you are not necessarily the right things. It's what concerns you, and we want to help you get over that time. So we create a list, 1, 2, 3, 4 potentially, depending on however many issues. And then we look at that list together, and we try to figure out, okay, if we were to try to fix the number one thing, which clearly is the most important thing, what other things could we potentially work in at the same time to try to get that patient to the goal that they desire? Now, some individuals, it can't all be accomplished in one operation, and that's okay. And a lot of folks, when they hear the word mommy makeover, they think, okay, I'm going to go in, it's a one-stop shop. And that's not always the case, right?
Right, yeah. It's a process, and again, we want to emphasize safety, and so you don't want to over-operate in one setting. You may need to put certain combinations of procedures that go well together and then do other things at a later time.
Absolutely. So what we'll do is we'll create a list with you as the patient in our consultation room, and in a discussion we'll try to isolate the things that are truly impactful and important to you in creating what we think would be the best plan. Now, there are some advantages to combining procedures. Dr. Moore, let's talk about those. What are your thoughts on this? What are the advantages of getting things done in one lump?
When you can combine procedures, the recovery period for each procedure, they happen simultaneously. So you actually you wouldn't have to recover 3 weeks for the breast, 3 weeks for the tummy, or 3 weeks for liposuction. You put them all together, they're healing simultaneously. So it's 3 weeks for all those as a combined procedure. So that's the biggest one. The other thing is there are some, in addition to the healing time, there are some economic factors in doing the procedures all at one time in the operating room, and we pass those savings on to our patients. So
there absolutely are.
And then the big thing is safety. Again, you do the procedures that are safe together. So,
right. Yeah. So again, one surgery versus 2 or more, patients have less downtime potentially because you don't require another operation. One recovery versus 2, so it's better to have that one recovery period like Dr. Moore mentioned. Less stress on the family. Yeah. Most of these patients all have kids. They all have families. They all have lives outside of whatever that they're going to do with us, which means that this surgery will in effect impact that lifestyle and impact the children's lives and the family's lives and cause a little bit of a disruption. And there need to be steps taken to care for folks while the individual, the mom, is undergoing the procedure in the recovery period.
Yeah, and it's hard.
There's a little bit, it is.
Yeah, it's hard to get time off sometimes, and so if you can do it all at once, that's just one time that you've got to hide out afterwards.
Yes. So now, combining surgery might seem like a great idea, and after that first slide, everybody might be like, wow, I want to put all my surgeries together because it's going to make all those amazing things happen. However, it might not be the right thing to do. And there are some factors to think about when you're approaching an operation like this that might not be the right thing to do to combine a procedure. So sometimes it's not safe for the patient. to undergo, when you add procedures, right, Dr. Moore, you're adding multiple procedures together, which is increasing the length of time that a person is spending under anesthesia. As you increase the length of time, also the chance of having any kind of a complication goes up. So we as surgeons are trained to sort of diagnose and figure out, okay, combining a breast augmentation with a tummy tuck is going to add this much time. The risk of having a complication goes up by a little bit versus doing a brachioplasty, thigh lift, and a tummy tuck might increase it a lot more, and this patient might not be able to handle that operation, right?
Yep.
Safety first. So safety is first, and our safety and our dedication to safety is aimed at the patient. We want the patient to have the most successful, awesome outcome. So can the patient handle the recovery process? Does the individual have a good support network at home? This is probably one of the more important, other than probably the last one, the most important thing. You're not going to be able to recover from a mommy makeover by yourself. You're going to need help. You're not going to be able to lift super heavy things. Going to the grocery store the next day after a mommy makeover is an impossibility. While Amazon Prime is a wonderful service to help deliver your groceries, other things might become an issue for you. So you have to make preparations in order to do this. You have to have a network set up either at home, whether it is with your children who might be grown up and able to help provide that additional care, or other individuals, or your husband, or your family members, or whoever else is around you, right?
Yep.
And then the last thing, Dr. Moore, communicating effectively. How important is that?
It is essential that the patients have a clear pathway of communication with us, and one of the things that we do is afterwards you will have our cell number, and if you have problems, we want to address them quickly before they become big problems. So you could call after in the post-op period, Dr. Stroshik or myself, and you will get us. You won't get an answering service or someone who you have to go through in order to get to us. So we want ready access so that you can be well taken care of, and there's not any barriers, or minimize the barriers to communication in that post-op period when it's so important that we are available to you to get your questions answered and make sure you're doing well.
Absolutely. And as well, you know, after surgery is also important, but also before surgery too, to make sure that the patients are understanding that there are risks associated with surgery, that there are certain things that they're going to have to do and follow certain requirements by us that we have determined in order to have a speedy and smooth recovery. To making sure that there's not a big language barrier. Occasionally we do get faced with patients who have a language barrier, and it's a challenge for us, and we have to make sure that we can communicate with them and provide them that best level of care, because otherwise we're doing them a disservice, and that's not fair to the patient, right?
That's right. Yeah, that's correct. And the other part about that is that we want to understand what the patient's expectations are. We want to know what you are expecting and hoping to achieve with the surgery, and so we have to communicate effectively in order to understand what you want to look like on the other side, and that's very, very critical.
Yes, absolutely. I would totally agree, 100% agree. So let's talk about mommy makeovers. Traditionally, when a term was coined, it was talked about how we're going to lump some procedures together and call it the mommy makeover. However, it's not really very steadfast. There is some variability. There are some inherent changes that a woman's body undergoes when she undergoes the delivery of a child, etc. And those changes predominantly focus on areas like the breast and the belly and the tummy, but other areas of the body can be affected as well. So it's not 100% that we're talking about breast and belly. For the purpose of this first talk, we're going to focus a little bit on that, but there are other areas that can be lumped together or in that whole kind of acronym, so to speak, of a mommy makeover. So first, breast surgery. We're going to talk about two groups separately, and then we're going to talk about kind of lumping it all together. So there are a number of different procedures that can be done on the breast to restore the breast from a postpartum state. Breast augmentation. Breast augmentations a lot of times are used to restore volume in the chest. So for patients who've lost volume throughout the pregnancy or postpartum, who maybe didn't have a lot of volume in their breast before surgery and contemplated a breast augmentation sometime before they got pregnant, those individuals after pregnancy might still need just a little bit of extra volume, right? Breast lift.
In lactation, if you breastfeed your child, you can have expansion of the breast, contraction of the breast, and the ligaments that support the breast internally get stretched out, and then so you can have drooping of the breast, and that can certainly change with pregnancy and breastfeeding.
Absolutely. And then so folks can require breast augmentation and breast lift, or they might require a breast lift and an augmentation. So there are individuals who will require not only a lift of the breast, but also an additional volume to that procedure. And then there's another subclass of patients who, during the time of pregnancy, will gain weight, will gain a lot of volume in their breast, and some of that volume might not go away, and their breasts might be very large, and they want to do a reduction.
Yeah.
And those are tough. But all 4 of those categories sort of fit into the realm of possibilities for women in a postpartum state. So breast augmentation. So Dr. Moore, let's talk about breast augmentation. We're going to restore volume to a breast, right? For women who've desired to have a larger breast, but had a smaller breast in postpartum, their breasts will remain a smaller size. There's 2 ways to do this. One way is to use implants. A second way is to use fat grafting. Now, implants, we're going to have a whole breast aug talk a little bit later on, but let's talk a little bit about this concept, because a lot of women come to our office asking about fat grafting, wanting to remain all natural. They don't want to have an implant in them. Let's talk about fat grafting to the breast. What's your thoughts and approach to that for these patients?
Fat grafting, typically I will use it to enhance the outcome in a breast augmentation, because it can be used purely as a volume replacement. If you do that, when you inject the fat into the breast, some of it will take. It's a live tissue graft. Some of it will take, some of it will not. Your body absorbs it. When that happens, you'll have a smaller than you might want. And so what we have to do is be judicious, because we're protecting the blood supply to those fat cells, and you can only do a certain amount. So if you're going to try to do it as a pure volume replacement, it oftentimes takes multiple procedures to do that, multiple episodes of fat grafting. So it's not my preferred way to enhance a patient's volume.
And I agree 100% with you. I have the same concerns and the same thoughts about that. Implants traditionally will give that a lot of that volume. Fat grafting can be used either repeatedly over a certain number of time as a way to augment the volume of the breast, but as a one and done, it's really a challenge to do that.
If somebody has issues that would keep them from having an implant-based breast enhancement, fat grafting can be magical in what it can do, but it does take multiple procedures to get to a great outcome.
Absolutely. Now, breast lifts. So remember, we talked about breast augmentation, breast lift. So breasts do be, like Dr. Moore mentioned, they become engorged. They stretch the ligament. These ligaments inside of the breast that hold the breast get stretched out, pulled, and then after the postpartum state, after the cessation of breastfeeding a child, the breast will atrophy, and those glands will become, and those ligaments will become stretched out. So a breast lift becomes important to talk about. There are some words that women sometimes will use to describe their breasts when they come into our office. And a lot of women ask, well, how do I know if I need a breast lift or not? And these key buzzwords we hear repeatedly. One of them that I hear a lot is, well, my breasts look like an empty sock, like I just don't have any volume in them, right?
It can happen. Mostly I hear droopy.
You're droopy,
or
right?
sad, my breasts are facing the ground, they're very sad.
And those are reasons, and those are the things that women tend to think about, but they can kind of lead you to think, okay, this is normal. This happens to a lot of women, and there is a solution for this, and that is a breast lift. So this is a picture of what happens to a woman's breast over time. And this can be an example of using the postpartum state. And you see this blue line running across the screen, and the blue line sits in the fold underneath of the breast. And over time, the breast, this little spot, I know it's hard to see because we have to blur it out because we're on YouTube, the nipple starts to move down until the nipple points at the floor. So this is a progression. So what we try to do in breast lift surgery is try to restore and bring that nipple up to a good position, higher up on the patient's chest, try to get it higher than that inframammary fold if we can, to restore that more youthful looking breast. And here we have some examples. So this is a woman who had children, who has a breast that you can tell is what we call droopy or ptotic. The nipple position, as you look here, the nipple position is underneath of the fold of the breast. There's a lot of loss of volume in the breast itself. And again, she desired a breast lift. This is another patient that you can see. Again, the breast is hanging down below where the fold would lie. The nipple is below the fold. So another example of somebody who could potentially benefit from doing a breast lift operation. So how do we do this? Dr. Moore, let's talk about the incisions.
Yeah. There's multiple different types of incisions. The most commonly done is what we call an anchor incision, or it's an inverted T when you finish up. And when you do this incision, you are going to remove the excess skin, and it allows you to leave the nipple on the breast tissue where it gets its blood supply from, and the nerves come into it, and then you can move the nipple higher on the breast and then retighten the breast up with the remaining incisions there.
So Dr. Moore, a lot of times patients will come into my office and say, wait a minute, did you just say you leave it attached? I thought you took the nipple off and then put it up higher. But you can't do that, right?
Not if you want to preserve the sensation and to the nipple.
And the blood flow. So again, this kind of marks out some of the pattern. The nipple area here, we make an incision around it, and leaving it attached to the structures underneath, we're able to shift that nipple position up. And the scar pattern ultimately that patients get, I know it's going to be a little bit hard to see, is something that resembles potentially this, where there's a scar around the new nipple areola complex. There could potentially be a scar going down to the bottom and a scar along the bottom of the breast. And that varies, right? It's not necessarily in every patient.
Sure. And sometimes you can do it just with the pure vertical scar, and occasionally you can do it with the scar around the areola.
All right, right, exactly. But it's tricky, and it's a case-by-case basis, and it's one of those things that when you meet with your surgeon to discuss what you're going to be doing, they can kind of help shed some light on how to do that. So here's a before and after. This is a patient who underwent a breast augmentation, postpartum augmentation, with a periareolar lift. So this patient only had an incision around her nipple like Dr. Moore just described. So there was no vertical incision, there was no T incision, just the incision around the breast to put the implant in and to lift the breast up. And you can tell, and you can see how we've managed to reduce this concavity here and now filled the concavity out with an implant, lifted that nipple up for symmetry. She didn't need a whole lot of nipple lifting, but to establish symmetry between both breasts. And then we put a 400 cc implant underneath of the patient's muscle. So this is just one example. This is another woman, right? So this is a patient who has a very flat, collapsed breast. This is one of those patients that would have come in and said, my breast feels like an empty sack. There's nothing in it, and the nipple's hanging down. So this is an example where we put an implant in, silicone implant, 425 cc's under the muscle. We'll talk about that in a little later discussion. And restored volume and lifted the nipple and put that nipple up on the chest, as you can see here. And the scar pattern on this patient was a scar around the nipple, down and a little bit along the bottom. So there is some variability, right? It's not a one for all. There is some change in variability between them, but we're able to help use those things in order to achieve that lifted pattern. Now, second component, so we were going to mention tummy tucks. This is the biggest other adjunct in a mommy makeover, and a lot of women, babies, are amazing, incredible things that you bring into the world. But unfortunately, sometimes will leave you with something that desires to be fixed down the road. So, a couple different problems that women come in with. And Dr. Moore, I know you see this all the time. I see this all the time. So some patients will come in with extra skin. Just skin. They're fit. They work out all the time. There's exercise, but they just can't get that skin to go away. There's no way to make that skin disappear. Some patients come in with a little bit of extra skin, but some extra fat, and there's no way for them to lose that extra volume around that midsection. And then sometimes women come in with both. And more so than not, Dr. Moore, what do you see most often?
Extra skin and extra weight.
And I see the same exact thing, and it's hard because as hormone levels change in patients, in that postpartum state, it becomes difficult for women to exercise. The body begins to deposit weight in different places, and it will cause for them to gain weight and stretch that skin out. So this is where tummy tucks can be pretty amazing. Now, there's one thing that pops up all the time, right? In your discussion, and that's diastasis recti. And this is a very important concept to talk about because a lot of women come into our office to have conversations about this. And they don't sometimes understand it. They don't know what it means, but they're like, hey, do I have this? So we're going to spend a few minutes just kind of covering the basis of this. So diastasis recti, this happens when during pregnancy, the muscles in the belly get stretched out and pulled apart. The development of this does not happen to every person. Do you see it in every patient that comes in for a mommy makeover?
No, but it's fairly common. I would say probably 85% of the patients that come in for a mommy makeover for the tummy part of it do have stretching out of the muscles.
Yeah,
So-
I see that too, and a lot of things can affect that. Genetics probably play a big role, where women whose moms have had the same thing happen are more apt to have it.
Twins, if they have twins.
If they have twins, the number of pregnancies, the size of the baby. So if you've got 1, 2, 3 babies, some women have more than that these days. We've all seen those television shows. Pre-pregnancy body shape, that's another thing that, so for women who've had a little bit of a larger, heavier weight, could have a more predisposition to having it. And I show this picture because I want to show it as an example. And again, I'm not saying that this woman's body is great, but this woman's body, you can see her rectus muscles lying up and down. Now, this woman's probably not had children, but again, you see the muscles up and down right in the middle of her abdomen. You see this line in the middle, and she has a nice abdomen. This is what happens when you get a diastasis recti. This is what happens. You see those muscles here now. Those muscles are pulled apart here, and you have this little hollowing, right? And most patients have a little bit of extra tissue covering that hollowing, but on exam, this is where it's important for your doctor to examine you. You can feel that. You can actually feel that diastasis. And this is something that in surgery we can fix. And for most women, this is what it causes. It's a feeling of, wow, I didn't eat a lot last night. I didn't eat overnight because I was sleeping. I woke up this morning, I looked great, but then I had something to eat. All of a sudden, I feel like I'm pregnant again. Why does this keep happening to me, doctor? And I'm sure, exactly. And this is something that, is difficult to fix on your own. There are a lot of things out there. A lot of people advertise things that advertise different exercise regimens, different creams you can use, different magical potions you can sprinkle on your head and do. But the lo and behold, I mean,
this is one of those things that no matter what you do, you cannot fix this. You need Dr. Soroshik.
Well, you need me or Dr. Moore. You need a plastic surgeon. You need a board-certified plastic surgeon to help you, or a board-eligible plastic surgeon to help you along this journey to get this fixed. And why does this happen? Again, the muscles normally, the rectus muscles, the six-pack, the big, the six-pack muscles, lie up and down from birth. And as you have babies, all that gets stretched out. And those muscles, too, they get pulled apart. And those muscles will not go back together on their own. It takes a little bit of effort. Now, sometimes after 1 pregnancy, those muscles will go back together. After 2 pregnancies, I think it's a little bit less likely. 3 pregnancies, I would say close to impossible. But again, that's not scientific data. That's my own perception.
Really, it depends on the patient. Some women, the tendons in between the muscles will stretch out, and then they can restore. But if your muscles are stretched out 6 months, a year later, they're just not going to go back. In that space, it's a tendon that really can't heal itself unless it's got the genetics to stretch and then go back down in.
Right. So how do we fix that, Dr. Moore? What do we do?
Yeah. Well, we do a tummy tuck.
We do a tummy tuck. And during an operation, right, you can physically, in the operating room, see this gap. We can see the difference between both sides. And by using various suturing techniques, we can help pull those abs together and get them back where they were supposed to be originally. Now, the important takeaway from this is look at her waist. So she has a waist and a hip here. So there's a ratio between the two. Look at what happens when we put those muscles back together. Look at that waist now and look at those hips. All of a sudden, you recreate some of that form that she would have had before surgery.
Sure, and you flatten the abdomen from the front as well.
Absolutely.
Critical.
That bulge can now go back to the way it was before. So some examples, and we're going to run through these kind of quickly because I know we're sort of short on time. We're getting the hurry up sign. So this is a woman who, remember when I said it at first, I said some women come in with extra skin. So this woman came in with extra skin. She'd done everything she could possibly do to lose that skin to her belly. She couldn't get rid of the skin. So how do we help her? We did a tummy tuck. And here, lo and behold, we're able to get rid of that extra tissue, extra skin, pull everything down. And you can see this is her scar underneath her underwear line. That's her belly button. You can see her muscles underneath. And you can see how we're able to give her a more shapely, more form-fitting abdominal wall. Here's a woman who had a little bit of that fullness. So not a whole lot of extra skin, but a little bit of that extra fullness. And again, different patient, here you go. So stretch marks, little bulge here. Boom, surgery, you can see her scar right here underneath her underwear line, belly button. And you can see how we're able to bring that.
I want to point out something that's really been a really recent advance in tummy tuck surgery is that it's not important only what we take away, but what we leave. And we do leave a little bit of volume right here in the middle, and then you contour it centrally, and you get a really nice, shapely, like athletic-looking abdomen by doing that.
Exactly.
Yeah.
So you leave a little bit of fat right here along these lines, do a little bit of contour out here to help get rid of some extra fat and create a little bit of a nice contour. Exactly.
Sure.
Now this is a woman who had both. So she had both a lot of extra adipose tissue or fatty tissue and extra skin. We're able to get her slim down tight, get her tummy tight, bring in her waistline, and give her a little bit of a better shape. This is another woman, again, same thing. A lot of extra volume here, right? And extra skin. So she had both. And we're able to get her pulled in nice and tight. We got rid of almost every single stretch mark. She's got a few left down here, but not very many. Created a new belly button, and we're able to pull her in and try to give her back some of what her body looked like in years past. Now, this is something that I'm very passionate about, and I know that you are too.
Sure.
Because a lot of times, a lot of surgeons will address the front of the belly, but completely neglect the back. And this area here, no matter what you do for the front, if this is not addressed, will leave you with a result that is, I think, suboptimal.
I agree, totally. And it's pretty exciting what we can do now with the backs of patients.
It's incredible. So a lot of times with mommy makeovers, what we'll do with patients in order to address that issue, like for instance, this patient here, you can see the result, is all it takes is making one little tiny hole right above where the two butt cheeks come together. One little hole. And using that area, perform liposuction on the back and be able to give you that. Now imagine if we had left all of this behind and she had a nice flat tummy, but she had all of this. So every time she put pants on or a bathing suit on, all of this extra tissue remained. It would leave her looking a little bit suboptimal, at least from my perspective. And I think that it's an important adjunct that we address when we do these mommy makeovers.
Totally agree. And there's also the fullness up here under the bra. We can reduce that as well when we do this operation, and it just really changes the way a patient looks.
It's a game changer. Imagine, you know, being her to being her. Not that there's anything wrong with this patient, but again, just some steps that we can take to help patients regain some of their youthful look. Here's another patient who had a little bit of extra adipose tissue here, and we were able to slim them down by doing a little bit of liposuction on that back area. Okay, so putting it all together. So tummy tucks, breast surgery, right? A lot of times we'll combine these, but again, Dr. Moore, what's important? That we do this when it's safe for the patient, right?
Exactly,
That when we're not gonna hurt someone, that we're gonna put them through an operation and they're gonna have a successful outcome. Communication are open and they're freely communicating with us. So that's also incredibly important. So these are some examples of patients, and you know, some of these patients we've shown you tummies on before. So here's a woman who came in for a mommy makeover, before, after. Again, all of our before pictures are going to be on the left of the screen. On the right side are going to be the afters. So you can see that she underwent a tummy tuck. Not only a tummy tuck, we did some lipo-sculpting on the front of her belly to give her some of these contours, and then did an augmentation with a lift. And you can see the scar up here around her nipple going down and a little bit along the bottom of her breast to help get rid of some extra skin to give her that nice round contour. Here's another patient, that same tummy that I showed you earlier. That same patient, we were able to combine and do both surgeries at once, which again helps speed recovery and makes that process a little bit better. This is another patient that we were able to do the same thing. We were able to do a tummy breast augmentation, so she did not need a lift, just an augmentation to help give her more shapely abdomen. So post-surgery, this is some important stuff, right? Because it's not just you come in, you have a surgery, and you go home. I tell my patients, this is not like a car wash. This is a journey, and there's a recovery process involved, right?
Sure,
And some of the rules that we kind of advise our patients, and there's some variability from surgeon to surgeon. No heavy lifting, right?
Yeah, when you do the breast surgery, you're actually going to injure the muscle to a degree, and you want to be protected during that healing phase. So you want to limit the lifting. And the same thing with the stomach muscles. When you tighten that diastasis, it takes about 3 months for that to heal to its point of maximum strength. So you need to really protect that during that period.
Absolutely, absolutely. Another thing, must walk slightly bent forward. And that sounds crazy, and some people are like, well, why would I need to do that? Well, if you imagine, if you make a cut down here and you make another cut here, and you take all of this out and you pull this down, this skin for the first couple of weeks is really tight, right? And you want to keep yourself a little bit bent forward to take a little bit of tension off of that incision to allow it to heal. After about 2 weeks, I would say 98%, 99% of my patients are able to stand straight up and be just fine. But in the meantime, it's important to keep that flexed posture to help that incision heal. Abdominal binders. I love binders. Dr. Moore, what do you think about binders?
I like to wear some form of compression for the patients. You know, I'll have them wear it.
And that compression is incredibly important because it helps to push edema and fluid that your body will naturally put there. It helps to push that fluid out and helps that tissue recover and heal nicely well. I use drains. Those drains I leave in for 2 weeks. I usually put in one on one side, one on the other side. Exactly. And the drains themselves, there's a strange drain fear out there. Some people have posted videos on Facebook, on Instagram about these horrific experiences with drains. I've never had a horrific experience with a drain.
No.
My drains and Dr. Moore's drains, they're thin tubes that as you cut the stitch, the drain just slides out. There's no additional pain to removing that drain. I've never seen a patient have a bad experience removing a drain. In fact, they actually help produce a much better result because they eliminate that fluid that's collecting there, right?
In a patient who is fearful about the drains when we take them out, I will put a little bit of local anesthetic in around it just to help.
Just to help alleviate the discomfort.
Yeah.
So some simple things. There is some variability. Overall, Dr. Moore, what do you think about the procedure of a mommy makeover, for instance, combining breasts and belly?
Magical.
Magical?
So magical of a mommy makeover. It can really transform a person in one trip to the operating room from the changes that happen with pregnancy.
It's definitely incredible, and we're very fortunate. Again, we have our own operating room suite. We have our own staff here that help us every day get through an operation and make sure that we're taking the bestest of care of our patient from before surgery until after surgery and through the recovery process. And it's absolutely one of the most glorifying things to see that transformation happen.
It is fun, very much.
And when you pull up their pictures at the 4-week mark and you say, look, this is where you were before and this is where you are now, it's just incredible. It's an incredible moment for us. It's an incredible moment for our patients. We love doing it, and we absolutely are very grateful that a lot of patients allow us to take care of them. So if any of y'all are interested, if there are any moms out there and you're thinking potentially maybe this is the right thing for you, maybe it's not, but maybe it is. And if you have some questions, give our office a call at 615-771-7718. Or click on the link below, give us a call, schedule a consultation. We're happy to meet with anyone to discuss not only is this the right procedure or what combination might be right for you, but also to talk about scheduling the surgery and how we would do it, whether it would be a good thing to do in one operation or to break it up into multiple.
Sure.
Right?
Right.
All right. Well, thank you all so much for watching. We really appreciate y'all watching this segment. Our next segment, Dr. Moore, we're going to be talking about some breast stuff. Okay. All right, so we are back. We are back for the second surgical segment, and the breast segment is actually going to be the third segment we do. First, we're going to talk about some body procedures, so some adjunctive procedures that plastic surgeons can offer for patients to help kind of get them back to where they would like to be. So, women's bodies, again, come in all different shapes and sizes, and there's nothing out there that says that this is what your body should look like. Everybody has a different perspective. In my perspective, Dr. Moore's perspective, our perspectives really don't matter. It's about you and what you desire, right, Dr. Moore?
That's correct. God makes people in many different shapes.
Exactly. So, and it's not our business to tell people what they should look like. However, we can try to help by doing plastic surgery to help address certain areas that, again, might concern you. So, Dr. Moore, liposuction, one of the greatest inventions in the last 50 years. Like, wow, what can we liposuction?
Yeah, we can change people's shape with liposuction to the abdomen, the arms, the chin, as we'll show, the thighs, the lower leg to shape calves. We can do liposuction. Just if you've got fat somewhere, we can shape it.
We can shape it, and that's the beautiful part about liposuction is that it gives us the ability to be able to use sort of a, we don't want to use the term minimally invasive because it does require an operation, and anytime you break skin, you're cutting somebody, it's an operation. But the recovery time and the discomfort is not quite as much as making a larger incision. So liposuction is an incredible tool that we have to be able to use to shape and to help define certain areas. True. We're going to talk about some arm lifts, right? Tummy tucks, we've already talked about tummy tucks a little bit. So if you missed that talk, maybe rewind your cursor 20, 30 minutes and you'll kind of get a whole spiel on tummy tucks. Thigh lifts, Brazilian butt lifts, fat grafting to the hands or other parts of the body, and even calf augmentation. So some areas that we kind of are going to highlight this year. So before, after, again, for those of you who are just joining us, on the left side are our before pictures, on the right side are our after pictures. So this is a young patient that came to the practice. She wanted to define a little bit of her lower abdomen. She worked out, she ate a healthy diet. She wasn't someone who was grossly overweight, had a normal BMI. However, she wanted to have a little bit of definition. So liposuction, for me as a tool, was the perfect way to help give her a little bit of definition, just to help remove some excess fat. Now, Dr. Moore, is liposuction the right procedure for everybody?
No, it's not. There are some people that if they're already very thin, don't have something to work with, then you certainly wouldn't want to shape it with liposuction. If a person's general health is not good, then you have to question that. And then there are people whose goals can't be achieved with just liposuction alone.
That's right. So. And that a lot of times folks will come in with a lot of excess weight or skin that's been stretched out. One dead kind of giveaway for us can be that people have a lot of stretch marks around their bellies and have a little bit of excess fat in that area. Liposuction for those folks, it's going to be really hard to get you a incredible result because of the fact that that skin really won't recoil well. And you know, we have conversations with patients all the time, asking them and telling them that, look, we're happy to try this. We're happy to try to do what you would like us to do for this particular reason. But there's a potential that you might not be excited about the result because you might have some extra skin there, and that skin might need to be cut out at some point down the road.
There are also patients who really the best thing is to go through a program of diet and exercise before coming in to get a consultation, because liposuction, if you've just got, it's a really good sculpting operation to change shapes and to get rid of focal fat. But if you're have a very large BMI or body mass index, liposuction may not be the best first step. The best first step may be to do a consultation with a dietitian or nutritionist, or to go to the gym. You know, so in some cases, that's the best first place to begin.
Absolutely, and I can't stress that enough. There are a lot of diet scams out there. I think there are a lot of people that try to sell you weird, crazy diets. If you don't eat carrots, or you have to eat only carrots, and next week it's some other diet. There's a lot of gimmicks out there. I think focusing, if you're trying to achieve weight loss, it's a balance. It's a balance of diet and exercise. A diet, a lot of it really is focused on what you're consuming and what you're burning. And if you're consuming a lot things that are high in fats and carbohydrates, those individuals are going to have a much harder time losing weight than folks who are consuming a more leaner diet. So there's a lot of things that you can get to help yourself. Seeking help of a nutritionist can be helpful. And then exercising, having a regular exercise regimen. You know, we had a blog about this recently, and I hate to go off on a tangent, but I really want to, because again, exercise, some people at New Year's will make a resolution and say, I want to exercise every single day. And you're never going to achieve that. It's impossible with the busyness of life, having kids, having a family, or potentially your active lifestyle, doing whatever it is that you do. It's impossible to do that every single day of your life. Select few people might be able to achieve it, and those of you out there, I've met some of you, and you're amazing individuals. However, for the general mass, it's impossible to achieve, but set some reasonable goals, like losing a pound a week, or maybe a pound or two every month. And try to get on that journey and start that process, because you're right, you know, it's not for everybody that sometimes that they might need a little bit of a jump start. This is a side profile of that same patient showing what we're able to do, just give her a little bit of definition and help her achieve a result. This is a cool case where a patient came to us asking for the improvement of the dorsum of her hand. She had a lot of tendons that you can see running up and down her hand. She had a lot of volume loss or concavities between the tendons themselves. So we were able to take some fat out of her body and use that fat to graft in between those to help her provide a smoother and more youthful looking hand.
Yeah, and seeing your tendons on the back of your hand is normal.
It is normal.
But in some patients, they lose so much volume in their hands as they age that it becomes a distraction and it harms their confidence, because that's maybe the tell that I'm 80 and not 65 that I look and feel. So those are the ideal the patients for doing hand fat grafting, or the patients who just lost a tremendous amount of volume. And it's not necessarily 80-year-olds, it's some patients. That's what you want to look for, is how much volume you've lost.
And you know, the other thing we mentioned earlier on when we were talking about halo and BBL, a lot of times that skin will become very spotty and it will become very aged on the hands, and you might have a very smooth looking face, but if your hands don't match it, you might feel a little out of place, especially when you're talking, because we all tend to use our hands a lot. So not only combining a little bit of fat grafting to the hands would be advantageous, but also sometimes doing a treatment on your hands using halo, BBL, to help smooth out some of the spots and the wrinkling. Dr. Moore, take us away here. So let's talk about arm lifts.
All right. This is a patient who her mom, grandmom, grandpa, somebody gave her the genetics to have this very loose skin. And she also had some weight gain, and so she's got fat as well as excess skin, and that really distracted her. And so she came in asking for arm tightening. And when we do that, a combination of liposuction and then tightening the skin, and we put the scar where when her arm is down, it's in a place where you can barely see it. And with time, this is relatively early, but as time goes on, the scar becomes obscure. It takes, for a brachioplasty, it can take up to a year for that scar to become obscure, but it is a wonderful operation, because there's really, with this type of arm, that's going to be necessary or you won't be able to change it.
And I want to give a shout out to my mentee. So Dr. Moore here, taught me a few things about brachioplasties and about doing them. And in his experience, for women who do not need to have any extra resections done up here, you can usually kind of run the scar in that fold here and then curve it around back to behind that elbow area to try to conceal that scar, to try to not have it come out too far on the arm if you don't have a lot of looseness up there, which is a nice way. And again, one of the benefits that Dr. Moore and myself have of working together and being able to work in this amazingly incredible practice that's been thriving for 25 years, which is amazing, is the fact that we're able to help each other and bounce ideas off each other to help us continue to be better, to provide better treatment and better outcomes for our patients. So this is her posterior arm, Dr. Moore?
Yeah. And you can see you can shape to the shoulder, the biceps, and then the arm skin and the scar. Again, it's kind of in that posterior medial aspect that hides when you have your arm down in a normal position.
Okay, so thigh lifts, another really challenging procedure. So many women over time tend to lose volume in their thighs, and the skin tends to get loose. And we have questions. I mean, I have patients at least a couple times a week asking, how do we fix this? What do we do? I just hate this extra skin here on the medial thigh. This bothers me. Can you just lipo this? But it's tough to lipo that area because it produces a lot of times loose skin, and you get wrinkled skin in that area. So this is a beautiful example. Dr. Moore, Moore, walk us through here the outcome.
So this, you see this often in patients who have lost a lot of weight or patients who spend a great deal of time in the sun and they lose the elasticity of their skin. And this lady here had loose skin in the upper medial thigh. And so what I found over time is that the best way to tighten it up and to get tightening up and down the thigh is to put the incision in the posterior medial thigh area where it's hidden. And this is an example of that. And it just tightens it up all the way along here. That's just a medial thigh lift. We can do a lateral as well, where you go up in here and tighten from around the hip area to help up the upper thigh.
But amazing result. You can see the slenderness of her thigh improved dramatically from one side to the next. The scar lies in that inner part, on that inner part of her thigh, so it's very difficult to see unless you're wearing very short shorts or if you're sitting at a table, for instance. But if anybody who's wearing longer pants, that scar is very easy to conceal. And again, most patients with time, their scarring fades so well that it's barely visible anyway. So phenomenal result. Again, one way to help folks. But what's the recovery like from this? This is not an easy one to recover from.
That's another one, just like the brachioplasty, where it does take a while for the scar to become obscure. We do hide it in the posterior medial thigh where it's hard to see. The other thing about this operation is that it varies. Some patients only need the top part tightened up, and others need to have, in a massive weight loss patient, we sometimes take the incision down below the knee, and it curves around behind the knee there. So, but the recovery period, you can be up and about walking really. We want you walking after surgery. So that's not the issue. It's just that you've got a wound that's in a difficult place, and so sometimes you have to be patient with the healing, and then the scar, it takes a while for the scar to fade.
But phenomenal outcome, amazing result, and challenging surgery, but and there's a bit of a recovery period, but again, the results sometimes speak for themselves. Chin, neck liposuction, coronavirus hit everybody pretty hard the last couple of years, hence why we're doing another virtual open house. We're hoping that next year, maybe we'll have a virtual and open house. Hopefully have some of you back into our office to tour our amazing facilities during the 26th year of Cool Spring Plastic Surgery. But nevertheless, with coronavirus, a lot of folks were doing a lot of Zoom calls, keeping that computer screen right in front of your face, and you're noticing that extra chin, that extra fatty tissue hanging down. And everybody's got some, so don't pretend that you don't, but everyone's got a little bit. So what can we do for that? There are a couple of options. For a lot of folks, doing a little bit of neck liposuction, which is very easily done through 3 tiny little incisions, one behind one earlobe, one underneath the chin, and one underneath of the other earlobe, will allow us to remove a lot of that extra tissue and help shape that neck and give that neck a much, much better look and produce a much more desirable result to create a jawline. I mean, that's amazing for this woman. I don't feel bad saying so because she said that when she went to her Department of Motor Vehicles to get her driver's license re-updated, they didn't believe that it was the same person. They thought this was a fake person, but in fact, it is her, and it's amazing the dramatic difference that you can create with just liposuction. And Dr. Moore, I know you've done a ton of these. I'm doing a ton of these. It's a lot of fun, great procedures, and it makes you feel good when you have pretty awesome.
How long do you, how do you take care of the patients after surgery, and how long do you have them wear the?
So my restrictions might be, they vary depending on the surgeon. The biggest thing that I ask my patients to wear is a chin strap around their head. So the strap goes around their whole head. I put a little bit of gauze underneath it right after surgery. I put a little stitch in all 3 of the little holes. And I ask my patients to wear a chin strap for 24 hours a day, 7 days a week for the first week. After the first week, they come back to the office, we take everything off, and we look at the different incisions, we remove the stitches that are there, and then I put them back in that chin strap and ask them to wear it 24/7, but they can take it off to shower. Now, the analogy that I use, and this is my own belief, and again, I feel like I've gotten a really good experience with this, is I use the Scotch tape analogy. And my analogy is that if you took a piece of Scotch tape and you stuck it right here to my jacket, and then you peeled it off, and you stuck it over here, that Scotch tape would never stick the same way that second time as it did that first time. Some of that glue is lost. And I truly believe that when you do that initial procedure and you carve out and you remove a lot of that extra fat, that when you push that fat up, that inflammation that happens there, that first inflammation is so crucial that keeping that good opposition helps to hold that skin, helps that skin retract, and to remain and maintain its shape and form.
Yeah.
So there's a little bit of variability. Dr. Moore, what about you? We differ a little bit on this?
Yeah, a little bit. I ask my patients to wear it 24/7 for about 3 days, and then pretty much whenever they can after that. So if they need to get out and about and do stuff in public, they don't have to have a chin strap when they go out in public. But when they're home, and most people, with the COVID and everything, that's not been a real challenge to wear it at home, and they're home a lot. So as that's changing, basically, I have them wear the chin strap at night and when they're home for 3 months.
Yeah.
So,
and
but I
the
agree with
nighttime
the
is
concept.
perfect too, yeah.
Yeah.
So either way, again, we all are striving to give amazing results and incredible outcomes. This is one last picture we wanted to talk about in the show. So this is a young person who underwent a calf implant.
Yeah.
Dr. Moore, walk us through this here a little bit.
Yeah.
Show us.
Well, the patient who has doesn't have much definition of the leg between where the gastrocnemius muscles or calves are and a break point. And so she asked us to help her with some shape in her legs, and through an incision that's hidden back here in the knee, we go ahead and put in, these are silicone elastomer, they're firm silicone implants, so they feel like a muscle, and then under the skin they look like a muscle. So that's
And you can see that that shadowing right here along that lower border of where the gastrocnemius would be, kind of helping to define that calf muscle, which is great, which is a phenomenal thing. Do you find that do they shift around a little bit? Do they stay pretty fixed?
They stay very well fixed. You in the initial period, just much like with the chin, we do wear compression socks below the implant, and then an ACE wrap to help them fix during that early healing phase.
Gotcha. No, great, absolutely awesome stuff. A couple more quick cases we're going to show and talk about some of the amazing things that we do. This is male gynecomastia surgery. So for all those women out there who are watching the show, you might have a boyfriend, husband, neighbor, whoever who has a little bit of extra tissue in the chest. And you can see that exemplified here, where there's a little bit of this kind of puckering of that breast, that nipple areola complex. So this is an operation that we offer to patients where it involves doing a little bit of liposuction on the chest to help reduce the overall fatty tissue, as well as removal of that glandular tissue underneath through a little incision. And I like to make my incisions inside the nipple area. So a little tiny incision fades really well over time, and you don't even see that it's there. Hard to tell the difference.
I would say this is not the typical gynecomastia patient. Statistically, about 65% of males that go through puberty will have some degree of breast hypertrophy. Most of it goes away. Most of the folks that I see are either older men who have developed breast over time, or kids that have gotten heavy, or kids that their breast tissue just didn't go down. And so do liposuction is a primary adjunct. If it doesn't go away and you still have that breast bud that Dr. Stroshik just demonstrated, then you go in through a small incision at the areola to remove that. So typical.
Just a couple of other quick things. Otoplasties, we commonly do this great game changer for a patient. Usually it's a young patient comes in with ears that are much more, kind of a little bit more projecting. So being able to reduce those ears and bring them back through an operation where we can pin that ear back and create a better contour can be a pretty big defining point in someone's life. And you can see it from the back here, the difference between here, the pre-op and the post-op picture that you can see over there. So with that, we're kind of going to wrap up the body session. The next session we've got is the breast session. We're going to show some implants. We're going to talk about choosing implants. We're going to talk about breast surgery. And then after that, we're going to have a face talk. So y'all stick around with us, and we'll see y'all when we come back.
Okay.
All right, well, welcome back for our third segment of our show this afternoon as we head into the 6 o'clock hour. I'm joined here by Dr. Moore. I'm Dr. Konrad Soroshek. Dr. Moore here to my left. We're going to be talking to you guys today in this segment about putting your best breast forward. A catchy way of talking about breast augmentation, breast implants, breast lifts, and everything to do with breast, including breast reductions and breast cancer reconstruction. So,
I know your kids are watching, right?
yeah, so hopefully not. So this is a big deal. So I know, again, we mentioned this last time. We are going to be showing a lot of photos here of patients and women's chests. And if you've got kids around, please make sure that you understand that and that your kids are either away from the screen or you're taking some proper steps to protect them from potential.
I know your boys are really eager to watch you do this presentation. So
yeah. I do have 2 boys at home, and they're pretty wild and squirrely. So to my wife, I hope you keep them away for right now. So here's our agenda, right? We're going to cover breast augmentation, breast lifts, breast reductions, breast cancer reconstruction, breast implant revision, and then talk about maybe a little bit about combining breast surgery with other procedures. But before we get started with all of that, we have an exciting and incredible announcement to make to everybody. I think we are the first group in the area to have this feature available. So we have created on our website an ability to search photos for breast augmentations based on starting cup sizes. So if there's a woman out there who has an A cup breast and wants to know, well, I don't know what I'm going to look like, what size implant should I get? So how do you figure that out? You have to scroll through hundreds and hundreds of pictures of women. Yeah. Our website now has a new and amazing feature. We're going to show you how to find that out. So here's a picture of our website. Here's Dr. Moore and myself. And all you do is you click on the gallery button. And this is at csps.me or .net. And you just go ahead and click on gallery. It pulls up this amazing page. You hover your cursor over the breast icon and click on the breast augmentation tab right here. And that will take you to this website. And as you go to this website, right here in the very middle, surrounded by the red mark. Now, you won't see the red. I put that on there so that everybody can see where to click. But you'll see size before procedure, A cup, B cup, C cup, all. This will allow women to sort of narrow down the scope of, do I have to scroll through thousands of breast augmentation pictures, or can I just look at ones that are sort of like me? So by clicking the A cup, this will pre-populate patients with, on the left side, the pre-picture will be roughly an A cup breast. Now, Dr. Moore, cup sizes, are they uniform? Is it a standard measure?
No, not uniform. And a lot of it varies on the manufacturer of the bra. It's what you'd wear. An A would, in some brands, might be a B in other brands. So no, it's not uniform at all.
So there is some variability. However, this will help you in your search if you're looking for someone like yourself and you're looking to try to figure out what size implant you need. By clicking on A cup, B cup, or C cup, this will help you narrow down your focus. So we're super excited to offer that. We think we're the first ones in the area to be able to do that. I'm sure others will follow. But in the meantime, feel free to go through our website and take a look at our patients. So we're going to start talking about breast augmentation. So important points of decision that we're going to talk about. Choosing an incision. And again, we hope that every one of you out there who ever have a consultation for a breast augmentation have an opportunity to meet with a board-certified plastic surgeon. Not a cosmetic surgeon, but a plastic surgeon who can kind of review with you all the different steps of the operative planning. So choice of incision, choice of implant, choice of placement, and choice of size. So we're going to start kind of addressing these issues. Yeah. So choice of incisions. Dr. Moore, walk us through this and tell us about what you think.
All right. I'll go through the ones that we don't commonly use. The transaxillary approach, which I did when I first went into practice pretty regularly, and then the periareolar type incision. We abandoned those because some studies were done and they showed that the rate of capsular contracture, which is when the breast gets hard, are higher with those two incisions. So we don't use those as often now as we used to. Primarily now we use the inframammary incision.
And I agree. I do the same exact thing. The transaxillary is the incision through the armpit, and the periolar being the one that goes right around that nipple area. Those incisions are great. However, there are associated complications that are associated with those incisions that aren't necessarily great. I've found that I've taken care of a few patients who've had the transaxillary incisions where the breast implant ends up being out here on the side of the breast when the patient lays flat because it kind of dissects the side. So that's not been a favorite of mine. This also not a favorite of mine for reasons Dr. Moore mentioned. This is a great incision because it's clean, it's safe, and the rate of complications for the most part is pretty amazing.
And typically, even if you don't have enough breast tissue to have an inframammary fold, after we put the implant in, you will have a contour there, and that incision hides up under the breast in most cases.
It virtually disappears. I mean, it's pretty amazing. So, so that's choice of incision, kind of focusing on what we prefer here. Again, we're willing to do certain things for folks if they truly have a desire, but again, you got to kind of weigh your risks and benefits of those incisions. So moving on to implants. Today, in today's day and age, there are two types of implants. There are saline and there are silicone implants. And Dr. Moore, what are your thoughts on saline, silicone? When do you use one versus the other?
The saline implants, and I have a lot of experience with saline implants because during the early years, silicone gel implants were just not available. They were taken off the market by the FDA, and they've since been proven to be safe, and so now they're back on the market. But saline implants, they can produce a beautiful result. In most cases, if a patient is really thin, they can have rippling where, I'll show kind of what that is when this is where you have some contours of the implant, and that rippling can show through the skin. And so in a thin patient, saline has a higher risk of that. So in those patients, we tend to recommend silicone and sometimes even a more cohesive type silicone gel implant that holds its form better, and so you don't see rippling as much.
Absolutely, and I couldn't agree with you more. You know, saline implants are great, silicone implants are great for the right patient, and for the most part, for a lot of folks who have what we call micromastia, which means very little bit of breast tissue, their body does not have a lot of coverage, or I always kind of describe it to my patients as a pillowcase over a pillow. If the pillowcase was super thin and you put a pillow in there that will collapse under any pressure, that rippling will be easily seen in that pillowcase versus if you put in a little bit more of a firmer pillow. So that's where these two kind of are variables. But again, how are you going to know which one's right for you? You got to meet with a doctor. You can't decide that on your own. That's an important decision to make and to analyze your tissue. These implants all really will help create additional breast volume. They enhance shape and then allow for your breast to kind of more uniformly distribute around that tissue itself. So profiles, and we actually have some breast implants here to look at here. So Dr. Moore, let's talk about profiles of different implants. There are profile differences. In the profile, what that means is the height of the implant, which means the distance from the table up to the top of the implant. So you can see here 3 implants. And all 3 of these implants have almost the same exact volume inside of them. So there are about 365, 368 cc's of volume inside. So the same amount of jelly is inside of all of these implants. But look at the height difference. And this is important, right?
Yeah, it is. To help, again, we try to find out what is that patient desire, and then you kind of weigh that along with their natural tissues, the width of their chest wall, the width of the breast, their natural breast, and you have to choose an implant with the correct projection and width based on those factors, and this helps us have choices to give the patient what they want in a safe and natural-looking manner.
And you know, Dr. Moore, the other thing you mentioned correctly just a second ago is the width. And I'm going to aim at this camera here, and if we can cut to this camera right here, I'm going to show something here. I'm going to turn the table just a little bit. And the important thing that Dr. Moore mentioned is notice how the implant here, all the way to your right, this implant has the lowest height, but look at its width. It has the widest width. As we move to your left, the implant here has a little bit of a narrower width, but a little bit more height on that implant itself. As we move all the way over here to the end, this implant has the narrowest base, but has the most height, but yet they have the same volume inside of them. So is a breast augmentation a cookie cutter procedure?
No, sir.
It's not. And this is the important takeaway point. There's a lot of thought that goes into this, and you have to approach each patient, measure the base diameter of a woman's chest. You have to look at the patient and figure out, does this woman want an athletic breast? Does she want a very large breast? Does she want a wide breast? Does she want a more projecting breast? And there are different types of implants offered by the big major implant companies that actually can manifest and create what those women desire. So this is not just a cookie cutter procedure where you say, I want this one, and that's it. There's more that goes into it that you have to truly consider in making your implant choice. So diameter and height of the implant all change, yet these are all 365 cc implants. So think about that. If your friend has a 365 cc implant, which one does she have? She could have this one, or this one. So make sure that you have an understanding of what you're choosing and what your doctor is choosing for you when you're undergoing the operation prior to that operation.
And on the projection and the profiles, what you start with is critical in the decision making, because if you talk to a friend and they give you a volume, you don't know how much native tissue they had before they started, so that may be totally inappropriate for you.
And that is so true, and that is the other thing, that a lot of women will come and see us and say, wow, my friend had a 350 cc implant, I want a 350 cc implant, yet there's a very big difference between the patient and then her friend. And you have to consider those options. And again, those are things that you would have in a conversation with your board-certified plastic surgeon when you're having that discussion about breast augmentation. Now, implant placement. So Dr. Moore, let's talk about this. This is another very important topic to cover. So implants can traditionally be placed in one of two areas, right? And women, when they come to the office, they'll refer to it as, I want to be under the muscle, or I want to be over the muscle. And we're going to talk about what that means right now. So I'm going to talk about this, Dr. Moore. You're going to talk about those two. Here is a native breast with native breast tissue. And you can see here, this is the nipple complex here. This is the glandular tissue inside of the breast. And this pink layer on the outside is the skin. Inside the yellow is the fat that composes the breast. And underneath of that, this red area right here, this is the pectoralis muscle. This is the chest muscle. On a man, it's a much more bigger muscle. On a woman, it's a smaller muscle, but nevertheless, that muscle's there. So implants can be put either under the muscle, so here, under or over. Dr. Moore, let's talk about those.
Yeah, this is a what's called subglandular or in front of the muscle type implant. So it's underneath just the breast tissue. There's no muscle covering over the implant. In this central picture, you've got it underneath the muscle, and that's called subpectoral or retropectoral type muscle implant placement. In most of these cases, you'll hear that term, but it's usually going to be partially under the muscle and partially under the breast tissue underneath here.
So the advantages, disadvantages. What's the advantage of putting the implant, for instance, on underneath of the muscle, Dr. Moore? What do you tell your patients?
The big advantage of it is, well, there's two main advantages. One is that every time that you contract that muscle, it squeezes and massages that implant. It will keep it softer over time. And the other factor is that underneath the muscle, if you're a really thin patient, you don't have much breast tissue, and it's on top of the muscle here, the implant will, you can see the implant edge through the tissues. So you kind of disguise it by putting more tissue between the skin and the implant.
And that's exactly the way to look at it. When you put that implant under the muscle, you're lifting that muscle and all of that tissue above it to cover up that implant so you don't see that top edge of that implant itself when it's in your chest.
And it gives you a more natural look.
More natural look versus putting the implant right here above the muscle. If you don't have a lot of fat here, which some women that come to see us for a breast augmentation, they don't have a lot of fat there. And you're going to see a very thin rib cage, very thin muscle, and then you're going to see an implant there. So there's a lot to talk about, but a lot of it depends upon your physical exam and what we see during that consultation when you see your plastic surgeon.
And the rippling that we talked about earlier, it can really be disguised by the muscle.
Absolutely. And that's another great point, that muscle will provide that coverage to that rippling. Absolutely. Totally agree. So right now we've covered incision, inframammary, periolar, transaxillary. We've covered silicone versus saline. The advantage is silicone maintains its shape a little bit better than saline does. Saline, people traditionally refer to it as a more natural implant because it just has water in it. However, silicone implants tend to hold their shape better and have less of that rippling factor. So putting a saline implant in a subglandular plane, like underneath of the gland on top of the muscle, your chance of rippling, I would say in somebody who has true low breast volume or micromastia, is very high. Would you agree?
Yep, I agree.
Okay, so here are some examples. This is a young lady who underwent a breast augmentation. Just a simple implant inside of the chest. You get a nice shape, you get a nice roundness, you get a nice fullness on top. This is a subpectoral implant. The implant lifts up the breast, lifts up that extra tissue, and helps to provide her a little bit of extra fullness right here in that upper part of her chest. Now, the important thing is that on our website, I want to point you all back there because we just have that amazing new feature. We have hundreds of additional pictures of women who have undergone breast augmentations. Prior to undergoing a breast augmentation yourself, please go on a surgeon's website, whether it's ours, whether it's another surgeon's from another office, whether it's another surgeon from another state. Go find a breast that fits well with what you're desiring and make sure that you save those images and show them to that surgeon and see if that's something that they can accomplish for you.
So, Dr. Strozic, how do you help women determine what size they need to be and pick the implant?
So that's a very common thing, and that's a tough thing to decide. You know, in my consultations, when I speak with women, I ask them I talk about their lifestyle. I look at women who are more active versus less active. People who are less active tend to desire a larger breast. Women who are more active tend to desire less weight on their chest, but still want to enhance the shape and the curvature of their chest. I ask them to size with our incredibly amazing and awesome nursing staff in our office who will give them a sizing bra. And then in that bra, they will utilize a sizer, the implant sizer that will go over their native breast tissue. And then we ask them to bring their favorite shirt, their favorite outfit, their favorite bathing suit. Bring that with you and put it on top and see if that size in a mirror gives them the enhanced look that they want. Because truly, most of your life, 95% of it, I would say, you spend fully clothed and you judge yourself by how you look in clothing. And it's imperative that you find the favorite things that you enjoy to wear at home and put them on and look at yourself, whether it's a sweater, a shirt, a bathing suit. Look in a mirror with this sizer and see if that gives you the shape you desire.
Yeah, and you're an extraordinarily gifted individual, but you're not a mind reader. So
I am not a mind reader.
This system, using those sizing implants with the nurses, gives you the best opportunity to determine what size it is that you want and communicate that effectively to the physicians.
And that's what's really important, is to have that amazing experience, to have that experience with the staff, with the physician, to be able to conclude what you desire in order to achieve the goals that you would like. So moving on, breast lift. We talked a little bit about this already, so we're going to kind of glance over it briefly. Again, breast lifts are done for patients the nipple has changed its position from being above the inframammary fold, which is right here with this blue line, and as it moves down to a point where it's below it. So breast lifts are meant to try to restore and get that nipple up higher than that fold. The incisions that we typically leave patients with, or that patients experience, are a little bit of a variation, right? We can have just an incision around the nipple to lift just a little bit of the nipple, an incision around the nipple and down to the bottom of the breast, or a more common incision around the nipple, down to the bottom, and a little bit of a T incision, or what we call an anchor incision along the bottom, to help remove that extra skin and lift the breast up. But that's all stuff that we talk about during the consultation with our patients. This is an example of a woman who just underwent a breast lift. So there's no implant in this woman whatsoever. We have a breast that's very flat, thin up here. The nipple is almost at or just slightly below her inframammary fold here. And you can see we just lifted her breast and put that implant up higher, put that nipple up higher to give her a more rounded, full shape. However, the drawback to doing just a lift, right? Upper pole fullness, right, Dr. Moore?
Yeah, it's hard.
You want to point that out up there? She's a little bit flat right up in that area right there, where if she had had an implant put in, that implant would have provided that extra additional volume and fill that space out. Augmentation, so adding a breast implant with a lift, again, gives you that ability to give that enhanced look up here, that more fullness as you lift the breast up. And not only does it lift the nipple and change its position, but also change the shape of the breast and give it the additional fullness on the top. Next, we're going to move on to breast reduction, and we'll glance over this briefly because breast reductions are very similar to a breast lift, right?
Very much, yeah.
The main differences really are that breast reductions, we remove a lot of tissue, versus a breast lift, it's not as much of tissue, it's more just redraping and reshaping the breast.
Right.
The incisions themselves are very similar and very the same. Would you not agree?
They're essentially the same incisions and scar patterns. The big difference is reducing the volume of the patient's breast.
So some things to take away. Sometimes breast reductions can be covered by insurance for the right patient. We say that because insurance companies will allow us to reduce breast tissue of some women to cover the cost of it. However, I urge all of you to visit our YouTube website or go to YouTube, type in CSPS, go to the website. We have a wonderful video, 47 minutes long, that will describe to you the whole process involved of going through an insurance case to get a breast reduction done, which is a great thing if you qualify. If not, obviously we can do it for cosmetic reasons as well in the office. Breast cancer reconstruction as we move forward. This is pretty amazing. We do some breast cancer reconstruction here at our office. Breast cancer reconstruction is covered by insurance based upon the 1998 Women's Healthcare and Cancer Rights Act. There are many reconstruction paths that are available, and it's tailored to each patient. I bring this patient up to show to all the folks out there who are watching this video, when you look at this picture, what would you say this patient underwent? What procedure did this patient undergo? And I leave you with that thought in place because this is an incredible journey. This woman actually had breast cancer. She underwent a total mastectomy. We took off her entire breast, including the nipple. Everything was removed. She was left initially on with a reconstruction based upon using a tissue expander where we stretched her skin after her initial operation. After the tissue expander was ready to come out, that tissue expander was removed and an implant was placed within her chest. Once that implant was in her chest, she desired more fullness in the upper pole. She then underwent additional fat grafting where we did some liposuction on her tummy, pulled some fat out of here, and then laid that fat around her breasts. And finally, she underwent tattooing of her nipples right in the middle of her breast. And I would tell you that looking at these two pictures, there's no way for anyone to look and say, wow, this patient has cancer. And that is an incredible, incredible thing that we strive for, to try to help women get their lives back despite being dealt an unfortunate card, which is unfortunately pretty common.
Yeah.
So important takeaway, we also offer breast cancer surgery here at CSPS for women who are undergoing mastectomy. And again, an incredible journey. I feel very fortunate that we're able to be a part of something like this that can be pretty devastating for a lot of individuals. Okay, revisionary breast surgery we'll touch upon just really quickly and then we're done. I know we're running low on time as always. So we do all sorts of types of revisionary surgery. So if your breasts, what you consider them to be odd, different, funny looking, whatever you want to call them, we're happy to see you, give you our perspective, our evaluation, and potentially try to help make your breasts a little bit better. Dr. Moore, we see a lot of this here and there.
Yeah, we do, and we're thrilled to help people with their changes that they want to make. And this patient right here is a great example. They've got implant malposition too high with some ptosis or drooping of the breast tissue, and here the implants have been repositioned and the tissues have been tightened up to give her a good restoration of her shape and breast.
So with that, we can combine breast surgery with additional procedures like eye surgery, facial surgery, belly surgery, thigh surgery, arm surgery. There's a litany of things that we can combine it with. The important thing, again, is to sit down with your plastic surgeon, have a conversation, talk to them about what you're hoping your journey to be. And again, make that to-do list, right? Make that list.
True.
And write down what are the big things that affect you and try to create a plan that will effectively help you achieve the goals that you desire. So thanks for joining us, and we'll see you back in a few minutes for our facial talk.
All right, thank you.
All right, we're back for the final and fourth segment of our show tonight, and we're running right on time as usual, which we really appreciate all of you hanging in there with us as we continue this amazing journey. So we're going to do a little bit of a presentation here and talking about facial surgery and some of the things that we offer to treat the face. I'm here, Dr. Conrad Soroshik. I'm joined by Dr. John Moore here. In a few minutes here, we're going to have Michelle Bailey and Heather Happy come up and join us. And Heather Happy and Michelle have been given many presentations throughout the day today. They're going to help us kind of talk about some patient cases that can be, provide some insight about multimodal therapy. So, common things that we do here at Cool Springs Plastic Surgery, we do a lot of brow lifts, upper and lower blepharoplasties, right, Dr. Moore? I mean, this is probably very common. Facelifts, we do a lot of rhinoplasties, chin augmentations, facial fat grafting, and otoplasty. Those are some of the common, more common procedures that we see on an everyday basis. And all of these, for the most part, are meant to treat the aging face. And that brings us to this diagram, and it's a very a nice picture to kind of look at a person, a face from the age of 35, 45, 55 roughly. Dr. Moore, let's walk through this. Let's talk about some of these the images here. Sure. What are some of the things that happen to a person over time as they age?
Yeah, over time, your volume is one of the most important things that we take note of. And this is a youthful person. She's got full volume in the face, the cheeks, the temples, the eyebrows, and then as you age, you lose some of that volume. Eyebrows get a little bit shorter, smaller here, and the temples hollow out, and then the cheeks start losing volume in the mid-cheek, and then as you get even older, things happen, you lose bone stock, and so you'll lose bone as well as fat volume in the face, and then when that happens, you have some changes that manifest with the skin, because it's when there's not enough volume in there, the skin starts getting relaxed, and then you have deepening of the cheek area here, the nasolabial fold here, not very deep. Gets deeper in this area here. You start having jowl formation when the tissues drop down toward the center. And then you get more and more hollowing here. In the eyelids, the same thing happens. And then in this central picture here, you've got significant what we call the cheek trough, and then up in here you can have a tear trough, and the nasolabial fold, marionette lines that happen below the corner of the mouth, and all this happens with aging. And then there's another component that Heather is going to address later, is that the skin loses elasticity, and so you, in addition to the loss of volume, you lose the elasticity or the stretchy component of skin that allows it to support some of the soft tissues.
So a couple of quick questions. Number one, jowls. When you mentioned the word jowls, what area on the body are you referring to? What is a jowl, Dr. Moore? Talk to us about that.
The lower cheek down here in the area that goes along the jawline, and you have a bulge of fat and skin at the jawline that kind of goes up into the area that's down here below and lateral to the mouth.
And then the nasolabial fold, you mentioned that. It's a big term. What does that mean? Where is that area exactly?
Well, lips, labial, and the nasal here, and so we talk about this right here. It's that crease that is between the cheek and the lip.
Perfect. And then one other thing, let's talk about the eyes. A lot of folks, as we age, all of us tend to display our age a lot of times with our eyes, unfortunately. So some of the changes that you see there, talk to us about that and what happens in that transformation.
So in this patient, you can see nice high arched brow and a relatively smooth forehead up here. And then if she gets a little bit older, you start seeing these animation lines, creases in the forehead. This area is called the glabella, in between the eyes and the eyebrows. And then out here laterally, the crow's feet area. And as we get older, the elasticity gets poorer. And so these start dropping down and flattening out. And then this older patient, much flatter and much lower and much deeper creases.
So you get a little bit of hooding, right? The brows come down a little bit. You get a little bit of hooding over those eyelids. And then what about that lower lid? That infamous lower lid, which sometimes can be a very unfortunate thing to happen to folks. And folks come and see us and they say, oh my gosh, listen, everybody at work tells me that I look tired all the time. I feel great, but they keep telling me I'm tired because my eyes look like this. How do you describe that? What happens there?
You lose elasticity not only at the skin level, but there's a structure called the orbital septum. It's a piece of connective tissue that holds back fat that normally lives behind around the eye. we'll get back to it. It lives around the eye, and as that weakens, then this fat can bulge. You start seeing laxity where the skin is looser under here, and then there's areas of fixation at the lid-cheek junction, and so that kind of drops over that, and so you get what's called a tear trough, where that fatty tissue kind of drops over that fixed point, and that's going to be right here in the central part.
So that's a lot of changes that happen, again, physically. There's a lot of other stuff that's also transpiring on this patient, especially even looking at the lips, et cetera. I'm gonna get Michelle Bailey to come on up here, as well as Heather Happy. Come on up here, ladies. I want you guys to help shed us a perspective about when you look at a patient, when you have a patient come to your office, and you guys serve patients that are young, middle-aged, older, the full gamut of patients. When you're looking at someone's skin and the aging process, what are some things that you notice that occurs over time, and maybe some things that we can potentially do to fix some of those areas?
Exactly what you guys said earlier about the breakdown of bone and volume loss and elasticity. So you find out, normally I find out from the patient what their biggest concern is and go from there. If you get somebody that a lot of times they'll come in when they get at this age right here with the way the folds are, and they'll go, I just don't like these.
Yep.
Well, there's several components to that. We look at, how much volume do they have in their cheeks, because that can lift putting volume in. Or we can inject right in there on some patients. And, we have loss here. So we can restore some of that with fillers. Right in here, what we've got, I call that the mean look. When people are looking tired and kind of mad there, you can do Botox in through here. You can also do it around the crow's feet to lift the brow this way and make them look brighter. So at this stage, there's a lot you can do that involves procedures that are non-surgical.
Right, so things that don't involve necessarily making a big cut, things that can be managed in, out, on an in-out basis. Let's talk about around the mouth area, Michelle. Let's talk about what changes occur around the mouth and some things that might be available to help treat some of those areas, for instance, like volume loss.
Okay, volume loss is something I see typically, and it starts around the age of 45, just like the slide shows here. And what happens is we lose volume and we lose elasticity there. And when you talk about doing surgery and doing facelifts, that's great, but a lot of times even a good facelift won't pull that skin taut.
No.
So that's where fillers come in, and you can go in and do fillers. You can also do some procedures, which I'm sure Heather will address. And Heather, what would you do for skin firmness there?
So the main thing I look for whenever I first meet a patient is the tone of their skin, as far as is there hyperpigmentation, is there excess brown, is there excess red in the skin. I look at the texture of their skin, because texture could be rough skin that's not smooth and soft, but there can also be lines and wrinkles where my lines and wrinkles that I treat are more of the little fine crepey lines and wrinkles rather than the deeper folds or something that would have a lot of laxity like this area down here. So I evaluate more skin health. The goal for everything that we do aesthetic-wise is to stimulate collagen production, increase that collagen, which is going to cause more of the contouring of the skin, and then brightening the skin, evening out the skin tone. So that's what we work on, and then that works complementary with the injectables and also surgery too.
So staying on topic with the perioral area. So for those of you at home, the word perioral essentially means the area around the mouth itself. Focusing on just that area. Michelle, you're absolutely right in saying that with a facelift, when you pull the tissue up on the face, this tissue around here really doesn't move, Dr. Moore, right?
No, it doesn't move, and if you were to try to correct the laxity in that area, you get the, quote, windblown look, where you're so tight that you don't look natural.
And that's where fillers come in, because we can help a little bit with the elasticity with lasers and microneedling and things like that, but you can go in, and this is one of my favorite areas to do with fillers. Like, I could do this all day long in here, just getting those fine lines and the deeper lines through there. Like, I am a lower face person all the way. I love it. And this is, this is a slice of heaven for me right here.
So it's interesting in that, surgically, we think that, man, surgery is the last stop and it'll just fix everything. And when I get to that point, I'm going to have surgery. But surgery, in essence, can't fix everything. There are certain aspects where we, as surgeons, depend on our staff to help us, right? We are all treating the same thing, the same place, the same face. We all work together to try to create kind of a homogeneous zone. So for the lower face that you were describing here, the perioral, Michelle, you were mentioning, okay, we can put a little bit of volume, put some filler in there. I know Dr. Moore has talked about how, putting fat grafting and doing fat grafting to the face can be helpful. Yeah. Heather, what about doing some lasers, some peels around that area to help with the fine lines?
So for the most minimal downtime would be microneedling. So microneedling is fantastic to stimulate collagen. Very little downtime. We saw it demonstrated earlier. Microneedling is great over the entire face, but especially perioral. I like to do BBL to stimulate collagen and help with the texture, and then halo, of course, and then you guys do the intraoperative CO2s and TRLs that can help as well. So microneedling, BBL, and halo from the aesthetic standpoint.
Okay. Dr. Moore, what do you think?
The volume replacement, I think, around the mouth is pretty critical, and it can be done either with fillers or fat. I like to do fat grafting in the operating room, and when we talk about the nasolabial fold, I can put volume in the cheek, and that really helps that. I put a little bit in there as well as the marionette area. And then sometimes in the tear trough, I like to use fat there as well. So it's
a multimodality therapy. Yeah. We talked about the perioral area. Let's talk about the periocular area. That area is very complicated. And for us, a lot of times during a facelift, we don't really even touch that area very much unless there's a specific need. So that's a lower blepharoplasty, upper blepharoplasty. But let's say a patient is not ready for that stage yet. What are some ways that we can treat the under eye area, for instance, non-surgically, that can help somebody stave off, for instance, a lower bleph or an upper bleph before they need the surgery?
I think Botox is a really good way of getting everything to lift and do a temporary lifting. And I do stress temporary because it only lasts about 3 to 4 months, which is great, but it's not permanent. So that's one thing we can do in that area. Another thing we can do, and depending if they're volume depleted through here, sometimes we can go in with fillers, and that is really patient dependent. I tell everybody, not everyone is a candidate for that. So, but that can help in that area. But as far as the lines go, Botox is what I would do in this area and around the eyes for the lift.
Heather, talk to us about what you think you can do.
So microneedling again for this just complete around the eye. I do microneedling a lot for the under eye area. BBL is excellent. We have to avoid the eyebrows because it can reduce hair growth. So that's a little bit more challenging for more of the upper hooded eye. Halo is great for that. And I really like all therapy because that's going to stimulate collagen production, and I can go across the entire brow and lift up a little bit of this hooded eye, do this kind of pie-shaped part of the crow's feet, and then like an inverted triangle to get this little bit of tightening under here. Whenever I do those treatments, usually all therapy is about once a year. Microneedling, several sessions, BBL Halo, several sessions, but those are the aesthetic options that I do.
Gotcha. So, a lot of different things to consider, a lot of different things for folks to consider at home when they're looking at their own face and they're analyzing the results and the look of their own, what we call aging face, because all of us have one. We're all aging. There's no way to stop the clock yet that we know of. So we're going to move forward one here. Dr. Moore, did you want to say add something?
Add a little bit. When we initially meet patients, a lot of times they've been cared for a very long time by the estheticians or nurses. Michelle has followed patients for 20 years, and then Heather has been a long-time healthcare provider and also followed people for as long as up to 8 years. So, and what they'll do is help with their skin and manage these things that can be done non-surgically. They'll get to a point to where the patient needs more help, and then that's where we come in with the things that we can do. And I was going to ask you, on eyes, we hear a lot about eye creams and things like that. In skincare, there's Retin-A. You may have talked about a lot of this earlier in the day, but quick comment about topicals and creams that you guys use before, and then we enlist you to help take care of them after we do surgery to maintain their result.
So the top ingredients that are necessary in anybody's skincare routine: daily sunscreen. It just has to be worn every single day. That's going to protect the skin from photo damage. The UV rays that we have will probably cause about 85 to 90% of our aging. And most of us have been in the sun for decades without sunscreen. So that's the number one thing, having sunscreen on. Other popular ingredients that will help stimulate collagen and help the texture of the skin, which is what I really like to work on. Vitamin C is necessary, retinols or tretinoins, retin-A's, those are incredibly important as well. Hyaluronic acid, hydroxy acids like glycolic, something to work on the texture of the skin. Eye creams, I think they're controversial. I don't put a lot of weight in eye creams because I use my normal skincare products under my eyes. People love eye creams. If they get a good result, that's totally fine. But the other ingredients are the most important for the skin.
Great, thank you.
That's perfect. Well, thank you guys so much for that that part of that conversation. So the next thing we're going to talk about is just a little bit about facelifts. But rather than spending some time, Dr. Moore, real quick, walk us through a basic facelift incision for folks at home to understand what are the mechanics involved and how that is done. If you want to kind of hop over there, Michelle, maybe come on over to this side. Switch spots with Dr. Moore.
Okay, so a facelift, you want to make it to where the people looking at you cannot tell that you've had a facelift. And so the way we want to do that is make the scars obscure. And so we hide them in places where their natural contours or are covered. So underneath the hairline, and I like to use an incision that goes under the hairline here. I don't put one into the hairline because I don't want to take this hair that oftentimes will move posterior as you age anyway. So we're going to protect the hairline, hair position, and then we follow along in the natural contour in front of the ear where the cartilage joins the cheek. And then another line, I prefer to go in front of this cartilage because the cheek skin is different than the skin that's right in front of your ear, and it's very smooth and doesn't have many structures in it. Whereas if you put cheek skin up there, there's no transition zone. So and that scar gets very obscure because it's in a natural depression there. And then we do the same thing at the lobule, and then we go into the hidden area behind the ear and then go real high so that if you pull your hair back, it's above that place where you can see it. And then dive into the hairline back here posteriorly and line that hairline up so there's no change in the hairline posteriorly. And by doing that, and with good surgical technique, you can make those scars essentially disappear.
And I agree, and it's amazing to see some of these folks, you know, a couple weeks, couple months out of surgery where those scars start to fade. And it's pretty incredible that the change that they undergo. So what we thought we'd do next, we would kind of look at some patients and provide some analysis, a multi-specialty analysis of looking at a face, an aging face, and then talk about kind of some of the things that each subdiscipline would do. So we're going to start here. So maybe we'll start with Dr. Moore. Dr. Moore, give us your glimpse of what, when you look at this woman's face, what are some things that you would consider doing to try to help restore some of her youth?
Okay. A few things that are going on with her. Again, we talked about volume loss, and you can see the crease at the junction of the eyelid to the cheek, and it's hard to see because of the shadowing, but there is hollowing in the cheeks and loss of a transition zone between the cheek to the higher cheekbone to what we call the submalar area here, and then got this loss of volume in the face that allows this to drop down, and you get early jowl formation and this pre-jowl hollowing, marionette lines, and then in the neck with loss of elasticity, these muscles called the platysma muscle create these bands that begin to show up. So you've got laxity from loss of elasticity and then volume loss as well as the muscle bands showing. So those are things that I note, and then the operations that we would do, which I would suggest, some volume replacement and the facelifting, and then she had some lines around the mouth, and I would address those with laser.
Heather, why don't you comment kind of about some of the skin and some of the things that you notice on her that you could potentially...
So her texture looks incredibly smooth. She doesn't have a lot of excess brown pigment. She does have some redness in her skin. I do see, of course, this laxity on the lower face area. So non-surgically, I would do a series of BBL treatments to stimulate collagen and work on the redness of her skin. I would do some halo treatments. I would also bring that down on the neck area as well because we want to treat this. So BBL, face and neck, halo, face and neck. Potentially, even if she was against surgery or maybe not a candidate for surgery, I would consider lower face and neck therapy to give her some more of that tightening and lift. It's not going to be a surgical result, of course, but some people just can't have surgery. And then I would make sure that she is on a good skincare routine to maintain the texture of her skin and have her on some sort of a retinoid product, retinol, tretinoin, to continue the collagen stimulation.
That's great. And then Michelle, let's talk about volume. Let's talk about some fine lines. What would you do for this patient? What do you think if she came to you to see you?
Definitely has some volume loss. It doesn't show as much here as it does when you turn it to the side. Most people, well, all people should have what they call an OG curve, which is a roundness of their cheek. Doesn't mean it has to be puffy, just a little bit rounder. And she's pretty flat through there. So that tells me that she doesn't have a good amount of volume there. And when we do volume, that kind of helps pick this up just a little bit. Now, I'd restore volume in her cheeks. I would take a look at this initially and go, oh, we could probably do some filler down there and soften that jowling. But this would stop me dead in my tracks right here because...
What are you pointing at there, Michelle? What is that?
Loose skin.
Loose skin.
Lots of loose skin, and you can see it from the side too. Dr. Moore talked about platysmal bands. You can inject the platysmal bands with Botox. The problem is it's going to make her skin more lax there. So in looking at that, I would probably refer her for a lower facelift based on what I'm seeing here with some fat grafting. Now, if she was not a candidate or did not want to do that, I would volumize her in the cheeks, and I would offer to maybe transition this a little bit with some fillers for her to soften it. The other thing I'd do, I'd fix the asymmetry of her brow with Botox. This is higher than that, and I would fix that while I was in there.
So I think all of you had an incredible input into this patient's case. So this patient, here's a before and after, left side the before, the right side the after. She did undergo a facelift with a neck lift. She underwent a lower blepharoplasty. She also underwent some fat grafting to her lower lid cheek junctions, to her cheek, pre-jowl area. She had a perioral laser, Botox to her crow's feet, BBL, and follows a skincare regimen by Zio. And it's a pretty amazing result. She looks fantastic. It looks incredible. And, really, the point of what we were trying to showcase and to show everybody here today is that every one of our patients here at our office, we don't look at them as just one individual comes in, has something done, and they're out. We're trying to help you achieve your goals. And if your goals are to try to maintain a more youthful appearance, try to regain some texture, a better quality of your skin, whether it's to regain volume in your face, whether it's to regain a better shape of your body, whether it's to, create a better lifestyle or more active lifestyle for yourself, we're going to try to help you do what you can to achieve those goals. We look at the whole picture, just like we did here. We look at the whole picture. We have a lot of staff that are involved. 25 years of experience. I mean, you can't find a better place than that. I think this probably is the oldest practice in all of Nashville, which is phenomenal. But again, a lot of trust, a lot of empathy, a lot of patients who come through our practice, who undergo treatment, and as you see on the comment section, provide amazing comments about how wonderful of an experience that they've had. And we're grateful for every one of those opportunities. I'm grateful to be here working with all of you, as I'm sure all of you feel about working with this team here. And not only the team of doctors and nurse providers, but our support staff has been incredible. The whole journey, the whole experience is an awesome one. So with that, we kind of want to close everything down and move on to the final segment, which I'm sure most of you are tuned into. Before we kind of get there, I wanted to step off stage, but I'm going to ask Mrs. Moore, so I'm Dr. Moore's wife, Ms. Sherry Moore, to come on up on here. Again, 25 years of amazing hard work to get our office to where we are today. I feel like, all of us want to honor the both of you for everything that you've done for us and for this practice and for every patient that you've treated along the way, which I'm sure is thousands of patients. So thank you to all of you from all of us for an amazing experience and an amazing, incredible practice, and for being able to be here today due to your hard work. Mrs. Moore, one opportunity to say something. You can speak into Dr. Moore's microphone. Any thoughts? Here.
Wow.
You got a microphone. 25 years to get to here.
25 years I have listened to my husband say he loves his job, he loves his team, he loves his patients. He's grateful and honored to serve. And I feel exactly the same way. Very grateful.
And Dr. Moore, do you want to say anything to your patients out there? We've got thousands of them, 25 years.
I will say thank you, and it has been a joy to take care of you, and I'm not quitting.
Very good. So I'm going to step off stage. We're going to bring Angel back up here, and you guys are all going to partake. And we're going to do some final drawings for some amazing and exciting prizes.
So before we do our drawings, I have just a few fun facts. We did 552 total surgery cases in the surgery center last year, 92 breast augmentations, and 181 liposuction cases, and 60 facelifts. Wow. We are the place for you to go, you to come see us, to get some of these awesome things done. I love standing here in between you awesome people. But the best part of the show, not really, but all of that other stuff was the best. The funnest part is the giveaways. So I'm gonna give everyone a sack, and your sack says what you are drawing for. I'll give some of you 2 sacks. And I'll do one. Okay, so Dr. Moore got 2. Yeah. So what we're gonna do is we're gonna go in and shake them up. These are all the things that you've entered all along the way, all you awesome viewers. We're gonna all pull out a name, and we're gonna say a first name and a last initial. So I'm gonna give away first a treatment of sclerotherapy. Remember, Amanda did a great job talking about sclerotherapy. So we're giving away one treatment of sclerotherapy to MK H. So the first name is MK and the last initial is H. Heather, what are you giving away over there?
2 syringes of filler. Oh, sorry. 2 syringes of filler.
2 syringes of filler.
What's a username? Yeah, it's fine. Victoria D.
Victoria D. We'll be contacting you. 2 syringes of filler.
That's exciting.
Michelle, what are you giving away?
I am giving away Botox for a year.
Botox for a year. That's huge. It's huge.
And I know who's going to be doing this Botox. Me.
Because you know who that is?
I know who this is, and I'm so happy for her.
Yay.
Katie T.
Katie T. Yay, Katie T. Yep. Let's see what all we have here. Halo BBL treatment. Hydrofacial.
No, this one's better. I got to
okay.
For just a minute. Okay. This hydrofacial and skincare regimen, and I drew the name of Heather D.
Heather D. We're going to... Yeah, keep that. We're going to get in touch with you, Heather D. I'll take that sack for you.
All right.
And then what about yours, Mrs. Moore? What are you giving away?
I am giving away, happily, a Halo and BBL treatment.
So earlier we gave away just a BBL. This one's the combo, Halo BBL. Who won that?
Ricky H.
Ricky H. And the last thing to give away, Dr. Moore, what is that?
I have a $1,000 gift card. That's pretty exciting to me.
That can be used for so much here at the practice. Who won that big one?
Alexa K.
Alexa K. So we're going to get a hold of you, Alexa K. I'm going to talk with you about it. So to close out our segment, remember, you still have one more day to buy packages to get 20% off of your skincare, to talk about that Botox special with one of our phone people. There's many options for you. You can click on the link to shop. The rest of the night, you can shop with us. That would be awesome. And then tomorrow, you can call in if you have any questions. We will be here in the office. Please do your deed. Do some shopping. But if you have any questions, you call the office tomorrow, 615-771-7718. Your job is to shop. Our job is to work. So we will do that for you. Anything else?
Angela, you're fantastic.
Great.
Thank you.
Well, thanks. I work in a great place. So good night, everyone. Have a great night. Great job, everyone. Thank you.